occasion of International Women's Day, we gather here to expand knowledge, recognize efforts, and forge collaborations, all in the pursuit of our goal to improve the mental health ecosystem. To bring the conversation on mental health to the forefront, especially for the marginalized sections, we have with us an extensive lineup of speakers coming from diverse spaces to share their insights and drive further discourse. We look forward to an enriching day full of meaningful discussions and exchange of ideas. We are grateful to all our partners who helped make this event possible. Our presenting partner, Vikas Lifecare Limited, TV partner, Bharat Express, radio partner, Radio City, print partner, Nav Bharat Times, digital partner, Women's Web, YouTube partner, MyUpchar, magazine partner, Psychologues, global outreach partner, Twitter, Safety, PR partner, Media Mantra, gifting partner, Winnie Gifts, startup media partner, Startup Story, and our organizational support partners, Delhi Psychiatric Society, Schizophrenia Awareness Association, Protsahan India, Menstrupedia, Swayam Foundation, Nirmal Initiative, Sangati, and Herit Heart. Now, I would request Bharat Dialogue's co-founder, Ms. Pooja Priyamvada, to come on the stage and deliver the formal welcome address.
Thank you, Kavya. It is a wonderful feeling seeing all of you here on a festival day and International Women's Day. My hall is full of a lot of women, so I'm very glad about that. So I once again welcome you all on behalf of Bharat Dialogues and all of us here wearing these flowers are Bharat Dialogues. We are all students, teachers, largely educators, and all who feel passionately about mental health and women's rights. Before I begin the formal whatever welcome or setting context, I must tell you that I stand here not as a co-founder, but as a woman, as a survivor, as a caregiver, as an ally, as someone who has been on both the sides of all the divides that are possible in the way of women's rights or mental health. So I am myself an embodiment or personification of all the intersections that you can think of when you think women or you think mental health. The irony of mental health is that as a phrase, हम आज भी उसको बहुत तुच्छ नजर से दिखते हैं. वो हमारे घर में नहीं हो सकता. एक पॉपुलर मीडिया में कहा जाता है कि शहीद सबको चाहिए पर पड़ोसी के घर से. तो उसी तरह हमें लगता है कि मेंटल हेल्थ हमारे घर की बात नहीं है. बाहर अखबार में ठीक है, कहीं बुलाएंगे तो बोल देंगे, लिख देंगे, लेकिन हमारा कंसर्न नहीं है. When we were ideating for this event and the question came, who are the stakeholders? I said that's not even required to be discussed. Everybody is a stakeholder. Every human being is a stakeholder in mental health. And I would believe that everyone is a stakeholder in women's rights, whether they identify as women or not. Because everybody, whether they identify as men or non-binary, they have stakes with women in their lives, right? So how is women's rights not their concern? So yeah, this is what I begin with. Sam dosha, sam ganishcha, sam dhatu malkriya, prasanna ta mindriya mana swastha iti abhidhiyate. ये सुश्रुत संहिता से है, and that's the definition of a healthy woman from our ancient texts. That's the definition, and that translates to this roughly. So your all bodily humors are in balance, your appetite is good, all tissues of the body and natural urges are functioning properly, and body, mind, and spirit are jubilant, blissful picture of health. That's not true about me. How many women would relate to that in this hall? Wonderful. But I think that is a minority. And that's why we are here to discuss. Why don't we fit into that? I have not had sleep, appetite, for many years now, as a single parent, as a woman who works, as a woman who commutes, and of course, the stressors of, doing what we do every day. Next slide, please. This, can anybody guess where this picture is from? Not this hall, but another similar hall that I went to for a similar event on cancer awareness. Look around, there are empty chairs. If this was a film award or a pop singer coming, there will be people fighting outside to enter the hall. I delivered a lecture to that hall with 3 organizers because I went all the way 2 hours across Delhi to be there. And the irony is that for the entire day, they could only serve 1 cup of tea because that's all the finances they had for a cancer awareness campaign. And that's the truth of today's event as well. All the partners that you see have been gracious enough and they have come with us in spirit and strength. But nobody, trust me, we reached all brands. They told me a mental health part drop kar do. सिर्फ women कर लो तो कॉस्मेटिक वाला, फैशन वाला, सैलों वाला सब आएगा स्पॉन्सर, लेकिन मेंटल हेल्थ रहेगा तो हम नहीं आएंगे. That's the truth. Click, please. So why women's mental health? This is why. Because हम इस दुनिया का सबसे बड़ा majority minority हैं. हम सबसे बड़ा ग्रुप हैं that way, लेकिन हम वो माइनॉरिटी हैं जिसके राइट्स की किसी को नहीं पड़ी है. हमें महानता का मेडल दे दिया जाता है और उसके बाद इट्स अप टू यू व्हाट डू यू डू विद इट. नेक्स्ट स्लाइड प्लीज. ओके, आई एम फिगरिंग दिस आउट. दिस, मुझे भारत की बेटी फ्रेज से बहुत दिक्कत है. दैट इज टेकिंग आवर एजेंसी अवे. मैं किसी की बेटी, बीवी, माँ, बहन के अलावा भी कुछ हूं. क्योंकि वो आइडेंटिटी ही असर्ट नहीं होती, तो फिर मेरी मेंटल हेल्थ की या मेरी सेक्सुअल वेलनेस की या मेरे रिप्रोडक्टिव राइट्स की बात होगी क्यों? क्योंकि मैं तो बेटी हूं. किसी की बेटी, किसी की माँ, किसी की बहन, ये वाला ह्यूमन बीइंग वाला पार्ट इज विड्रॉन फ्रॉम आवर आइडेंटिटीज. And because of this constant erasure of our identities from the public spaces and the public discourses like this one, we sit in empty halls talking about women and their challenges in mental health. This is a very interesting book from my collection of books. I read from the Sushrut Samhita earlier. वो मेरे कल्चर का वो पार्ट है that I'm proud of. लेकिन ये भी मेरे कल्चर का पार्ट है. पूरी किताब लिखी गई है जिसमें महिलाओं पर अभद्र कहावतें हैं और वो इसी कल्चर से ली गई हैं. अभी आप चैप्टर्स के नाम ही अगर पढ़ पाएंगे क्लियरली, अधिकार विहीन कठपुतली परंतु नाम जोरू. बाकी पढ़ना नहीं चाहती हूं मैं, बट अगर आप सब पढ़ लेंगे तो आपको लगेगा ये क्या है. और उस हर चैप्टर में करीब 200 कहावतें हैं इसी कल्चर से. तो नारी की महानता इज वन पार्ट, but this is the other part of what we glorify every day. These then, the policy. The government is not coming from Mars. People making policies, whether they identify as men or women or non-binary, are not coming from another planet. वो इसी सोसाइटी से आते हैं, वो उसी कल्चर से आते हैं, वैसी ही गालियां और कहावतें सुन के आते हैं जहां औरतों का दर्जा दोयम है. इसलिए हमारी पॉलिसी और प्रैक्टिसेस में सिर्फ 0.06% हमारे समृद्ध भारत का बजट खर्च होता है ऑन मेंटल हेल्थ. और उसमें से सोचिए विमेन्स मेंटल हेल्थ पे कितना खर्च होता होगा. Those of you who stay today, in the second panel, we have a lawyer who does PILs in the Supreme Court and will tell you कि औरतों के mental asylums में भी मर्दों के mental asylum से खराब हालात हैं. Discrimination वहां तक है. Of course, the number of trained psychiatrists and psychologists is very less. क्योंकि हमारे बच्चे यहाँ हैं साइकोलॉजी के बच्चे. आपको अक्सर बोला जाता है there's no career in psychiatry or psychology in India. ये हैं वो social determinants of health जो globally count किए जाते हैं for mental health. Economic stability, I'll not go into the sub points. Neighborhood and physical environment, education, food, community and social context, healthcare system. In each one of them, women are a margin. I will just take one point, food. In India, today also, girl children are more malnourished than boy children. Trust me, male babies are breastfed more than girl babies. वो वहां से शुरू होता है और वो लास्ट तक जाता है. औरत को, माँ को बचा हुआ खाना खाना है. Nutritional deficiencies. That also affects our mental health. She will be hungry all the time. Happens all the time. So everything is connected. Neighborhood and physical environment. हमारे मेट्रो कितनी सेफ है हम सब जानते हैं. हमारी बसेस कितनी सेफ है हम सब जानते हैं. स्ट्रीट लाइट्स हैं कि नहीं हम सब जानते हैं. कैसे जाएगी वो काम करने? When she is going, is there equal salary? Tanuja is here from Bollywood. कुछ लोगों ने शुरू किया कि फीमेल एक्टर्स के नाम हम पहले डालेंगे कास्ट में. क्या वो फीमेल एक्टर्स को खुद से ज्यादा सैलरी देते हैं क्या फिल्म में? आई डोंट थिंक सो. मेल एक्टर्स को ज्यादा सैलरी मिलती है. The remuneration that they get is more. Then this, of course, this was a study by Business Today because I'm a working woman. You can see globally, pay isn't high enough, lack of learning, I feel burnt out. All of these numbers are much greater in India than they are globally. So the discrimination is much deep-seated and hence our fight is more steep. I do not know, there is so much to say about this. हाइब्रिड वर्क, जब हमने वर्क फ्रॉम होम करना शुरू किया, किसके लिए सबसे अच्छा टाइम था वो? नॉट फॉर women certainly. I had a child doing online classes, I had office work, and there was household work, and I was not keeping well, and the fear that if I get COVID, who will take care of her? And I know all of us went through similar crisis. So yeah, this is something on my cabin. Women don't endure simply because we can. No. औरतें ज्यादा सहनशील और whatever नहीं होती हैं. They are as human as everybody. We endure because we aren't given any other choice. We are forced to be strong. And this, of course, what I was when I was a survivor in 2009. I was on antidepressants. I had postpartum depression. You can see the child very young there, and then 10 years later. So yes, depression is not visible. You'll not see me wearing a armrest or a sling or carrying a support something. But I think it is visible. You can see that is from then because I'm also a fibromyalgia survivor. I used to burn my fingers because I could not gauge the temperature of the, the whatever the utensil was. And this is now. So depression and every other mental health condition or whatever we go through is visible on women. I travel every day in the metro. As a writer, as a translator, I'm an observer. मैं औरतों के पाँव देखती हूँ. मैं उनके पाँव और हाथों और आंखों की थकान देखती हूँ. और वो थकान मैं आज यहाँ लेकर खड़ी हूँ उन सब औरतों के लिए. और इसलिए मेंटल हेल्थ पर, औरतों की मेंटल हेल्थ पर बात होनी चाहिए. Thank you very much. So we will now have the lamp lighting for the formal opening of the function. So I'll first invite my co-founder Vivek. We have with us Dr. Pratima Murthy from NIMHANS, Dr. Ranjana Kumari. Please join us for the lamp lighting. Dr. Neena Bora ma'am, Tanuja, Aparna, everybody who's come from so far. Please join us. Deepika ji, Neena ji, please आइए. Somebody help light the candle and बेटा ये आपको करना है करिए. So yeah, this is very symbolic for me. I usually skip the usuals, but this is that the light come out there. आइए करिए. Thank you so much, everybody. Thank you.
Thank you all of you for inaugurating the event. I now invite our chief guest, Dr. Ranjana Kumari, Director of the Center for Social Research, to the stage to deliver her opening address on Shattering Taboos, Women's Mental Health in India, a Battle for Light. Dr. Ranjana Kumari is a renowned academician and women's rights activist. Dedicated to empowering women, she is currently the director of the CSR as well as the chairperson of Women Power Connect.
So thank you, Pooja, for not only giving me this opportunity to talk to the sisters on International Women's Day, and also, of course, some brothers who are sitting here, but also that you have taken a huge task, a huge challenge, not only in your personal life, but also professionally, to address something which, as Indian society, we want to, like many other things, just rub under the carpet. We don't want to, there's such considered silence. It's not just silence, it's considered silence. People know that there is mental health challenge, including my own family, that I have gone through these issues with members of the family. Every family, at some stage or the other, with some sense of confidence, I can say, distant relations, perhaps someone or the other goes through this mental health condition of someone or the other. But four things we do as a response: we hide it, we don't want to share it, we just remain silent about it, and also that if we want to access some services, if we want to go somewhere and find some support, some help, very rarely, at least if I talk about my own city town where I come from, Varanasi, Banaras, I think it's very, very difficult to access services, because not only that you will be fearing the stigma. Now, that's the main thing about mental health in India, that there's a huge stigma attached to someone who's suffering and someone whose family it is happening. Also some kind of a silent blame that you get, that look, so and so did so and so, that's why this is what is happening to their family. And also it's a kind of, I'm glad that you talked about and you gave us that nice shloka, but do you know that it's also said that it's all purva janma ka paap? Have you heard of that? Purva janma ka paap. So this is something which about mental health. Nobody really strongly stands up and says, like Pooja said this morning, that look, I have gone through it, I have survived, and today I want to campaign, do advocacy, work for it, and she is doing it. And my kudos to her. But this is what it is in India. And when it comes to women, why it happens to women? If we analyze that, then we see that, why it happens to women, because women, the expectations from women, the level of expectation, the level of performance, the level of, silence that you expect from a woman is amazing. I mean, like, it's only our resilience, is only our strength that we are able to go through what family expects from us. Not only that, our parental family, their pressure, it's not just when you get married and you are with in-laws or with husband or someone, even the parents. They don't want to recognize it. They don't want to acknowledge it. They don't want to get you help and support. I think we have senior psychiatrists sitting here, and I have been friends with Nimesh Desai for a long time. And I know that the kind of stories that I have heard of good, so-called good families, educated families, people who come from different forms in different parts of the world, who've experienced seeing people talking about it, heard about it, people who have widely traveled. When you go to their homes, they don't want to acknowledge and if the daughter is going through something, if the son is going through something, little bit different reaction. There is a alarm immediately. People would like to go do something about it. They want to seek the support. When daughter is going through something, and especially in the small city town, as I told you about where I come from, it's fuss. What is all this fuss about? She's faking it. She doesn't want to do something, so she's being lazy. She wants to sleep the whole day. It's just so many stories of this blame to the person who's suffering, stigma and blame. I think the first thing is that we have to fight back and we have to say that, no, this is my mental health condition and I need support. And that needs a lot of awareness and education. A lot of awareness and education. To say that we are not someone who's, women are not or girls are not, and especially girls when they are going through different turns and turbulences through the age cycle, age cycle is also very important when they are going through teen, then they are going through the whole menstrual cycle period, when they are going through postpartum depression after the childbirth, so many other forms of stages of depression that girls go through. That kind of support that is needed will have to be given and will have to be recognized. This is from the part of the society and family that I'm talking about. But let's move on a little bit further. When society and family doesn't really respond properly, then you do need to get other systems and structures to function. That is, you have to have good, robust policy. What has been our mental health policy in this country for a long time? Not only 0.06% budget that we get, but also mental health policy. Tie them with chain, isolate them, send them to these so-called pagal khanas. People laugh at it. People make joke about how they behave. In village, if somebody is suffering and going through, talking to self-talking, laughing, whatever, I mean, if it's bipolar or it is schizophrenia, whatever the kind of situation a young man is or a woman is, everybody makes fun of that. Since I also have the village experience, I can tell you, even to the extent that people beat them up, people throw stones on them. This, and then institutionally, when you institutionalize them, then there is double cruelty. At least family gives you support of food, support of clothes, supports of, going to play for some time, whatever, some support comes, some emotional support comes from the family. Mothers are like, living their life for such children. But when you go to these institutions, how much, you can say how much neglect that you face in these institutions. Thank God that some years back, that we changed that law that you can't inflict this kind of cruelty on someone who's going through mental health situation. So that's something which we have to look at. What are our policies? What are our discussions in our parliament? Does Indian Parliament ever presents a report of status of mental health condition in India? Have you ever heard? Have you ever heard even once in 75 years a good discussion on mental health situation of the country? So if it is not there, that means that we are really not a very aware society about this situation. And women's mental health is further than, when you look at this. So I feel that is very important that four things. First, very important thing is to fight back this stigma. There is no stigma about it. Why should people feel shy about it? Why should it happens to, as I said, through the years in life, it can happen to anybody, and much more so because women are confined. Let me tell you a story, two stories, just very briefly. During recent period, some young girl from Bihar called us and said that they've tied me up they've locked me up in the room, my mother and father, and you know what, I'm not able to even go. There is no window in this room, and I'm not being allowed to go anywhere. So I said, how are you making the phone call? So because and my natural reaction, because we deal with so many cases and so many types of cases, I said that, but if they have locked you up, there is no window, nobody is coming to talk, how are you? She said, do you know what I did? I have just broken the lock of this place. I kept banging. Finally, the door opened, and I have run away. And I am at the end of my wherever she was living, colony, what gully, and I'm standing here. A lot of people are looking at me, and I have just went and I fought with the boy, and some young boy must be playing with the phone or something. And I'm calling you from that phone. I said, where did you get my number from? And this girl smart, she saw it from the list of from National Commission for Women list, where we all share our number. My number is of course very much shared there. So she calls from there. She said, I tried many NGOs and finally I have tried to reach you. So I said that, why first thing you do, go back home, because if people are looking at you, you are alone, you are in this place, just go back home. Go back home, let me talk to your mother. And next day, her mother calls me and says, she is very, very chalu. I said, why? Your own daughter, why are you talking like that about her? She said, no, she makes these stories and she calls people and, make people talk to us and, say wrong things to us or scold us. Why is she doing it? I don't know. Off late, she has started doing it. Off late, she just goes anywhere, takes somebody's phone and calls people and does this. She one day, so I said that, look, do you realize that this is a new situation in her life? Maybe, did you discuss with anyone? Did you go, किसके पास जाएं मैडम, यहाँ कौन है, किसके पास जाएं हम? Then this whole thing came, and of course we finally got some support to the family. But let me tell you, the किसके पास जाएं was an issue in Darbhanga in Bihar, where this girl was calling me from. My parents was kiske paas jaye. So that's my second point. Access to institutions, access to services, access to all kinds of support system that we need to create. And if you look at the number of psychiatrists in the country, then and number of people who they are dealing with, then you can see that what access do we have. Has Government of India invested in developing psychiatrist educational programs across the country in every institution of education, that where people can, people are doing psychology? And in college psychology, the people, if they took psychology as a subject, how everybody used to treat, and especially boys, if they took psychology as a subject. So I think this is whole mental, the whole thing about mental health and women's mental health is a kind of mindset in our country, which needs to be changed and challenged. And we are doing it. We are doing it at every level, wherever we are able to do that. So break the stigma, create education and awareness, work for access. So we need better policies. We need more investment by Government of India in mental health. We need advocacy for that. And I support Pooja, and I support everyone who's trying to do this advocacy to get more resources, more institutions, much more developed programs. It's becoming expensive to access mental health in big cities, quite expensive. So let's normalize this whole system in which people can easily walk into, and also integrate it with normal health services. It should be part of the normal health services. Why should it be a separate thing where you want to go to someone and people say, oh, look, wo to pagal ho rahi hai, ya uska to dimag kharab ho raha. Why should we have this kind of a, separate system for that? Integrated with the larger health system. And I can see Sameer and I can see Kamna ji and all the others here. I think it's important that we have worked with all of you. So in that context, I want to also bring, just yesterday, I think in Amethi, we had that panel. I think it's important to see that how online situation is adding and aggravating what is happening to young people. How online competitiveness, communication deficit, and you feel you are connected with 1,000 people, but you are so single and so alone that you just don't know how to deal with yourself. So I think that's also very important that we look at the online mental health, how we will deal with that, how young people should be trained and educated. So education awareness is extremely important. And also finally that I would like to say that, it's our mind, just like the body can get sick, mind can get sick. And we need to really, really normalize in society how we deal, how we look at, and how we are really dealing with such people. Let's have empathy. You isolate them immediately. Even most educated children, especially young people, are here. I tell you, if somebody is suffering, you need to reach out, to hold hand, talk to such people, spend time with such people. Don't ignore. Don't think that your life is going fine, so let that person suffer, because I see a lot of young people don't really reach out and support the kind of issues that mental health, people who go through mental health challenges, especially women. So do that, reach out, hold hand. And this kind of a conclave, I'm sure Bharat Dialogue will reach out, do advocacy, is doing already a lot of work on it. And I congratulate both of you for really coming up with this whole thing. Thank you very much, and calling such eminent psychiatrists here. I'm sure there'll be a very, very intensive, good dialogue. We'll come up with good recommendation. Let me also join your force if at any stage I can do that. Thank you very much.
Thank you so much, Dr. Kumari, for giving a wonderful start to this event. I request you to please stay on the stage for the felicitation, and I invite Ms. Pooja and Mr. Vivek to felicitate Dr. Kumari.
Thank you so much. I'm sorry, I'll have to leave because I'm going to Patna. So straight to airport from here. And so thank you very much for inviting me. Thank you.
Thank you so much. Now I invite our esteemed chief guest, Dr. Pratima Murthy, to kindly come to the stage and address the audience. Dr. Murthy is the director of NIMHANS. She has extensive experience in the field of mental health and is a well-known leader in addiction psychiatry. She has worked with National Human Rights Commission on quality assurance in mental health care and has also consulted for global agencies like the WHO, ILO, and UNODC.
Good morning, everyone. It's a pleasure to be here today amidst all of you. And I was just listening to the last part of your presentation, as well as Dr. Anjana Kumari's. And I think there's a lot of issues that we need to discuss. But at the first instance, let me congratulate and wish all the women here on International Women's Day. It's an important day, I think, to acknowledge the important role that women play in society as much as anybody else. And perhaps we need to see how, and more relevantly, can women play a role in society. But at the same time, of course, there are also sobering thoughts on the fact that many of us here are possibly privileged to be sitting here. But for every one of us, there are possibly tens of thousands of women who don't have the privileges that we enjoy at various times. It's also very heartening to see that in every possible spectrum of life, there are women. But the fact is that at that point of privilege, there are very, very few, and there ought to be many more. And I think that's what we need to look at. And this year's theme of International Women's Day talks exactly about that, that the more we engage women in different aspects of our functioning in society, society will be better off, countries will be better off, and we need to see how that is possible. Now, when you look at women's mental health, I think we need to understand that it's inevitably couched in a whole lot of other situations. Socioeconomic status is one of the very, very important situations in which women's mental health is located. So, for example, poverty and mental health have very, very close connections. I remember a couple of decades ago, when I was talking about decision making in families. It is a sad truth that very often when women do not even have the right to make decisions about what to buy, what to cook, it's very, very difficult then to expect that they will be able to move through other stages of empowerment automatically. So, socioeconomic status and the kind of status we attribute to women very often determines how empowered or how influential they're going to be in society. Lack of social protection is again something that is a huge problem in our country. There are models in the West where there is social protection offered outside of families. But in our country, most of the protection occurs within the family structure, and therefore looking at social protection becomes very critical. Then we talk about maternity benefits and food security. It is, in fact, COVID is possibly one of the eye-openers where a lot of gender inequities actually came. And the need, for example, to look at gender-specific statistics and not as statistics as a whole. Generally, when statistics are offered, they're done for women only in the context of maternal and reproductive health. But there is far more to women than just maternal and reproductive health. So you need to look at gender, whether it's in terms of the percentage of women in active employment, the percentage of women who leave active employment at various stages because they have so many other responsibilities and roles to play. And how do you retain women, therefore, in every level? As you go up the pyramid, you will see a gradual attrition of women. Of course, there are exceptions. I mean, I can talk about my institution where all the 3 deans are women in very, very high leadership positions. But these, of course, are, while they're very, very welcome, one must recall that they are rather exceptions than the rule everywhere. Now, let's talk about a small thing like school enrollment. I mean, one of the things that, that was noticed is that the dropout from schools is more among young girls than among boys. One of the very sad things that we noticed during COVID, where we were looking at, digital expansion, we were trying to make classrooms available to kids where they were in their homes. Sadly, when it comes to only one mobile phone or only one computer being available in a house, the priority that is given to the girl child becomes then lesser. And those are the kind of things that really talk about this kind of inequity in society. And we also know, especially, of course, even before COVID, a lot of these was there in terms of having to balance responsibility of homework, work at home, as well as the workplace. There is certainly a much greater pressure on women to do that. Increased violence against women and women's safety has again become a problem. It was always a problem. It has got more amplified globally. When I talk about all these problems, I don't think they're confined to any one part of the world. These are global problems that people are facing. And of course, the fact that women's inclusion, particularly in the STEM areas, science, technology, engineering, etc., is far less desirable than it ought to be. So when we look at the impact of COVID particularly, that it has been established that there were steeper losses of jobs for women as compared to men. There was also, various other things, like, for example, access to services was far more difficult and challenging for women. We must understand that a lot of mental distress is very often couched in gender role and gender expectancies, causing a lot of distress. In fact, I remember when I started my career, a lot of women used to come seeking help for a lot of somatic problems, body aches, everywhere, because there was no language to verbalize psychological distress adequately for women. I think that has changed somewhat. It's very nice to see that it's very encouraging to see that people are talking about psychological distress. But it's also very important not to equate psychological distress with mental illness. And I think all of us must understand that at different times in life, we can have much more psychological distress, and we might be able to function quite well at other times. Of course, we also know that there are biological differences in the manifestation of mental disorders in men and women, whether it's in terms of severe mental illnesses like schizophrenia, bipolar mood disorders, or indeed common mental diseases like anxiety and depression. While we understand that, we must also understand that the way men and women perhaps deal or, our kind of fashion in society occurs to two kinds of reasons. One might be that men are more externalizing in the way they kind of react. They are more outward focused, and women, when they are emotionally disturbed, are more inward focused or more internalizing, and that's one of the reasons. In addition to that, of course, the social expectancies that Dr. Rajani Kumari spoke about is also something that combines to produce the end result of psychological distress. The second and more very distressing fact is that when you look at suicides across the world, while in the rest of the world, suicides are more prevalent among men, or the persons who complete suicide are more men than women, we have a change ratio in our country. And particularly young women are perhaps, the risk is most prevalent in young women. And that's where we need to understand psychological distress from a socio-cultural perspective, because if we don't do that, I think we'll be not able to really address the social vulnerabilities that women face. Women also have a higher risk of taking care. It's not just children that they take care of. Very often, as the demographic is changing and we are increasing life expectancy and there are more older people, the responsibility of caring for the elderly is also disproportionately more on women. And therefore, in talking about the issues that we need to talk about, I just thought I'd just focus a little bit in terms of the science and technology part of it. And this is important because, many of you here are in higher education possibly, and therefore we need to understand that, again, in terms of participation of women in STEM, and I'm not quoting only data from India, this is global data, and that's quite surprising. Only 1 in 3 researchers is a woman. A mere 17% in international patents are taken by women, 83% are still by men. Women are 2 times less likely to know how to write a computer program as compared to men. Women hold less than 25% of science, engineering, and other jobs globally. Why am I saying this? Because it is in positions of higher education, in positions of governance, in positions of policy that you need to see far more women. So therefore, when we look at joint action, I think we need to consider that. But before I go to the joint action, I'll just mention a few things in the context of what was presented earlier by Dr. Ranjana Kumari. There is a lot that has occurred in the area of mental health. We do have a national mental health policy. We do have a human rights-based mental health care act. There have been more innovations using innovations like the Telemanas, which is offering, help just a call away to people. Mental health has been decentralized, and some states are doing better than others. But it's also a reality that, for example, she mentioned the National Commission for Women's Study. We found that when we interviewed some of the women in institutions, they felt far safer in institutions rather than back in the community. And that's a very sober fact that we need to accept, that we need to change the attitudes to mental illness in our society amongst ourselves first. So the first thing is the stigma associated with mental disorders and a greater acceptance of talking about it. The second thing is to understand, as I mentioned earlier, and I'm reiterating that fact, that all of us can go through psychological distress at telling points in our lives. We need help. We need informal help. We need formal help whenever the problem goes out of hand. As far as mental disorders are concerned, it is important not to delay help seeking. There is an attempt to increase the number of professionals in this country, but the more you kind of work at it, the more the treatment gap is. As was mentioned, there is an attempt to train all healthcare providers in at least basic communication with people, just asking, how are you coping? How are you doing in any health consultation? So integrating mental health with all kinds of physical health interventions is very critical. But at the same time, addressing attitudes and reducing stigma is also very important. Increasing accessibility to help is important. Rehabilitation and reintegration is equally important. So again, I just want to compliment you on the fact, and I think that's the message that we need to talk about, that there is hope and optimism, that just as physical illnesses can be, controlled, mitigated, treated, and recovery is possible, it is also possible to recover and get on despite having challenges in the area of mental health. And therefore, but we must also address the socio-cultural context in which distress occurs. I'm very carefully using my words, psychological distress vis-a-vis mental disorder. In terms of that, we must invest more in women. Women must be much more represented in Asia of influence. We have to look at poverty. I mean, I think it's very simplistic to believe that, when as long as your mental attitude is right, everything will go okay. I think it's important to address that. We have to respond to gender-sensitive planning in whatever we do. We also need to look at women as change makers in society. And there, it's very, very important that women come together as a united group so that we can actually talk about. And I mean, I think one must not go off the way of, men's health and women's health, completely in isolation. But it's important to understand that there are elements of these which will finally influence what we do. We talked about some of the misconceptions about mental health, believing that you must be in control of your mental health 100% of the time. That's impossible. Okay, just like in physical health, there can be times when this is strained. We need to look at holistic mental health. Also, finally, I'd like to end by saying we must not only look at the spectrum of illness, but also the spectrum of wellness, how to take care of ourselves. And when we do that, how to take care of our girl children, how to be equitable in the way we bring up our children. Also, how do you promote mental health and wellness? How do you encourage people to share their distress and get help? These are important challenges in front of us. I believe that as a society, if we respond to all of these concerns, we will certainly not just be a happier society, we'll also be a more productive and empowered society. So I hope and wish I compliment the organizers in conducting this seminar, and I hope and wish the deliberations will look at some of these aspects so that we can be happy society where women share an equal responsibility, not just in decision making, but also in making sure that we take the whole of society with us in the course of the country's development. Thank you very much.
Thank you, ma'am, for sharing the valuable insights. I now request Mrs. Pooja and Mr. Vivek to kindly felicitate our chief guest. Thank you. Now we have our keynote speaker, Dr. Sameer Parekh. I would like to invite him up on the stage for his keynote address on mental health, a universal human right, our women's rights, human rights. An eminent psychiatrist, Dr. Parekh is the chairperson of Fortis National Mental Health Program. He has played a significant role in increasing awareness on mental health across the country and has spoken on the topic at many international and national forums.
I'm not up for too many days as a concept. I just feel that days end up becoming a symbol of what we not do rather than what we do. Because we end up having one day and then we forget the remaining 364 days also exist. So that's what we've done to most strata of our society. Mental health is for sure. um, if it's a universal human right, which it is, and the fact that in this 2024, I was last told we are in. So if we still need to talk about mental health as a universal human right, we should also realize how we have collectively and absolutely failed. Because you really can't be having a civilization for hundreds of years, thousands of years, and then talk about what to do about the mental health rights. It should have been the reverse. You really can't even have a civilization if you don't have mental health on track. And that's where we are. And then we talk about mental health, then we talk about women's rights. We ask the question, do the rights matter? Rights matter. Rights matter of everyone, human beings, living beings. Fact of the matter is that no matter what we say, our words don't meet our actions. I it's just I just feel there's just so much whataboutery about our life that we end up saying just so much. And in the words and the grammar and the full stops and the commas, we actually forget that somewhere action needed to be happening. And because action hasn't happened, we'll just keep on having these intellectually stimulating 15, 20 odd minutes, and then the traffic jams will take care of it. And that's what it is. Mental health needs to be seen as a right. I think at multiple levels, we fail ourselves. I'll start with our own selves. I think mental health professionals probably need to do a lot more than what we've done, right? What we do in our clinical practice needs to be a part of what we do. If we don't realize that there's a whole world outside this clinical practice as well, which needs to be taken care of, it can't be how many patients you saw and what prescriptions you made. I'm sure there needs to be a matrix which is less mathematical than this. I mean, when Rockmurthy was talking about um, distress, if we start actually addressing distress, we'll probably do a better job at disease also. But we just can't keep on waiting for disease to happen and then look at every few days we come up with trends. And abhi to ye haal hai that we come up with newer disorders every other day. All it takes is 3 people talking about it on social media, and then it just becomes something else. 3 days back, I had an interaction with an HR who wanted an engaging, entertaining 60-minute talk on parenting within and an exercise that lasted for 30 minutes, 60 minutes, where a psychiatrist actually spoke for about 25 minutes and did 30 minutes of Q&A. 30 minutes of Q&A in a 50-minute talk, last I know, was engaging. But the feedback wasn't engaging enough. The tonality was not changing. This was not happening. I think we've actually forgotten. This is not Instagram. And life is not 2 minutes. Nowadays, 15 seconds actually. I was told by a digital marketer some weeks back that, your first 2 seconds matter. I'm so glad nobody told me when I started my medical education, your first day matters. I mean, are you kidding me? It was a nightmare. I still don't remember that first day in psychiatry or first day in MBBS, a nightmare. First 2 seconds matters. They don't matter at all, in fact. If they matter, then you've lost what means. You've lost the bus here. And if you want to learn, you learn. If you want to be entertained, go see a film. Assuming they still entertain you for some reason where probably your cognitive processes did not develop well enough that you still want to say the same hash shown to you again and again. That's how it is. We talk about rights. We're just so judgmental. Just look at the campaigns today. It is so embarrassing. Out of the blue, you will have as stereotypical as it gets. You will get today's campaigns, half of them will have a bindi. Half of them will do some Shakti. Half of them will talk about be unapologetic while being highly unapologetic and apologetic both in the same way if it was even possible. It's just unbelievable. I was, as life is now, while coming here, I was going through some social, came across a very embarrassing post on LinkedIn again by a clinician from our fraternity. Impact of, let's say, menopause on mental health. Keep getting judgmental. Keep getting judgmental. If it is depression, it is depression. You'll screen for depression, then you'll connect it with menopause, and then you'll create this whole thing. If you have a menstrual problem, you will have emotional disturbances, you'll have mood issues, you'll have menopause, you'll have this. You keep on breaking the cycle first, keep on adding on things which are totally unrelated, by the way. Or even if they're related because of multiple factors. At least put all the factors in the context. And then what happens is, then you'll keep going through that again and again and again. You'll see, just look at the last 10 years campaigns. You won't find a difference anymore. We are probably saying the same thing again and again, but I now don't even know since how long. Rights matter. So yes, it starts from clinicians like us. We need to understand there is a deficit of experts. I also feel expertization of mental health is not going to work. There aren't enough of us. There will never be enough of us. क्या 300% शॉर्टेज कितना कम हो जाएगा? हमारे लाइफ टाइम में तो नहीं हो. So what is the next? How do you divide your time in the change that you can bring in a community? And then what you do in your clinical practice, of course, and hopefully following evidence-based medicine, if whatever best we can. The next would be healthcare providers. If healthcare providers do not integrate mental health at all levels, healthcare providers are failing us at the next level. You go to any healthcare and you'll get a preventive health checkup done. You have the audacity of calling it a preventive health checkup without having mental health in the context. I dare anyone to define mental health without using the context of mental health. If you can't define health without mental health, how are you doing a preventive health checkup which does not have mental health? Logically नहीं है ना. सबसे पहले तो जहां जहां से प्रिवेंटिव हेल्थ चेकअप करा रहे हैं, इफ योर ऑर्गेनाइजेशन देन एचआर और एनीवेयर एल्स, पहले तो वो कैंसिल कराइए आप, बिकॉज दे आर कॉनिंग यू. That's what it is. Why at both preventive, secondary, and tertiary level, mental health is not integrated? You bring a specialist from tertiary care, pick up a cancer specialist, pick up a neurosurgeon here, and the moment they'll start speaking, they'll tell you the importance of psychology. And then you ask them, do you have a psychologist on board? Oh, that we don't have. I talk. You don't talk, you dream. The patient is under anesthesia when you're performing the surgery. What talk you do then doesn't reach out. And then really, you also know who does the post-op care, which is not honest. My problem is that I was just telling Jitendra that here only that started lately attending lesser and lesser of these conversations. The pretense, social media's fake portrayal of our fake self has made us forgotten. I mean, completely forget who we truly are. It's like we have, probably we might soon have the way things are going. We'll probably have filters for our own mirrors because we don't want to see what's in the mirror. So we'll put on filters on the mirror also. यहाँ थोड़ा blue आ जाएगा, यहाँ से तो green आ जाएगा, वहाँ से थोड़ा फूल आ जाएंगे, यहाँ से थोड़ा पत्तियाँ आ जाएंगी. And then we'll start looking at also like this, like this, like this, like this. Embarrassing. You'd much rather have a non-qualified expert or a pure quack telling you why don't you have an avocado sandwich in the morning. First of all, they taste horrible. Right? I know a lot of you like avocados. They look bad. They taste bad. I'm sorry, it's not bread. I'm a Gujarati. Give me good old strawberry jam with bread. I will have it morning, evening, night. Right? But you will say, okay, fine. You want to hear this. You want to hear कि नहीं जी डिप्रेशन में तो हम यही खाएंगे और आपको कितना ही बोल बोल के बता देंगे यार ये दिस इज एविडेंस बेस्ड ट्रीटमेंट. फिर आप क्या करेंगे? कोई एक सिली सा आर्टिकल, कोई एक मेटा एनालिसिस के नाम पे किसी कोने में लिखा होगा, उसको आप छाप देंगे. That placebos. This is more than a placebo. Then if I have a depression, please take me to one of my colleagues here. Please give me a medication, give me RTMS. I'm fine. Just don't tell me that just start jogging and do some breathing in and out and have some amle ka pani and your depression will go away. I'm sorry, it's not going to happen. You will not ask a physician, blood pressure की दवा कब तक चलेगी? हमारी तो चल रही है. 25 साल पहले बोल रहा था थोड़े दिन खा लो, अभी भी चल रही है. और हमने जो लिख दिया गलती से आपको, फिर आप गूगल के पेज लेके आ जाएंगे. And the beauty, just look at the sheer stupidity of who we've become. Every time I tell a young person, don't take cannabis, and let's say if the person has let's say depression or anxiety, and I'm prescribing a medication, I'm going to be asked, what are the side effects of this? My dear, you're having cannabis. And then you'll tell me medicinal usage of cannabis is very good for health. You don't even have the basic intelligence to understand that this is an orchestrated attempt by a mafia that is ruling the drugs across the world, who've given you more data than anybody else could have given. And they pump that data to you again and again. And today you talk about micro dosaging. Micro stupidity is also stupidity. It doesn't need to be macro to be stupid. Stupid is stupid. So you want to talk about rights, be honest. We have failed you. Healthcare providers have failed you. Media has failed us. We talk about things. I mean, every time I get a call, what is the trend now on? I feel like banging my head on the wall. How do you expect trends to happen just because you have a 24-hour news cycle? It can't be trendy, right? It's not a hashtag which is going to change every hour. This is science. Science takes its own sweet time. 50s is when the first medication came. Now there are more medications. I mean, it's taken us a lot of time to have this change. We failed us because we don't consistently maintain this. And then we have this whole new social that's coming up. We have a social world out there, social media world out there. First, I don't think it's social, right? You can call it digital media for all I care, but just don't use the word social. Social, when I was in school, was a nice word. We just made a mess of it. And it really can't be social if you're going to the washroom with it, right? Or you're sleeping with it, or you're waking up on it, and everything else you're doing. And you really don't need to tell me here, hey, I am with the legend, Dr. Bora. We are together at the same place. I don't need to do that. If I feel it, I feel it. If I don't feel it, I don't feel it. But if I'm showing it, I most definitely don't feel it. Right? It is so good to know that when we were born, parents did not wish me on Facebook. Now it's kind of embarrassing. Just imagine your dad wishing you, Beta, I love you. Stop embarrassing me. Right? And if you don't, then you'll have a problem. That one's great, this one's great. Come on. You want to make a universal right? Let's start with basics. Let's be honest to our own selves. If we are not honest to our own selves, all this is what about it? And it'll all be a trend. It'll be gone. Today we'll celebrate Women's Day. Tomorrow it'll be something else. Day after tomorrow it'll be something else. And the next, and they'll come up with these nice fancy themes. We'll have nice hashtags. They'll last for a few hours. Assuming something doesn't happen right now, 15 minutes something happens in the political circle, all these trends are over, okay? Then you can celebrate all the days you want. It's all going to be taken over by something else. That's because we are so reactive to a here and now that we are not understanding what needs to be consistently done in a longitudinal axis. You want to change, you bring it in a longitudinal axis. You want to make a road, then you have a chisel in your hand. You have to keep doing it and doing it and doing it and doing it and keep banging at it without stopping, without changing, without any change happening until you actually see the road. The road's not going to happen in my lifetime. Now, the question is that the youth that is out there, are you going to do something enough for their lifetime or not? So the question can't be, do rights matter? They matter. The question cannot be, is mental health a universal right? It is. Does it matter enough for us to do something or the other is a question we ask ourselves. So from prevention to community, from clinicians to media, from society to connectedness, from social media to social relationships, beyond the trends and cross sections and here and now moments, the longitudinal axis requires collective, consistent, cohesive, sincere, genuine effort if we want to make mental health a universal right across the board, across the age, across any form of gender or any other form of a bias. That's the only way to look at mental health.
So much, Dr. Parekh. I request you to stay on the stage. I invite Pooja ma'am and Vivek sir to present a token of gratitude to Dr. Parekh.
Thank you so much. Thank you, Dr. Parekh, for bringing in all the food. We will have tea after the first panel. Thank you so much. Kavya?
Thank you so much. Now we will have our first panel discussion, Breaking Barriers, Addressing Women's Mental Health in India. This will be moderated by Ms. Pooja Priyambada, co-founder of Bharat Dialogues. Please welcome our panelists, Ms. Tanuja Chandra, a renowned filmmaker. She has directed and written many hard-hitting and award-winning mainstream films like Zakhma. She is known for directing women-oriented films such as Dushman, Sangharsh, and the more recent docuseries Wedding.com. Dr. Kamna Chibbar, she is a clinical psychologist and a trained cognitive behavior therapist. She is head mental health at the Department of Mental Health and Behavioral Sciences, Fortis Healthcare. Dr. Sujata Satpathy, she is a professor at the Department of Psychiatry, AIMS Delhi. She specializes in areas such as trauma psychology, trauma-focused CBT, and CBT for depression and anxiety. Dr. Pankaj Kumar, he is an eminent psychiatrist with over 20 years of experience in research and teaching. He is the president of Delhi Psychiatric Society and senior consultant psychiatrist at Max Super Speciality Hospital. Ms. Ambika Pandit.
That's it. I'll take it up.
And then we have Ms. Deepika Thakur. She's a transgender rights activist and the National Program Officer for Advocacy and Training at Alliance India. A passionate leader, she works towards advancing gender equality.
Thank you, Kavya. I'll stay at the podium if my speakers don't mind. Ambika unfortunately could not join us today, so this is our panel for today. And the first panel was scheduled to be slightly earlier, but I hope good conversations can happen anytime, right? So this panel is about breaking barriers and addressing women's mental health in India. I will just take it across to all our panelists one by one. What, according to you, is the biggest barrier? So just one barrier that you think is the biggest in the way of addressing women's mental health in India. Maybe Dr. Kamna, we can begin with you.
Thank you, Pooja. I believe that one of the biggest challenges currently, if you're looking at it, is of course accessibility. at this point in time when you're looking at addressing mental health concerns. Like Dr. Parekh was also mentioning, you're looking at more than a 300% shortage of experts. You're not just looking at that, you're looking at a disproportionate distribution of professionals across the country. The further away you go from the main towns and cities, the lesser the number of experts who are available. And while, of course, mental health services are beginning to support access, however, we have a very, very large, long way to go when we are looking at making sure that that is taken care of in a more comprehensive manner.
Yeah, thank you. Tanuja ji.
Please call me Tanuja.
Yeah, Tanuja, please.
I would think that it is not considering it an illness to begin with or an issue to begin with. Even a common cold is given more importance than one's mental health. And you don't water plants when they're dying. You water plants to make them healthy. So this should start right at the start. I mean, I don't see why seeing a therapist when you apparently don't have any problems is not required. You should see a therapist when you seemingly are healthy. Then you will actually find out how unhealthy you are.
Yeah,
So I
true.
think that it's just not given its due importance as a raging issue and a problem that is very much there in all our bodies. And I think that's a tragedy because you find out about it way too late in life. And then you sort of go hiding to see therapists and to find out that you really should have done this a long time ago. So I think it's which I think is just terrible.
Thank you. Dr. Sujata.
Hi, good morning and happy Sivaratri to all of you. Before giving answer to this particular question, I would like to know how many of you know that which one is considered as a Women's Day in India? Anyone? Do we really have a day? Yeah? Yeah? How many of us know? I think 99% of us, we do not know that Sarojini Naidu's birthday, that is 23rd of February, is once upon a day considered or was considered as Women's Day. But we all know that it is 8th March. Right? So the problem itself starts with us. As individuals, how we, consider how we approach mental health, what is our understanding about mental health and how हम कितना उसको जैकेट प्रूफ कर देते हैं, ब्रैकेटेड कर देते हैं. And जब हमारी सोच, हमारे अप्रोच दोनों ही मेंटल हेल्थ के लिए ऐसा है, तो वो ना वर्टिकली जाएगा ना हॉरिजॉन्टली जाएगा, कभी भी हेल्थ के साथ इंटीग्रेशन नहीं होगा. As very correctly and very emphatically highlighted by Dr. Parikh. It starts with us only. जब हम accessibility बोलते हैं, availability बोलते हैं, वो bigger issues है. Right? But it starts with us कि what do we understand about mental health and how we approach mental health at our personal level, at our family level, at a community level, and then the tertiary or government level, whatever it is. But what is our attitude? Whether we are talking about mental health or mental illness or both. So how do we approach it? That the problem starts from there, and that is the first barrier. And I hope all of you, we all are assembled here because we belong to a certain socioeconomic status. Whatever the women who are at the bottom of the society, at the middle level of the society, what is mental health for them? How do they think about it? So the thought itself is very, very important when we talk about mental health and the barrier towards it. Right?
Thank
So
you,
for
ma'am.
me, it is our approach and our thought. That's the biggest barrier.
Dr. Pankaj.
Thank you. Good morning, all of you. And first of all, wishing you a very happy Women's Day. I would like to answer this question just one word that goes like mindset. That is the biggest hurdle. Everything which I believe, good or bad, starts in our mind. The idea is the basic thing which starts up, either positive or negative. If it's not in your mind, it can't be outside. So automatically, whatever has to start or not to start has to be in your mind or not in your mind. So automatically, whatever biggest hurdle is in mindset, till we change that mindset, all other criteria, stigma, accessibility, policies, government policies, how do we look on the mental health, how do you look a female, how do you look transgenders, how do you look other person, a colleague, whatever. It all starts and ends up with the mindset. So we need to change the mindset. That's the root cause of any problem and make it in a positive way and not just talk, just Dr. Parik said, on just one day and just forget things within an hour or so. The mindset has to change. It's a gradual process and it has to change gradually and daily. We have to need to do something about it and so that we reach where we should be doing a good thing for a society and the women overall. Thank you.
Thank you. Deepika.
Yeah, thank you. Good morning. My name is Deepika, and I work for transgender people, transgender sex worker, female sex workers as well. I have worked for. So I think मैं जब सबसे मिली हूँ और मुझे पता है when I met everyone, so most of them suffers with mental health problem. But the thing is, क्या सच में हमको mental health पता है कि mental health होता क्या है? मुझे तो वही नहीं पता, मुझे खुद भी नहीं पता था when I was 27। जब तक 27 साल की उम्र में आई तब तक मुझे भी नहीं पता था। तो पहला वही जानना बहुत इम्पोर्टेंट
Right.
है ना? तो हम सब पॉलिसीज और ये सब चीज़ों की बात करते हैं। वी वांट टू टॉक अबाउट दैट, वी हैव ऑलरेडी क्रिएटेड वन सिस्टम, वी हैव चेकलिस्ट दिस दैट, वी हैव 185 क्वेश्चंस विद इन वन ऑफ द क्वेश्चनर, उसके थ्रू हम जाना चाहते हैं टू अंडरस्टैंड दैट व्हाट इज इट। So if we really want to understand, we have to give this information at the school level when there is education at the age of 13, 14, 15, 16 or at age of 22। तब समझाएंगे तो मेंटल हेल्थ समझ में आएगा ना। अब आप जाके समझा रहे हैं, जब उसको सोशियो कल्चर नॉर्म्स में फिट होने की आदत हो गई है, तब कहाँ जाके समझ में आने वाला है मेंटल हेल्थ? आएगा क्या? आता है क्या? मेरी दादी को तो समझ में नहीं आता है। आई एम सॉरी, मेरे पापा को भी समझ में नहीं आता एट द एज ऑफ 64 व्हाट इज मेंटल हेल्थ, बट ही इज सफरिंग विद मेंटल हेल्थ, माय मदर इज सफरिंग विद मेंटल हेल्थ इश्यूज, बट दे डोंट टॉक अबाउट दैट, और उनको समझ में भी नहीं आएगा। दे डोंट वांट टू गो टू साइकेट्रिस्ट, आई एम सॉरी, दे डोंट वांट टू गो टू साइकेट्रिस्ट। एंड यहाँ बैठे हुए बहुत सारे लोग होंगे, बट वी आर ऑल्सो नॉट गोइंग टू द साइकेट्रिस्ट। हम बहुत सारे स्टेज पे आके बात करते हैं, बहुत सारे ऐसे वर्कशॉप्स में आके बैठेंगे तो लगेगा कि हाँ चलो बात करते हैं इस इशू पे, बट हम खुद भी नहीं जा रहे हैं ये सब करने के लिए। सो मुझे लगता है कि मेरे लिए मेंटल हेल्थ वो है कि सबसे पहले तो हमें हमारे दिमाग को ओपन करना है, सबसे पहले हमें उस चीज को उस एज में जाके सुधारना है, ठीक करना है, ताकि आगे आने वाले भविष्य को ठीक किया जा सके। आज तो कुछ नहीं हो सकता है, आई एम सॉरी, मुझे ऐसा लगता है पर्सनली।
Right. So I think all of you, the essence of it is the lack of awareness, whether it is because of, as Kamna highlighted, the differences in cities, in access, or as Tanuja said, or Dr. Satpathy said, कि awareness नहीं है अपने यहाँ आसपास क्या है। डॉक्टर पंकज ने माइंडसेट की बात की, दीपिका ने बात की कि एक पर्टिकुलर एज तक तो अवेयरनेस ही नहीं है, एजुकेशन नहीं है। वी हैव अ पैनल लेटर ऑन एजुकेशन एंड अवेयरनेस। आई वुड गो बैक टू तनुजा and highlight, because we both here are representing media, what has been the role of media in creating misconceptions about mental health or shattering the taboos around mental health?
I wish it was the latter. Media, I would say films, have completely betrayed the cause. Just has been given no importance. I have been in the storytelling business myself for over 25 years. And it was only in a series that I made last year, that was released last year, in which there was actually one of the characters speaking to a therapist for the first time. So I think that the media is, like Dr. Parekh was saying, caught in this web of like entertain, say the thing that captures people. By the way, you did capture us. So I think that what happens is that it is too quick to assume that people will think, "Arey, ye character ka dimag kharab hai." You know, all the cliches of the world will come into Hindi cinema, and I speak only for Hindi cinema. So we are far behind what we should be doing. Things like this, I mean, I was really, really happy to hear you speak, first of all. It was wonderful to hear you speak. When one starts opening up one's heart, speaking about oneself and what we've gone through, you start to speak about all the things you're not supposed to speak about. You actually speak for others who are also not speaking,
Right.
you know? So I think that it's very important that we start opening up. Hindi cinema, I'm afraid, will be the last to do that. We'll all try our best, the ones that really think it's very important to do it.
Right.
But don't expect it to come from movies.
Right. I'll now take it to Kamna because I also do a lot of intersections myself. So from media, I'm also from the practitioner's side. I'm a counselor, and a lot of psychiatrists, psychologists, friends are here. Uh, do you think we also have some kind of a barrier as practitioners for women or for other marginalized groups? What are the challenges they face when they access practitioners? What do you think are the barriers there?
So I think in general, there is a hesitation to reach out to experts. People experience in their own lives, in their own settings where they're coming from, a lot of times stigma, stereotyping. There is a lot of hesitation and resistance which comes in because you may not necessarily have people who understand things around you or can provide you with the support to say that it is right and okay for you to seek that help. So the barrier may not necessarily be that a therapist or a psychiatrist or psychologist, any expert, is someone who is not going to be able to create that space for you to be able to share your experiences. A lot of the hesitation is coming in from where you are possibly coming from. What is helpful is how is it that we are putting across information about what that experience can be? Why is it important for you to reach out and try and seek that help? How would early intervention really help you? Like Tanuja ji was sharing over here, that media plays a certain role, but also we as consumers of that media play a very, very large role. So while media needs to be responsible, I also need to take ownership to say I'm going to start raising some questions in my own mind to try and understand why certain messages are constructed. Where is that information coming from? What is leading to, what are the biases in it? What could be a value system which is being portrayed in it? So unless I am also willing to raise those questions, whether it is to people around me, whether it is to the media content around me, which is talking about mental health, mental illnesses, help that could be available, unless I also raise those questions, I'm not going to create an environment which is comfortable enough for me to utilize those resources, which
Right.
could be accessible. We are not saying they're adequate resources, but they are nevertheless there.
Right.
And they themselves are also often not adequately utilized by individuals, which
Right.
is something that we need to also try and understand.
Yeah. So from one practitioner
And
to
just
another.
a quick one.
Yes.
That the thing of this hathoda of pace
Yeah.
and capturing is where a lot of the problem lies. It's got to be dealt with patiently, listen carefully, mindfully, and not that capture my attention right away. If you can't do it in 5 minutes, then I'm not interested in knowing what.
Right.
It is going to take a while.
Yeah.
And so will you attending to your own health is going to take a while. And you'll be shocked to discover how much there is wrong with you in a seemingly very happy person.
Right.
You know?
Yeah. And I would not say there's something wrong, but we are all just in different spaces. In the same time and space, also, in the same storm, also, we could be in different ships. I could be in a very tardy boat, which is going to sink anytime, and you could be in the Titanic, which is also going to sink. But you will get a film made about it. And I'll go down quietly. So that's the difference. From one practitioner, Kamna, to another practitioner, Dr. Sujata comes to us from AIMS. And AIMS, incidentally, has the largest patient load in the country, AIMS Delhi. और हर तरह के लोग आते हैं डॉक्टर, वहाँ अलग अलग भाषा का चैलेंज है, फाइनेंसिस का चैलेंज है, पूरे देश से लोग आते हैं. तो खासकर महिलाओं के लिए, फॉर विमेन, what do you think could be done from the government sector particularly to facilitate the access?
I think, Pooja, I mean, if we are only focusing on the access to a hospital or a large tertiary care hospital, I think there is no barrier in accessibility, right? However, when I say that, the barrier itself starts from the home, as Kamna and my colleague, Tanuja pointed
Yeah.
out. So the health-seeking behavior itself, when I say health-seeking behavior, it starts from home, and it starts from a particular community, from I mean, each household level. But there also culture plays a very important role. And if you look at the data on health-seeking behavior of women, it is very poor. They are at the bottom of the health seeking, right? It's partly responsible is our culture, partly responsible of our, I mean, the way woman is perceived, like sacrificing and then, I mean, compromising, sacrificing, adjusting, binding to our families together, whatever. I mean, so when you say health-seeking behavior and the barrier itself, it starts from there. Even a penny spent on a woman is a big issue in a family, right? So accessibility, if the health-seeking behavior is very strongly related to accessibility of healthcare down from the village level. And we get patients from all over the country, especially the northern, eastern, and the northeastern part of the country, and a lot of refugees as well. So when it comes to women from different parts of our own country, accessibility, availability, and then facilitating the process is not a very big issue. But when we get a lot of refugees from outside India, let's say from Afghanistan, from Bangladesh, then there are a lot of cultural issues in accessibility. First, I mean, in addition to that, language is a barrier,
Right.
right? And when language is a barrier, then there is a the connection between the patient and the doctor, that could itself be affected in case we don't have to, in case we are not very, very careful and we do not understand the nuances of which culture they are from to
Right.
us, right? So accessibility itself is not a big issue, but yes, again, the thought process, the attitude, the mindset, as rightly said, so these play a major role in that.
Yeah.
Otherwise, accessibility in a big tertiary care hospital is not a big issue.
Right. So I'll pick from there and come to you, Deepika, since you've been working with marginalized groups for so long.
And just I'll take 1 second
Yeah.
to connect to what Tanuja ji said. When we look at media, there is a disconnection between media and mental health professionals.
Yeah.
Somewhere I feel. And that strong bonding to understand the nuances of each different illnesses, that's not there. That's missing. If you look at different, there are many movies. Some movies are focusing on PTSD, some are on psychosis, some are on depression. But however, if you evaluate it, whether it rightly portrays that particular illness, no, that is missing. And that is missing because there is not a strong bond or a formal network between the media people and the professionals, mental health professionals. Yeah. And in case we can establish that particular network, right? And then movies will be, I mean, they will portray the illness and different facets of illness, from illness to recovery, very well.
Yeah.
If that network is established.
Yes, of course. Media can be a bridge and can help in education and awareness hugely. So I was connecting that with Deepika. She's been working with a lot of marginalized people, especially from the queer community, transgender people. So films and media and the society at large, the biases are there. The media reflects the same or both ways. आपके क्या अनुभव रहे हैं कि मार्जिन से जब आप आते हैं तो वो चैलेंज कितना बढ़ता है और उसको नेविगेट कैसे करें, ब्रीफली बताएं.
ओके, सो पहले तो मैं एक दो छोटी छोटी चीज़ों के बारे में बात करूंगी मीडिया या मेंटल हेल्थ मूवीज़ के हिसाब से. सो कुछ कुछ चीज़ों के बारे में मूवीज़ ने ऑलरेडी दिखाया है. जैसे मैं बोल रही थी कि छोटी एज, तो तारे ज़मीं पर मूवी हम लोगों ने देखी है. और ऐसे केसेस हम लोग बहुत बार देखते हैं अपने बच्चों के साथ. बट वी ऑल्सो डोंट रिएक्ट लाइक दैट. हम भी वैसे ही रिएक्ट करते हैं जैसे उसमें पेरेंट्स ने रिएक्ट किया था. तो शायद वो थोड़ा सा गलत है मुझे लगता है, और हम ध्यान नहीं देते. हमने भी तारे ज़मीं पर मूवी देख के बस छोड़ दी है, उसको ज़िंदगी में इम्प्लीमेंट नहीं किया है. नाउ आई विल कम बैक टू माई ट्रांसजेंडर कम्युनिटी. सो ताली मूवी की अगर हम बात करें, जो वेब सीरीज है, उसके अंदर भी एक पर्टिकुलर केस है, इंसिडेंट है, क्योंकि इसकी स्टोरी जब लिखी जा रही थी तो उसके लिए भी वो लोग मेरे पास आए थे नोएडा में. और उसमें मेरा थोड़ा सा एक हिस्सेदारी है, क्योंकि कुछ चीज़ें मुझसे पूछ के लिखी गई थी. तो जब एक पार्टनर शादी कर रहा है और शादी करके एक ट्रांस व्यक्ति को छोड़ दे रहा है, तो वो सुसाइड अटेम्प्ट कर रही है करके, और वो मर जाती है. ठीक है, तो उस पार्ट में हमने दिखाया था, बाकी पीछे का हिस्सा हमने स्टोरी में लिखा और बोला. बट वो उस तरीके से पोर्ट्रे नहीं हुआ करके, क्योंकि वो बहुत कम टाइम में मूवी को खत्म करना होता है। वो सब सारी चैलेंजेस हमको बताए गए कि ये चैलेंजेस है, हम इसको इस तरीके से नहीं कर सकते हैं, वगैरह वगैरह। but these are the real challenges, है ना? So if I'll talk about transgender community, जो मैं रेगुलर बेसिस पे देखती हूँ, और if I'll talk about homosexuality at larger perspective, अगर मैं देखती हूँ तो उसमें मैं ये देखती हूँ कि अगर बहुत रिसेंटली अगर मैं डेटा की बात करूँ तो ऑलमोस्ट 19.5 मतलब ऑलमोस्ट 20% ऑफ द मैन आर सफरिंग विद द मेंटल हेल्थ प्रॉब्लम। बट उसमें ही अगर मैं देखती हूँ वुमेन्स की बात, तो ऑलमोस्ट 27% वुमेन्स आर सफरिंग विद मेंटल हेल्थ प्रॉब्लम। बट अगर मैं चली जाती हूँ वहीं पे ट्रांसजेंडर कम्युनिटी, जिसमें ट्रांस मैन ट्रांस वुमन दोनों ही आते हैं, ट्रांस मैन ट्रांस मैस्कुलिन आइडेंटिटीज एंड ट्रांस फेमिनिन आइडेंटिटीज, उसकी बात अगर मैं बात करती हूँ तो ऑलमोस्ट 70% ऑफ द ट्रांस पर्सन आर सफरिंग विद मेंटल हेल्थ प्रॉब्लम्स। सो इसकी जब मैं बात कर रही हूँ 70%, तो इसमें मोस्ट ऑफ देम, हमारे पास एक डेटा है, 44% have attempted suicide once in a life.
And Deepika, I'll halt you a little bit here. So I did not give this disclaimer since this is a mental health conversation. Some of us might, in our stories or narrations, talk about deaths by suicide or suicide attempts. People here might feel triggered or might feel upset about this. We have a lot of mental health practitioners here. If anybody feels distress, please connect with the organizing team.
Yeah, sure.
Step out, breathe, and come back. Thank you so much. Please
Yeah,
continue.
but it's important to share because the reality, people should know. That is why I am sharing, because in my life I have also applied that to my own body and to own my mind also. So I have also tried, and people has also tried. So we have this data, and I have also contributed to this particular study. So this is the fact and reality of the life, and I have supported many people. Even day before yesterday, I have supported one person, and she came to my office day before yesterday, and I have supported her to make her transgender certificate, which is there by Ministry of Social Justice
Yeah.
and Empowerment. So I'll come back to one more point which you have highlighted, that you know when it comes to media and social media, कि बहुत सारी ऐसी बातें आती हैं जिसको बहुत फनी मोमेंट में ले लिया जाता है। फॉर एग्जांपल, इफ आई टॉक अबाउट कुछ कुछ इंसिडेंट, अगर मैं बात करूँ, राजा हिंदुस्तानी मूवी में है, और कुछ कुछ मूवीज हैं जो और भी अलग मूवीज में जब लिया जाता है तो उसको बहुत फनी मोमेंट के तौर पे, प्यार किया तो डरना क्या, ऐसे बहुत सारे मूवीज हैं, मैं और भी बहुत सारे बता सकती हूँ। बट लोगों को वो समझ नहीं आता है। मैं एक ही मैसेज देना चाहती हूँ कि बहुत बार जॉनी लीवर और बहुत सारे ऐसे कैरेक्टर्स हैं, जब उस गेटअप को कुछ देर के लिए लेते हैं और छोड़ देते हैं, लेकिन people relate our gender expression and identity with that only for longer period of time। हमेशा वो यही देखते हैं कि वहां पर हमने ऐसा देखा था, वहां पर हमने ऐसा देखा था, बट दैट्स नॉट द रियलिटी। वो सिर्फ एक पर्टिकुलर रोल प्ले के लिए किया गया था वहां पर, बट एक जिंदगी है, वो एक अलग कहानी है। जैसे आप शबनम मौसी एक मूवी देख सकते हैं, हालांकि उसको नहीं दिखाया गया है, तो ऐसी चीजों को देख सकते हैं, तो उससे ज्यादा क्लैरिटी आएगी और समझ आएगी। इसी बात के साथ मैं इस बात को समाप्त करती हूँ, और हम टी ब्रेक पे बात भी कर सकते हैं,
Yes.
if anyone wants to talk.
Yeah, thank you
Thank
so
you.
much, Deepika. So now I'll, last but not the least, go to Dr. Pankaj. He's the minority in the panel, but we need allies. So let's clap for the men who are supporting mental health. So I'll give him the closing words on this. As practitioners, we need men as allies on women mental health. In families and homes, we need men as allies. In media, I do not see too many male filmmakers, unfortunately, portraying mental health or women's issues, what they call issues, correctly or sensitively. So, what is the role, Dr. Pankaj, of allies? And please sum up the panel for me.
Yeah, thank you. As you rightly said, the minority on the in the panel, and I take it from. So this is a stage set by you. You choose who the panelist, how many female, male would be in the panelist. You are a decision maker in this thing, and you and your team. So you could choose and you could put up the voices of female and the different criteria, transgender genders and every word. So listen to their voices and what they're going through and what they're going through the mind. So this is the thing which need to, in the reality, it is all opposite of it. And that's the real sad part in the irony. This number of females will be missing and this number of males will be there, and only one female or hardly any percent of female representation will be there in the policy making, in the top honkos will be sitting over there and deciding what to be done, what not to be done. So automatically when the mindset majority are there in the male policy making and anywhere, as you rightly said, in the home, in the politics or wherever you tell it, so automatically what they portray or they decide or they do will be surely gonna biased with their own experiences. Whatever post they may be sitting at, they may be IAS, the MP, MLA, or whatever they do be doing, a media person or filmmaker. So automatically the bias are tend to come in their own decision making. That is a part of personality. We can't differentiate that. So all the policies which will be made, all the mindsets which will be made, top to bottom, will gradually add up, add up, add up, and when it will really come into the real world, it will be a very biased picture what we will have. So females participation automatically is very low, and when what the share they really get in the real world becomes even lesser when they reach to the real female. And and imagine what we are doing. This is in the metro, capital of the India, sitting in the heart of the country, and see the implied of the female and what the mental health services are, availability and accessibility, as you talked, is there. Now think 100 kilometers from Delhi, not far away, not going to any tribes, any, forget that area. 100 from the Delhi scenes are really bad, really bad. They hardly, as rightly said by my colleagues, they hardly know what mental health is. लोगों को mental health पता ही नहीं है. जैसे दीपिका जी ने सही कहा, उनकी दादी को mental बताएंगे, नहीं समझ में आता, पिताजी को समझ में नहीं आता, जबकि वो इस समस्या से जूझ रहे हैं. I still remember my PG days. I did my PG MD from Lucknow KGMC. Majority of our OPD, we used to see around 100 patients a day in our PG days in Lucknow. It's a government college. So वहाँ पे the majority was male patients. Female were hardly any patients. ऐसे नहीं कि कोई बीमारी नहीं थी. Data says females are double at risk of mental health. एक मेल को अगर डिप्रेशन होगा तो दो फीमेल को डिप्रेशन सोसाइटी में है. डबल है. The data says. But in reality, accessibility and reaching to a doctor and a psychologist, a psychiatrist, वो multiple times low है. वो ये रियल फैक्ट है. तो हम पूछते थे भाई क्यों लाए हैं, तो सिर्फ जब महिला घर की काम करना बंद कर देती थी, झाड़ू लगाना बंद कर देती थी, खाना देना बंद कर देती थी, गाली गलौज शुरू कर देती थी, सिर्फ जब वो एक ट्रबल क्रिएटर हो जाती थी अदर देन प्रोवाइडर, तब उसको लाया जाता था मजबूरी में कि अब इसको ठीक कर दो, फिर घर इसने चलाना है. दैट इज अ रियल थिंग. इसलिए नहीं लाइफ अच्छी करनी है, उनकी लाइफ बिगड़ गई है मेल्स की, उनको अपनी लाइफ अच्छी करनी है, इसलिए उसका इलाज कराने आ जाते थे. दिस इज द रियल सैड पार्ट एंड दैट्स स्टिल कंटिन्यूज इन दिल्ली आल्सो. आई सी इन माय ओपीडी प्रैक्टिस एंड माय मैक्स एंड माय क्लिनिक, really its picture hasn't changed much in last 2 decades. So this is the really sad part. We need to give them more participation, real voice, and make a real noise starting from this small things and adding up to a bigger thing. So really लोग जाग जाएं जो ऊपर सो रहे हैं बैठे हुए टॉप पे कि भाई महिलाएं भी हैं, उनकी आवाज मैटर करती है, उनकी जीवन मैटर करता है, उनकी मेंटल हेल्थ, उनकी जरूरतें भी, उसको देखिए और उसको एड्रेस करिए. इससे काम नहीं चलेगा.
Thank you.
Thank you, Pooja ji, for using
Thank
this
you,
platform.
Dr. Pankaj. And I will encourage all
And you
women.
know, sorry, you know, the interesting part, एक study ये बोलती है कि 44% of the men doesn't talk about their mental health. वो छुपा के रखते हैं सारी बातों को.
Yeah, I mean, that's cultural and that goes across genders. But I'll take it up from there and say, कि I want all the women here to be troublemakers. Be troublemakers in the house. काम करना बंद करो, अपने mental health पे ध्यान दो. With that, I'll this and I'll invite Vivek to please felicitate our panelists here. And we'll have a group picture and then I think we have tea.
Yes.
Yeah, so thank you, my wonderful, wonderful panelists. We had such a wonderful conversation today. I hope we keep the conversation. Thank you very much. Yeah, why conduce in clapping? Yeah, our jury member, Dr. Neena Gulabani is saying, why conduce in clapping? I know chai peeni hai, bas ja rahe hain. So we are behind schedule. So please have your tea quickly. We should be back in 15 minutes. Thank you so much. Hello everyone. I request everyone to please settle down quickly. We are going to resume the next session, please. I request the volunteers around to please request the guests outside, those who had their snack time, please come back. We are going to resume in next 2 minutes. Yeah, please. I can see a few volunteers around the door. Please request the guests outside to join the hall back, please.
Welcome back. I request everyone to please switch off their phones. While we're waiting for everyone to settle down, here's a little bit more about Bharat Dialogues. Bharat Dialogues is an initiative founded by Ms. Pooja Priyamvada and Mr. Vivek Satyamitram, both with illustrious careers in media and mental health advocacy. Bharat Dialogues was launched with the vision to create a dynamic and safe space for intellectual churning of ideas which connects stakeholders from intersectional spaces. It strives to be a multidimensional platform for critical thinking, introspection, collaborative learning, and peer appreciation. It is a platform for layered and impactful mega-scale brainstorming. Its vision is to encourage discourse, allow ideas to evolve and take shape, as well as celebrate dedicated, meaningful work in various spheres. With this event, we aim to break down silos within the mental health spectrum, honor excellence, as well as build and reinforce networks within the mental health space. We request all of you that you can even connect with us on our socials and spread the word about the event and about Bharat Dialogues. We will also be going live on our YouTube channel. Now, I request Dr. Neena Bora, the jury chair, to come on the stage for her address. Dr. Bora is a distinguished senior consultant psychiatrist and a national leader in the field. She is former secretary, Central Mental Health Authority, Government of India, and national consultant, WHO. She was also the head of Department of Psychiatry at Ram Manohar Hospital, Delhi.
Good morning, good afternoon, rather. Well, I personally feel because 5 minutes were given, so I have written down because in this age group, I may forget many things which I want to point out. And I'm honored to be part of this. Being a woman is a gift in itself. The ability to be a mother, the laughter of the daughter, and the smile of a sister are relationship we all cherish, and yet we challenge the authority of a woman. Why? She's the one entire family depends upon. She's raised in a fashion to be nurturer, the provider, and never seeker. And case of a woman deviates from the stereotype role set upon her by society. She is being judged, questioned, challenged, and at times even abused. The lack of acceptance from the family or friend or society lead to the formation of a guilt and the wonderful woman of not being good enough. They are challenged at every stage of life, and result it makes them feel that they are not being able to do enough for their homes or jobs or for the kids. In the hassle, women lose an essence of themselves, and we lose the very woman we love. I did not believe that the woman is incapable of handling the house as well as work. but I am firm believer in having helping hand, a supporting arm in the form of a brother, father, or a husband who can set the right example for society. This support not only makes your woman happy, but also makes a happier household and independent woman capable of handling the world. The COVID-19 has brought, but the media also has got a role that we get mental health issues quite in front, anxiety, depression quite a bit, and everyone's health, mental or physical, but have been the toughest on the women. The support system of our houses with no leaves, no break, and added pressure of maintaining the house along with the work, maintaining the work, the life balance has been tough for everyone, but this past year has been adversities could be seen on the woman too much. The last 3-4 years is in front of the multiple issues of depression, increased rate of anxiety, abusive relationship, domestic violence, and harsh negative household environment, which affected individual on a large scale. Last Lockdown has been filled up in many states across the world, and some are still observing it. It is, but drive brings us the opponent to look upon these issues and make a better society a better. We have a multiple examples of women throughout the history who were the first woman athlete, the first woman psychiatrist, the first woman president, the torchbearer of change. But the strong, independent woman with the support of the family or without it is that they always want, we never gave up on their dreams, no matter the hardship. And that is what made them the benchmark of the next time to clerk. There has to be impact with a lot of enthusiasm from the various organizations, and independent people have come forward to discuss about this issue. But I don't want that this panel only discusses it and doesn't plan anything further, and it is just rushed under the carpet. So we all want these organizations to have a real impact and really have an action plan to take the women in a, let them cherish with the help of this thing. The man's attitude towards women has to be changed. That is the first and foremost thing, where we all have been discussing since morning, but we have to really work on it in a better way, that the husbands or the man in the house should change. Give them the freedom to talk, give them, take the full advice and not to abuse them, and let the flourish women so that we have a wonderful ladies amongst us. I thank the organization for giving me a chance to speak to you all, but I really wish all the best, that you should really continue doing the work for the mental health. Mental health has changed since COVID has brought a lot of anxiety and depression in forefront, but for a woman, still it has not been discussed as we have been discussing since morning. We wish them all luck and wish you all best. And I really congratulate the awardees of this thing. Being a chairperson, I have to really mention that. And I hope people will be happy with what the result they got it. Thank you so much.
Thank you so much, Dr. Bora. I request you to please stay on stage. I invite Ms. Pooja and Mr. Vivek for the felicitation.
I request our other jury members present here. Gaurav ji is here, Sujit ji is here, Neena ma'am is here. Please join us for felicitation of the stage. Let's have a jury picture. A lot of our jury members could not come. They are from across the world. I'll announce their names and their kits will be sent across. Thank you, ma'am. Sujit ji, please aye. Gaurav ji, please come. Thank you, ma'am. We have so wonderful, so much of Neena energy in the hall today. आप इधर आइए. Please. Ma'am, this is a puja night. You have to bring everybody together. Very, very active. He's a very supportive friend, ma'am. And a group picture. Please,
Yeah.
Thank you. Ma'am, आप थोड़ा आराम से step थोड़ा बढ़ाएं. Gaurav ji, please.
Thank you, sir.
There's a list there. I'll quickly read out the names of the jury. So Dr. Neena Bora here was the jury chair. We had Dr. Nimesh Desai, he's former director IBAS. Ms. Geeta Lal Sahai, she's a filmmaker, founder, president, SWAM Foundation. Dr. Shruti Kapoor, founder, Safety from New York. Dr. Rakshita Sharma, she is a senior HR professional. Miss Elsa Marie De Silva, she's the founder of Safe City app and Red Dot Foundation. Miss Meera Chaudhary, she's a documentary filmmaker. Shri Balendu Sharma Dadich, he'll be here later with us today. He's a director of local languages and accessibility at Microsoft India. Mr. Shashank Avasti, he's investor and co-founder LI Ventures. Mr. Sujit Kumar, CEO Online and Retail Winnie. Ms. Pallavi Ghosh, she's founder and director of Impact and Dialogue Foundation. Dr. Neena Gulabani here, who's a humanistic coach, and Mr. Gaurav Kumar Bansal, who's a Supreme Court lawyer. Thank you all. They did a fabulous job as a jury. Thank you. Next up is something that has led to this event. Both Vivek and I, dear friends, often have very intense conversations about topics from media and mental health. And fortunately, both of us keep getting awarded or invited to a lot of places. And one day, to one of my mentors in mental health, I was having a conversation, a senior gentleman, and he said, Pooja, you keep getting an award every week. I said, yeah, sir, that's the way it is in nowadays. And he says, but I never see anybody giving awards for mental health work. The gentleman is Mr. Amrit Bakshi. He is from Schizophrenia Awareness Association. He's the awardee of our first Lifetime Achievement Award for his exceptional contribution to mental health. For 32 years of dedicated service as an office bearer at SA Pune, and also as a caregiver to his daughter and so many people who live in the premises of SA, and to all of us, to the Mental Health Care Act in India, to all of us working in the community today, he's the person we would go back to. On a bad day, when the question comes, ये क्यों कर रहे हैं? कल मेरा एक रेडियो इंटरव्यू था और मुझसे पूछा गया कि किस तरह के रिएक्शंस थे। एक तो ये जो आप लोग यहाँ खड़े हैं साथ में, और दूसरा रिएक्शन वो है कि इवेंट्स आर ओनली अबाउट मनी मेकिंग। ट्रस्ट मी, अमृतसर भी कहते हैं ये बात, हमें मनी मेकिंग करनी होती तो हम किसी और फील्ड में होते। मेंटल हेल्थ में सच में मनी मेकिंग नहीं है, और अमृतसर की लाइफ उसकी टेस्टिमनी है। हम सिर्फ अपने दिल से और अपनी रूह से काम करते हैं। उसके साथ मैं विराम दूंगी अपनी वाणी को, और हमारे साथ आज उज्ज्वला हैं, उनकी ग्रैंड नीस, जो उनके बिहाफ पे शी विल रिसीव द अवार्ड। सर हैज नॉट बीन कीपिंग गुड हेल्थ, और आखिरी बार जब उनसे बात हुई मेरी, तो मैंने उनसे कहा कि बड़ी मंजिलों के मुसाफिर छोटी बातें नहीं करते। एंड विद दैट थॉट we present this Lifetime Achievement Award to Mr. Amrit Bakshi.
Good afternoon, everyone. I'm accepting this prestigious award on behalf of my grandfather, who's unable to travel on account of old age, as ma'am said. With utmost humility, I read out the acceptance note sent to me by him. I feel humbled on being conferred the Lifetime Achievement Award in the field of mental health by the Organizing Committee of Women and Mental Health Summit and Awards 2024, a flagship event of Bharat Dialogues on the occasion of International Women's Day. Like millions of other family caregivers, I'm a humble family caregiver of my daughter living with paranoid schizophrenia for the last 32 years. What could have been a beautiful life for her and her parents was ruined by the nightmares she dreamt about demons tormenting her. 3 decades back, there was hardly any awareness about mental illness. There was no guidance or appropriate advice. The condition was attributed to black magic or the affected person possessed by evil spirits. Our daughter suffered as she was tormented by those voices, and we as parents suffered as we had to bear the brunt of her hostile reaction to those voices and faced ignominy when neighbors complained about being disturbed. Dreams shattered, our family income reduced, expenses increased on account of treatment cost, and on top of it, our only child traumatized by the illness. I became a self-learner, doing internet research on schizophrenia and psychosis, joining peer support groups, hunting for day rehab centers, getting my daughter engaged in therapeutic activities was my typical day's routine as a full-time caregiver. Along with being a caregiver, I also started studying material on mental illness, UNCRPD, and give my inputs in discussions on drafting of the amendments to the Mental Health Act 1987, and later in drafting of a new Mental Health Act based on the UNCRPD. My mental health journey included attending conferences, seminars, workshops, and this is how a lay family caregiver who was a banker transformed into a full-time activist in the field of mental health. In 2010, I became the president of Schizophrenia Awareness Association Pune and was nominated by the government on NIMHANS's institutional committee. And in 2014, I became the chairperson of NIMHANS Hospital Management Community. Serving on several national and international committees, never in my life could I ever imagine that I would get so involved in mental health. Soon I became the one-point contact for family caregivers who would call me at any time of the day to seek advice. I did not want my learning to get lost, so I decided to write a book, Mental Illness and Caregiving, Challenges, Concerns, and Complications, which has been published in English, Marathi, Hindi, and Tamil. This book, I hoped, could serve as a guide to family caregivers. As I conclude, I would like to say that I would have loved to receive the Lifetime Achievement Award in person in the presence of so many stalwarts from the mental health community gathered here, but my present health does not allow that. I accept the Lifetime Achievement Award in all humility on behalf of all Indian family caregivers who form the largest gratis workforce in the world dedicated to provide care to their dear ones, and thank once again the organizing committee for considering me worthy of it. Thank you.
We have.
We have. The slide,
Sun.
please.
Sun slide.
Dr. Mr. Amrit Bakshi. No, not this. Before this. Mr. Amrit. Sorry. This one then. If you do a survey in the hall, I'll be the most tech challenged person. So I don't get into that corner of the hall. You not see me with them. Thank you. Thank you, ma'am. So, thank you, Ujjwala, for coming all the way and accepting the award. I'm so grateful to Bakshi sir. And now I will introduce my senior colleague, Dr. Jitendra Nagpal, for the next keynote. Dr. Nagpal is a senior consultant psychiatrist at Moolchand Medicity. All of us know him. He doesn't need an introduction. He's also director of Expressions India. He's been successful across varied psychiatric interventions and has been associated with leading psychiatry hospitals in India for over 2 decades. So, Dr. Nagpal, please, over to you.
थैंक यू पूजा जी। इनफैक्ट अभी टी टाइम में मैं मैम से कह रहा था कि आपके क्लोन्स और कितने आएंगे, उनका हिसाब लगाना हमारे लिए बहुत ज़रूरी है। एनीवे, टॉपिक स्टोरी टेलिंग आ गया इत्तेफाक से, बट इट इज़ मोर अबाउट इकोसिस्टम। you'd like to?
The slide has been mixed up, but sir will speak on what he was supposed to speak.
Perfectly all right. And what I was supposed to speak has a little evolution now, listening to great stalwarts and people. And I dedicate my talk to Professor Neena Bora, who I consider, and I think most of us in the field of psychiatry would consider as a contemporary mother of Indian psychiatry. So let's give a big hand to ma'am. So we have Neena ma'am 1 and Neena ma'am 2. Well, thanks to the entire team, Vikas Life Care, Bharat Dialogues, what else could be a wonderful moment that we all sit together here? And I feel quite emotionally coached and secure because we see the community actually waking up. ये जो जागृति है, मुझे लगता है कि वो आश्वासन, मुझे याद है नीना मैम के साथ हमने 22 साल पहले जब हमने अपना करियर शुरू किया था, we had the first ever Women in Mental Health Conference, national in India, and also we had international participation. You'll be surprised that Meenakshi Lekhi ma'am, who is Central Minister now, she was a panelist on that, and many other great people from different walks of life. In the aftermath of that, I think एक बात तो बहुत clear है. We should now evolve and somewhere stop counting the number of mental health manpower available. वो हमारे लिए ठीक है, कितने मरीजों के लिए कितने psychiatrist या psychologist हैं. It is very important to now start recognizing, and wonderful that Bakshi Saab has been decorated today. I'm sure this could have been done much earlier. How many of us are actually into the field, grassroots, community mental health promotion? Anybody? All of you? But I see only 5, 6 hands out of nearly 100 people. Thank you. I think we have the Sambandh team here. I had the privilege to talk. Have you been able to gather some idea what has been the overall scenario of the community mental health in India? In one line, if you can tell us, how many NGOs would actually be known to you who are doing as much as what all of you, 5, 6 of you have been able to do in India. And that is where I think the threading lies. We need to come together. एक आप मुझे बताइए, NMHP के बारे में सुना है आपने? The National Mental Health Program. उसका main crux क्या है? 44 years back, the government gave it to us. And the main crux has been community outreach. Manpower की बात तो है उसमें. Undoubtedly, we are all going to be somewhere, looking at 25,000 psychiatrists and maybe 20,000 psychologists in next 10 years. उतने हैं नहीं, अभी उसका आधा है. But patient and tertiary care के लोगों का जो रेशियो है वो तो 100 साल तक पूरा नहीं होने वाला है. मेडिकल कॉलेजेस में अभी भी उतने साइकियाट्रिस्ट के सीट्स नहीं हैं जितना आप और हम चाहते हैं. We need about 3 lakh mental health professionals and we have only 30,000. We have 1/10 of that. So where are we? We are with you. The answer lies in the grassroots community. Polio could not be eradicated by pediatricians, no? Polio had to go down into the do bund ka philosophy. So दो क्षण सुनने के, 2 क्षण संवेदना के, सहारे के, सहयोगी के, सारथी के, क्या हम मानसिकता के लिए नहीं दे सकते हैं? 2 क्षण. और शायद कितने सुसाइड नोट्स में यही लिखा होता है बच्चों की. आई टॉक अगेन बच्चों की. मीडिया नीड्स टू बी अ लिटिल रिस्पॉन्सिबल. जो आज सवेरे से बात चल रही है, जो लास्ट सुसाइड नोट कोटा फैक्ट्री से आया था, आपने सबने देख लिया है वो. पापा आई कांट टेक इट एनी मोर, समथिंग लाइक दैट. हाउ इज इट पॉसिबल दैट मीडिया रिपीटेडली एडवर्टाइजेस दैट सुसाइड नोट? क्यों? वाई? वेल, आपको जवाब देना होगा दोपहर में. एंड आई थिंक नीना मैम ने बहुत अच्छा बताया कि आज क्या हम कोई स्ट्रॉन्ग रिकमेंडेशंस बना सकते हैं. बहुत सीरियस मैटर है एक्चुअली ये. हम वर्ल्ड के सबसे ज़्यादा यूथ के सुसाइड्स के अवार्ड लेने वाले हैं, बिकॉज वी हैव द लार्जेस्ट यूथ इन द वर्ल्ड. आई सी ओनली यंग पीपल हियर and younger and youngest. So even if you're retired, you all look so young and vibrant. Kindly take up the responsibility of community mental health, because you will be the star makers and the change makers of tomorrow. Because burden disease का मैम ने हिंट दिया था, वो इतना ज़्यादा है that non-government sector में भी हमें 10 बज जाते हैं घर जाते हुए. इतना मरीज है. And you will agree, किसी को सफरिंग के साथ एक मरीज का खिताब भी देना कितना अजीब लगता है ना? We wish it was a problem, an issue or a concern. So in minimum emotions, I'm trying to tell you that we need to wake up the community, and this is a great example. Pooja and her team have been masters in bringing about this change recently. तो और भी आप में से कई होंगे. आप हमें बुलाएं ना बुलाएं अलग बात है, लेकिन आप सब अपने अपने नेशनल कॉन्फ्रेंसेज अब शुरू कर दीजिए. Because you are the leaders, let me tell you. We are doing, and I want to take up the issue of children in India, and gender starts there. Gender inclusion, gender sensitivity. आज के एडिटोरियल में अगर आप अखबार घर में जाके देख लें, boys will be boys. एडिटोरियल है. And exactly वही बात है जो हम करना चाह रहे हैं यहाँ पे. Today afternoon, I think you'll be taking up this issue also. It's not so much about femininity and masculinity anymore. It's about human rights. Can you tell me what is the workforce of women in India at the moment? मानते हैं कि डोमेस्टिक वर्क भी अभी चर्चा चल रही है कि सैलरीज मिलनी चाहिए मदर्स को, मम्मीज को, बट वर्कफोर्स कितना है? Less than 40. And qualified manpower is huge. I can tell you that I know about 15 psychologists who are just homemakers now. PhD करने के बाद घर में ही बैठेंगे. क्यों नहीं बैठेंगे? करिए घर का काम करें. बट जैसा मैम ने बताया that we are not here to have a competition between the man and the woman. We are here to help complementation. एक संवाद and कहीं ना कहीं righteousness about if I feel like working. Look at Indira Gandhi Open University. Millions. I was told by a professor there कि ये largest university है इस वक्त world में. Any contest on that? In terms of enrollment. And millions of housewives are enrolled in bridge courses, in degrees and diplomas. घर में बैठ के mothers जब बच्चे स्कूल में होते हैं. Look at the workforce which we can generate. And one side if the government is saying कि employment मिलने वाला है, the mental health scenario starts there reducing then. The mental health problems start reducing. If you are able to minimize the idea about what is my identity, what is my purpose, and what am I going to do in life. So I think the point number one, the recommendation one lies increase economical independence, increase education right from the time I go to the school as a girl. Today, after the COVID, the mental health disorders का जो आप अगर नक्शा देखेंगे तो it is more like a pyramid now. It was more like an obese man. अब वो पिरामिड है. क्या मतलब हुआ इसका? बच्चों में और किशोरों में सबसे ज्यादा हो गया है. As much as some surveys are saying that 20 to 30% of them are suffering from mental health conditions, they need help. Can the teachers alone help? They can. You need to orient them, you need to train them to identify flag signs, warning signs. A class teacher अगर 253 million बच्चों को कोविड के टाइम पर घरों में जाके पढ़ा सकती थी through her laptop, where in the world education warriors can this happen? They can do the mental health first aid also. हमें mental health first aiders की जरूरत है और आप सब हैं वो. In fact, many of you are professionals, you are practicing, but I mean Pooja will have an outcome of this prepared so well that the mental health first aiders मरहम पट्टी करने वाले दिल पर हमें नहीं मिल रहे हैं. मरहम पट्टी उंगलियों की चोट पर और हड्डियों की चोट पर मिल जाते हैं, लेकिन those who are committed and have the conviction for compassion, which could be a human being with a quality unqualified as a degree, are needed more than qualified people who probably don't have the time for it. I think it will be a fantastic scenario. हम ज़्यादा दूर नहीं है उस दिन से. I think let's be little positive. हम थोड़ा negativity भी बहुत सुन रहे हैं आज. मुझे लगता है कि आशावादी बन जाएं, क्योंकि सबसे बड़ा रिसोर्स हमारा क्या है? Human resource. People. Underutilized. तो क्या हुआ अगर 20% पॉपुलेशन को जरूरत है, 7%, 1 out of 7 इंडियंस इज सफरिंग फ्रॉम अ मेजर मेंटल डिसऑर्डर. ठीक है, प्रॉब्लम है, सच्चाई है, सर्वेज अच्छे हो रहे हैं. पहले WHO हमें बताता था, आज हमारी गवर्नमेंट ऑफ इंडिया में बता रही है कि ये इश्यूज हैं. दैट इज मीन हमारे सर्वेज भी बड़े अच्छे हो रहे हैं, रिसर्च अच्छी हो रही है. वर्कफोर्स इन विमेन का सर्वे हो रहा है हमारा अपना. लेबर ऑर्गेनाइजेशंस फ्रॉम अब्रॉड यूज्ड टू टेल अस, वी आर डूइंग इट ऑन आवर ओन. Look at the wonderful research. आप में से कितने लोग हैं जो researchers हैं? Then why are we waiting for the outcome and the action? I think I completely agree with Professor Neena ma'am. We want actionables from you. कि अगले 2 साल में क्या करना है? हम आपके साथ हैं. And the transformation lies in the community. Most important, I want to tell you, the peer-to-peer dialogue, whether it is at home, it is in the workplace. Can you imagine corporates have approached us to create peer-to-peer employees for mental health? Not only the HR managers. वो 1 या 2 होंगे, जैसे स्कूल में 3000 बच्चों के लिए आप इसी एरिया में बैठे हैं जहां बहुत सुंदर, बहुत बेहतरीन पब्लिक स्कूल्स हैं IIC के आसपास. एवरेज काउंसलर्स कितने होंगे? 2 होंगे, 3 होंगे, बट हजारों बच्चे हैं ना. कैन वन काउंसलर मैनेज दैट बर्डन ऑफ द चिल्ड्रन who will be growing up tomorrow with gender sensitivity or not? We don't know. एक जेंडर की क्लास होती है ना खाली. सो ये भी एंडेंजर्ड है, ये फिलॉसफी भी एंडेंजर्ड है कि जेंडर रिलेटेड एजुकेशन हम खाली एक लेक्चर ले लें स्कूलों में. You have to have the students' own interaction and participation. So what we started about 18 years back, ma'am is aware, and Professor Neelam Bora, late Neelam Bora साहब जो मेरे भी मेंटर रहे हैं, मैं उनको सलाम करता हूँ, बिकॉज उन्होंने एक ही चीज़ कही थी कि खाली बैठ के अपने हॉस्पिटल में पेशेंट मत देखते रहना, कुछ और भी करना. तो आज हम शायद यहाँ इसी बात पे खड़े हैं कि कहीं ना कहीं the government, the state government, and the autonomous organizations are listening to all of us. So please, let's join hands to create that. I'm sure if I take another minute, Pooja will tell me to get lost. So, but बड़ा मुश्किल होता है एक psychiatrist, hard working psychiatrist को खाली 10 मिनट बोलना. Anyway, I think that is the time limit. I just wanted to share दिल की बात. दिमाग से बात अभी की नहीं है, नहीं तो 2 घंटे चाहिए होंगे. Thank you so much.
Much, Dr. Nagpal. I would request Vivek sir and Pooja ma'am to felicitate our speaker.
अच्छा, बाय द वे, डू यू ऑल नो, आज के पेपर में मैंने पढ़ा इंटरनेशनल वुमेन्स डे के 3 मेन कलर क्या होते हैं कैंपेन के? You got it. Green, purple, green, and white. And purple is for dignity and justice, which I think Pooja is making it today.
Thank you. Thank you. Thank you, Dr. Nagpal. In the schedule, we were supposed to have the second panel immediately after this, but unfortunately, we are running a little late, and I'll immediately will have to request my panelists for the second panel to be patient, give us 10 minutes, as our third keynote speaker is here, and since he comes from media, he has a very packed day today, and he has to leave. So with that, I will invite now Mr. Upendra Rai. He is a journalist and a writer. He currently serves as the chairman, managing director, and editor-in-chief of Bharat Express News Network. He has worked with many media organizations in the past, including CEO and editor-in-chief for Sahara, India Media, and Tehelka. He's a mentor to both Vivek and I as well. Thank you. Welcome, sir.
बहुत बहुत आभार, धन्यवाद भारत डायलॉग्स का। विवेक को तो मैं अच्छे से जानता हूँ, आपसे मुलाकात यहीं पे हुई। विवेक हमारे साथ सहारा में काम कर चुके हैं, और जब मुझे पता चला कि ये सेमिनार है तो मैंने पहली मुलाकात में इनको बोला कि बिल्कुल हम लोग इससे जुड़ेंगे, इसको अच्छा से करेंगे। तो आभार, आप लोगों ने यहाँ बुलाया। ज़्यादा टाइम नहीं लूँगा, लेकिन आज महाशिवरात्रि है, तो शिव की सती पार्वती से ही शुरुआत करते हैं। जब राजा दक्ष ने, प्रजापति दक्ष ने अपनी ही बेटी का इतना अपमान किया कि सती हवन कुंड में छलांग लगा के मर गईं, और भगवान शंकर को इतना क्रोध आया कि सती के मृत शरीर को लेकर वो गुमनाम घूमते रहे। हालांकि सती के इस मौत का बदला भी उन्होंने लिया। प्रजापति दक्ष का, जो ब्रह्मा के पुत्र थे, और माना जाता है कि मानव जाति का जन्म प्रजापति दक्ष के बनाए नियम के अनुसार ही हुआ, और वो उसके संचालक रहे पृथ्वी लोक के। भगवान शंकर ने उनका वध किया, और शोक में सती का शव लेके वो तीनों लोकों में घूमते रहे। और कहा जाता है कि हमारा जो धर्म है, सनातन जिसको कहते हैं, पूरी दुनिया में आप सबसे प्रगतिशील धर्म मैं यहूदियों का मानता हूं। तालमुद जो उनकी किताब है, बाइबल को भी आप थोड़ा बहुत सब लोग यहाँ जानते होंगे, इस्लाम को भी सब लोग जानते होंगे, और धर्मों और जो मत संप्रदाय हैं, कहीं भी ईश्वर की कल्पना अगर की गई तो सिर्फ पुरुष के रूप में की गई। और इकलौता सनातन धर्म है जहां ईश्वर की कल्पना अर्धनारीश्वर के रूप में है, जहां ईश्वर आधा पुरुष है और आधा स्त्री है। यहां तक कि बाइबल में भी ये कहा गया कि जब आदम को बनाया गॉड ने, तो वो बड़ा मायूस मायूस सा घूमने लगा और गुमसुम सा रहने लगा। तो उसकी पसली से तोड़ के ईश्वर ने स्त्री की रचना की, यानी स्त्री बनाई गई लेकिन थोड़ा दोयम दर्जे की। तो मैं आज शिवरात्रि उस कहानी पे आता हूं। तो भगवान विष्णु को सूझा कि अगर जगत का कल्याण कैसे होगा, अगर सती के बिना शिव इस तरह से घूम रहे हैं तो शिव तो फिर 100 हो गए। तब उन्होंने, कहानी बताती है कि अपने सुदर्शन से सती के शरीर को वार किया, और 12 टुकड़ों में वो शरीर पूरे ब्रह्मांड में पृथ्वी पर गिरे। और जिन 12 ज्योतिर्लिंगों की आज सभी ज्योतिर्लिंगों में हर हर महादेव के और शिव पार्वती के नारे लग रहे होंगे, पूजा हो रही होगी, तो वो वही 12 ज्योतिर्लिंग हैं जहाँ पे सती के शरीर के अंश गिरे। बाकी नवरात्र में आप लोगों को पता है कि जो एक एक जो दिन होते हैं वो क्या होते हैं, क्या पूजा होती है, मैं उसमें नहीं जाऊंगा। लेकिन ये जरूर है कि मेंटल हेल्थ के बारे में तो मैं बाद में आऊंगा, लेकिन पहले मैं ये बताना चाहूंगा कि आप लोगों को जान के आश्चर्य होगा कि 1776 में अमेरिका को आज़ादी मिली और 1920 तक वहां औरतों को वोट देने का अधिकार नहीं था। 1920 में औरतों को वोट देने का अधिकार अमेरिका में मिला, और 1928 में जब ब्रिटेन के लोग भारत पे शासन कर रहे थे तो 1928 में ब्रिटेन में औरतों को वोट देने का अधिकार मिला। इस मामले में भारत को थोड़ा प्रगतिशील मानता हूं कि जिस दिन हमें आज़ादी मिली उसी दिन से हमें है, औरतों को है उसी दिन से। और जो 1949 में जहाँपाल सात्र की जो रूममेट थी कह सकते हैं, सिमोन द बोवा, जो उनकी किताब आई सेकंड सेक्स, उस किताब ने पूरे दुनिया में तहलका मचाया। और यहाँ बैठे मुझे लगता है कि जब अच्छे श्रोता हों तो थोड़ी अच्छी बातें जरूर करनी चाहिए। तो यहाँ काफी अच्छे श्रोता हैं, इसलिए थोड़ी बातें करूंगा मैं आप लोगों से। तो जब सेकंड सेक्स आई तो पूरी दुनिया में तहलका मचा, और सिमोन का एक वाक्य कि स्त्री पैदा नहीं होती, उसे बना दी जाती है, बना दिया जाता है। तो इस वाक्य का मतलब बहुत लोगों को समझ में नहीं आया कि आखिर सिमोन कहना क्या चाहती हैं। सिमोन ने उस किताब में बहुत एलेबोरेट करके लिखा कि जब पुरुष और स्त्री पैदा होते हैं तो दोनों प्राणी के रूप में ही पैदा होते हैं, लेकिन स्त्री की कुछ पैदा होते ही और थोड़ा सा बड़ा होते ही ड्यूटी पहले से फिक्स्ड है, पुरुष की वैसी फिक्स्ड ड्यूटी नहीं है। जैसे पति शब्द है, पति का मतलब होता है मालिक, राष्ट्रपति देश का मालिक, सेनापति सेना का मालिक, पति पत्नी का मालिक। पत्नी का शाब्दिक अर्थ होता है दासी, अगर डिक्शनरी में आप खोल के देखिए। तो पत्नी का जो स्त्री का पहली ड्यूटी है वो भाई बेटी के रूप में पैदा हुई, उसके बाद बड़ी हुई, उसके बाद जो है वो किसी की पत्नी बन गई, दासी बन गई, कुछ और बन गई, कुछ और बन गई, उसके पहले से रोल डिसाइडेड है। और महाकवि जयशंकर प्रसाद ने लिखा कि अबला नारी हाय तेरी यही कहानी, आंचल में है दूध और आंखों में पानी। तो जयशंकर प्रसाद जैसे मार्मिक कवि ने अगर ये बात लिखी तो उनके भी अनुभव से ये बात कहीं ना कहीं गुजरी होगी, तभी ये बात लिखी। तो इस पर पूरी दुनिया में जब बहस चलती रही तो उस टाइम जहां पाल सात्र के अलावा और मार्क स्टुअर्ट के अलावा दुनिया के किसी और पश्चिम के विचारक ने औरतों की आजादी को लेकर समर्थन नहीं किया, सिर्फ दो लोगों ने। यहां तक कि रूसो ये कहता था कि पुरुष को ही समाज में श्रेष्ठ होना चाहिए, क्योंकि पुरुष ज्यादा क्रिएटिव है, ज्यादा रचयिता है, और वो ज्यादा समाज को योगदान देता है। यहां तक कि अरस्तु ने पहली बार तो ये कहा कि स्त्रियों में आत्मा होती ही नहीं। फिर बाद में अरस्तु ने उसे करेक्ट किया और कहा कि स्त्रियों में अमर आत्मा नहीं होती। दुनिया के इन महान विचारकों ने भी औरतों को दोयम दर्जे का बना के रखा, और जब जब औरतों ने अपनी आज़ादी के लिए संघर्ष किया तो आप सोचिए कि मैं पिछले हफ्ते की एक आई खबर पे आप सभी का ध्यान खींचना चाहता हूं। दुनिया का पहला देश फ्रांस बना है जहां औरतों को गर्भपात का संवैधानिक अधिकार दिया गया। उसी फ्रांस में गर्भपात पर 17वीं शताब्दी में, 18वीं शताब्दी में, 19वीं शताब्दी में मृत्युदंड की सजा थी। 20वीं शताब्दी में जाके उस सजा को ढीला किया गया, नरम किया गया। लेकिन उसी फ्रांस की औरतों ने ये बताया, इस अधिकार को प्राप्त किया कि हमारा शरीर हमारा है, उस पर हमारा हक है, और हमें उसके साथ क्या करना है, उसका पहला अधिकार, पहला दायित्व बोध हमें होता है और हमें ही मिलना चाहिए। आज भी अमेरिका जैसे विकसित समाज में गर्भपात का अधिकार औरतों को नहीं है, यहां तक कि ब्रिटेन में भी नहीं। तो भले हमें लगता है कि हमने आसमान की उन तमाम ऊंचाइयों को छू लिया है, लेकिन अभी भी बहुत दूरियां बाकी हैं। एक दिल्ली सरकार का जो विमेंस डिपार्टमेंट है, जिसके अध्यक्ष स्वाति मालीवाल जी, उन्होंने मुझे एक फंक्शन में बुलाया था इंडिया हैबिटेट सेंटर में, पिछले साल की बात है। तो सहसा मेरे मुंह से निकला कि मैं औरतों के लिए कोई भी समाज तब उपयुक्त मानूंगा
और सशक्त मानूंगा, सबल मानूंगा, जहां औरतों को लेकर के कोई अलग से कानून न प्रिवेल करता हो, जहां जितने अधिकार, जितने कानून पुरुष के लिए हैं, सामान्य नागरिक के लिए है, वैसे ही औरतों के लिए हो। वहां औरतों के सशक्तिकरण के लिए या औरतों को कोई घूर के देख दे, इसके लिए थाने में जाए और एफआईआर दर्ज कराए और उसको इसकी जरूरत महसूस हो, तब तक मैं मानूंगा कि वो समाज पिछड़ा हुआ है। तब तक मैं मानूंगा कि वहां पे काफी वर्गीकृत तरीके से, क्लासिफाइड तरीके से दोनों के बीच में दीवार बना के रखी गई है और औरत को कमजोर बना के रखा गया है, पुरुष को सबल बना के रखा गया है। हालांकि मैं बहुत गहरे में मानता हूं कि इस सभ्यता के विकास में औरतों का योगदान बहुत कम लिया गया, और जिस व्यवस्था में, जिस संस्कृति में औरतों के योगदान को कम लिया जाएगा और पुरुषों के द्वारा रची हुई दुनिया बनाई जाएगी, वहां पे परमाणु युद्ध होके रहेंगे और वहां पर महाभारत होके रहेगा। क्यों? क्योंकि जहां पे औरतों को फ्री हैंड दे दिया जाए काम करने के लिए, मैं मानता हूं कि वहां सामंजस्य अपने आप बहुत गहरा बैठ जाता है। जहां पुरुषों को आगे कर दिया जाए, वहां पे विद्वेष और ईर्ष्या और लड़ने के तमाम तरीके पहले से तैयार हो जाते हैं। वो भी एक व्यवस्था पैरेलल चलती रहती है। जैसा कि कहा जाता है कि एक युद्ध का काल होता है और एक युद्ध के शांति का काल होता है। तो ऐसी स्थिति में डॉक्टर राम मनोहर लोहिया बहुत अच्छी बात कहा करते थे। डॉक्टर राम मनोहर लोहिया ने, आप लोग पढ़िएगा, द्रौपदी पे 9 वॉल्यूम में एक किताब लिखी, और वैसी अद्भुत किताब औरतों के बारे में मैंने अभी तक अपने जीवन में नहीं पढ़ी है। सबको पढ़ना चाहिए। डॉक्टर राम मनोहर लोहिया कहा करते थे कि भारत विकास कैसे करेगा जहां की आधी से ज्यादा आबादी गुलाम है, वो पुरुषों के मन के मुताबिक कदम भर भी नहीं चल सकती। उन्होंने तो यहां तक कहा कि मेरे मित्र बिरला जी की पत्नी भी गुलाम है, वो भी बिरला जी की मर्जी के खिलाफ कोई निर्णय नहीं ले सकती। तो उन्होंने कहा कि जो गरीब आबादी है वो तो है ही, अमीरों की औरतें भी गुलाम हैं, वो भी अपने पतियों के बिना एक कदम नहीं चल सकती। उस पर उन्होंने बिरला जी का नाम लिया था अपने भाषणों में, और उस संकलन में भी है, जो किताब मैं बता रहा हूं वहां पे है इसका जिक्र। तो अगर हमारी आधी आबादी पैरालाइज रहेगी, अधिकारहीन रहेगी, शक्तिहीन रहेगी, तो उन्हीं के कोख से जन्मे हम सबल कैसे हो सकते हैं? तो फिर हम भी दीनहीन ही रहेंगे। और हमारे अंदर कितनी भी ऊर्जा और ताकत फूंकने की कोशिश की जाए, फिर मैं वही अर्धनारीश्वर से जोड़ता हूं कि अगर हमारा आधा अस्तित्व स्त्री से मिला हुआ है और आधा अस्तित्व पुरुष से मिला हुआ है, तो हमारा आधा शरीर अगर लकवाग्रस्त रहेगा तो हम तेज दौड़ कैसे पाएंगे? तेज दौड़ने के लिए जरूरी है कि हमारी माताएं, बहनें, हमारी बेटियां सबल रहें, मजबूत रहें, और कम से कम हम अगर उनके साथ अत्याचार कर भी देते हैं तो अगले पल हमारे मन में इतनी तरलता होनी चाहिए कि हम उनसे माफी मांग लें। मैं भी कोई दूध का धुला नहीं हूं, मैंने भी अपनी पत्नी को डांटा है, मैंने भी काफी कटु वचन बोले हैं, लेकिन मैं ये जरूर आज आप लोगों के सामने कहूंगा कि मैंने 1000 बार माफियां मांगी, इसलिए मेरा मन बड़ा साफ है और इतना साफगोई से इस मन से बोल पा रहा हूं। लेकिन अक्सर ये देखा गया है कि बच्चा जब पैदा होता है तो उसको बचपन से ही ये संस्कार दिया जाता है, मर्द बच्चा, लोहे का बच्चा। परुष शब्द जो है, परुष का मतलब होता है लोहा, परुष शब्द से निकल के आया है पुरुष शब्द। और बचपन से जो हमारी ट्रेनिंग दी जाती है कि परमात्मा ने स्त्रियों की आंखों में जो रोने की ग्रंथियां बनाई, उससे 1% 0.001% भी पुरुष की आंखों में कम ग्रंथियां नहीं बनाई। लेकिन आप लोगों ने पुरुष को बमुश्किल रोते देखा होगा, बहुत कम। औरतों को हम ज्यादा रोते हुए देखते हैं। और नागपाल साहब जो बता रहे थे कि शायद औरतों में जो हार्ट अटैक की बीमारियां पुरुषों की तुलना में काफी कम है, उसके पीछे यही कारण है, उनका रोना। रोना भी एक औषधि है, एक दवा है। जो नहीं रोता वो घुट के मर जाता है, जो रोता है उसको बाद में हंसने के भी बहुत मौके मिलते हैं। तो मेरा ये मानना है कि मेंटल वेलनेस की बात करना बड़ा जरूरी भी है, लेकिन मुझे लगता है कि अभी शुरुआत ही नहीं हुई है कि औरत उस जगह पे खड़ा होकर के ये घोषणा कर सके। फ्रांस की घटना को मैं बहुत बड़ी घटना मानता हूं इस पूरी दुनिया के लिए और इस पूरी मानवता के लिए। आज हमारे घर के अंदर, परिवार के अंदर, हम जैसे ही औरत थोड़ा अपने मौज में अपने इरादे से कुछ करने की हिम्मत जुटाती है और निकलती है, पहला डर ये सताता है कि ये चौराहे पे जाएगी तो पता नहीं इसके साथ क्या हो जाएगा। और इसके पीछे मैं मानता हूं कि आचार्य रजनीश ने 70s में संभोग से समाधि की ओर लिखा, जिसके बाद उनको सेक्स गुरु करार कर दिया गया। मैं बच्चा था जब मेरे गांव के 4-5 लोग पुणे में उनसे मिल के आए थे। ये बात है 87 की, छोटा था तब मैं। और पूरे गांव ने मिल के उन सभी लोगों को निकाल दिया गांव से बाहर कि ये सभी भ्रष्ट होके लौटे। उस घटना में, उसमें एक चाचा जी थे हमारे, वो मुझे बहुत प्यार करते थे और मुझे बड़ा पसंद थे। मेरे मन पे बड़ा गहरा सदमा लगा। और मैंने, गांव के बाहर वो लोग रहते थे, तो मैं बच्चा था, खेलते खेलते जाता था, उनसे पूछता था। हम लोगों को कोई मिलने उलने की बहुत रोक नहीं थी, वैसे सिंबॉलिक ही था, कोई ऐसा नहीं था कि उन लोगों को कोई मारा पीटा गया हो, लेकिन उन लोगों को निकाल दिया गया। उन लोगों से बातचीत करने के लिए गांव में हिदायत दी गई कि इन लोगों से कम लोग बातचीत करें, ये समाज भ्रष्ट कर देंगे। तो उस टाइम पहली बार मैंने आचार्य रजनीश का नाम सुना 87 में। और वो किताब, 2 किताबें उन्होंने मुझे दी। एक शिक्षा में क्रांति, रेवोल्यूशन इन एजुकेशन, वो पहली किताब मैंने पढ़ी। और दूसरी किताब मैंने पढ़ी, उसी वक्त मैं बच्चा था, लेकिन बहुत समझ में नहीं आई, लेकिन बहुत बातें समझ में आई, क्योंकि तब मैं लगभग 9 साल का हो गया था, बहुत छोटा था। मेरा बेटा अभी 12 साल का होगा 21 मई को। तो मैं उससे तुलना करता हूं तो मुझे लगता है कि मैं अपने बेटे से काफी आगे था। तो उस किताब को मैंने तब पढ़ा। फिर उसके बाद मैं 8वीं क्लास में गया, तब पढ़ा। फिर उस किताब को मैंने 95 में, जब मैंने 10वीं पास कर ली, तब पढ़ा। 10वीं पास जब मैंने कर ली तो उस किताब का वर्ड बाय वर्ड, शब्द बाय शब्द मुझे समझ में आया, मेरे जहन में उतरा। उस दिन मुझे लगा कि हम किस देश में रहते हैं। एक ऐसे आदमी को सेक्स गुरु कह के लोगों ने समाज से निकाला, जिस आदमी ने औरतों की लिबर्टी को लेकर के, स्त्री पुरुष के भेद को लेकर के इतनी गहरी और बड़ी बात कही। और आदमी के जीवन में, भारत इकलौता ऐसा धर्म है इस पृथ्वी पर, या सनातन इकलौता ऐसा धर्म है इस पृथ्वी पर, जिसमें एक शब्द है जो दुनिया के किसी धर्मों में नहीं। वो शब्द है मोक्ष। और मोक्ष ईश्वरत्व के पार का भी शब्द है। जैसे तमाम हमारे पुराणों वेदों में इंद्र को भी विष्णु के सामने याचना करते हुए सुना गया कि प्रभु मुझे मोक्ष दे दो। और इस पृथ्वी पर जीते जी कुछ ही लोगों को मोक्ष मिला। जैसे मैं उसमें भगवान महावीर का नाम ले सकता हूँ, भगवान गौतम बुद्ध का नाम ले सकता हूँ, मैं मीरा का नाम ले सकता हूँ, कबीर का नाम ले सकता हूँ। ये तमाम वो लोग हुए जिन्होंने जीते जी देवताओं को भी मजबूर किया, और देवताओं ने भी उनसे आके स्तुति वंदना की। एक कहानी है बौद्ध धर्म में कि जब बुद्ध को ज्ञान प्राप्त हुआ तो बुद्ध 7 दिनों तक पूरे मौन में चले गए, उन्होंने बोला नहीं कुछ भी। तो कहानी ये बताती है, हो सकता है झूठी भी हो, लेकिन कहानी बड़ी प्रीतिकर है, बड़ी मन को लुभाने वाली है, अच्छी लगती है। तो कहानी ये बताती है कि इंद्र देवताओं के साथ आए और उन्होंने कहा कि पहली बार पृथ्वी पर आप जैसा कोई बुद्ध पुरुष उतरा है, अगर आप बोलना बंद कर देंगे तो मानवता का उद्धार कैसे होगा। तो भगवान बुद्ध ने कहा कि मैं किसके लिए बोलूं, जो जानते हैं उनको बताने की जरूरत नहीं, और जो जानना नहीं चाहते उनको बताने का कोई फायदा नहीं, इसलिए बोलने का कोई अर्थ नहीं। तो देवराज इंद्र ने कहा कि भगवान उनके लिए बोलिए जो इन दोनों के बीच में फंसे हुए हैं, जिनको थोड़ा धक्का की जरूरत है, जो ट्रांसफार्म हो जाए, रूपांतरित हो जाए। तो आप सोचिए कि भगवान बुद्ध ने भी अपने संघ में औरतों के प्रवेश पर तब तक बंदिश लगा रखी थी जब तक उनकी मुलाकात यशोधरा से नहीं हुई। और बुद्ध का यशोधरा का जो संवाद है, मैं मानता हूं कि मानवता का सबसे कीमती संवाद है। और मैथिली शरण गुप्त की जो कविता है, यशोधरा और उसकी सखी के बीच का जो संवाद है, वो भी बड़ा भावुक है, बड़ा मार्मिक है। जब बुद्ध के पिता राजा सुद्धोधन ने बुद्ध के 10 बचपन के मित्रों को भेजा और उनमें से 9 मित्र वापस नहीं लौटे, और बुद्ध भी कभी अपने पिता से मिलने के लिए नहीं लौटे, तब 10वें मित्र को राजा सुद्धोधन ने ये कहा कि मुझे पता है कि जब तुम गौतम बुद्ध से मिलोगे तो तुम भी नहीं लौटोगे, लेकिन मेरा एक संदेश दे देना बस, कि राजा सुद्धोधन अपने पुत्र से मिलने के लिए तड़प रहा है, एक बार मेरे से आके मिल ले। उस मित्र ने राजा सुद्धोधन की ये बात बताई और वो भी संघ में शामिल हो गया। राजा सुद्धोधन से मिलने बुद्ध आए, और जब कपिल वस्तु पहुंचे तो वहां के एक सिंपल से धर्मशाला में जाके रुक गए। पूरे कपिल वस्तु में हड़कंप मच गया कि सम्राट का बेटा आया है और जाके धर्मशाला में। तुरंत सेनापति आ गया, महामंत्री आ गए। तो बुद्ध ने सबसे हाथ जोड़ के कहा कि मेरी एक जीवनचर्या है, मेरा जीवन जीने का एक तरीका है, इसे बड़ा मुश्किल से पाया है मैंने, मुझे यहीं रहने दिया जाए, मेरी प्रार्थना है, पिताजी से जाके बोलिए मैं कल उनसे मिलने आऊंगा। तो बड़ी मुश्किल से उनको धर्मशाला में रुकने दिया गया, क्योंकि उनके लिए तो महल तैयार थे। खबर आ गई थी, गुप्तचर लेके आ गए थे कि बुद्ध चल पड़े हैं कपिल वस्तु के लिए पैदल। तो जब वो पहुंचे अपने पिता के यहाँ दरबार में, ये कहानी इसलिए बता रहा हूँ, कहानी अच्छी भी है और इसके बाद औरतों के ऊपर एक गहरा विमर्श भी है यशोधरा और बुद्ध के बीच। तो जब दरबार में पहुंचे तो राजा सुद्धोधन बेहवल हो गए और उन्होंने अश्रुपूरित आंखों से अपने बेटे को गले लगाया, लेकिन बुद्ध की आंखों में जरा भी आंसू नहीं आए। बुद्ध सबसे मिले, सबका हालचाल पूछा, सब लोग बुद्ध के चरणों को सबने स्पर्श किया। राजा सुद्धोधन ने भी अपने पिता का चरण स्पर्श किया, अपने पुत्र का, सॉरी। उसके बाद बुद्ध बैठे, सबसे बातचीत होने लगी। तो आखिर उन्होंने पूछा कि यशोधरा नहीं दिख रही। तो राजा सुद्धोधन ने कहा कि यशोधरा ने यहाँ आने से मना कर दिया। उसने कहा है कि अगर तुमको उससे मिलना है तो तुम उसके महल जा सकते हो। तो बुद्ध ने कहा कि मैं अवश्य जाऊंगा यशोधरा से मिलने। और बुद्ध वहां से निकले और यशोधरा से मिलने गए। अब देखिए दोनों के मिलने का जो सुअवसर है, जो स्क्रीन प्ले है, वो कितना जबरदस्त है। तनुजा जी बैठी हुई यहाँ पे, कि अपनी पत्नी के दरवाजे पर जिस महल के मालिक ऑटोमेटिक बुद्ध ही थे, जिसको ठुकरा के गए थे, वलकल वस्त्र धारण किए हुए, हाथ में भिक्षा लिए हुए, बुद्ध आवाज देते हैं भवत भिक्षाम देही। ये नहीं कहते हैं कि मैं बुद्ध हूं, मैं आ गया हूं, निकलो। और दरवाजा खुलता है और यशोधरा बाहर निकलती है और भिक्षा के रूप में राहुल का हाथ बुद्ध के हाथ में दे देती है। बहुत यशस्वी औरतें हुई, लेकिन यशोधरा जैसी भी औरत इस पृथ्वी पर बड़ी कम हुई। उसके बाद बुद्ध कहते हैं कि मुझे अंदर आने के लिए नहीं कहोगी? तो यशोधरा कहती है कि बिल्कुल आप आइए। और यशोधरा ने उनसे एक ही सवाल पूछा कि छत्राणियां अपने पतियों को तिलक लगा के युद्ध के लिए विदा करती हैं और उनको ये भरोसा होता है कि हमारा पति कभी वापस नहीं लौटेगा, तो क्या तुम मानव कल्याण के रास्ते पर जा रहे थे तो तुम्हें मेरे ऊपर जरा भी भरोसा नहीं आया? एक दिन के पैदा हुए बच्चे को और मुझे सोते हुए छोड़ के चले गए, क्यों चले गए? मुझे सिर्फ इसका उत्तर चाहिए। तुमने कैसे मान लिया कि मैं तुम्हें रोक लेती? तुमने ये क्यों नहीं माना कि मैं तुम्हें विदा कर देती? एक बार तुम कह के तो देखते। यानी तुम इतने बड़े संत हुए, फिर भी तुम अपने पूर्वाग्रहों से मुक्त नहीं हो पाए। और कार्ल जुंग ये बात कहता है कि इस पृथ्वी पर कोई भी मानव अपने पूर्वाग्रहों से और अपनी पक्ष से, यानी पक्षपात से, पार्शियलिटी से मुक्त नहीं हो पाता। कार्ल जुंग इस सदी, एक आध सदी पहले के विचारक हैं, और महात्मा बुद्ध की ये बात मैं आज से 3500 साल पहले की बता रहा हूं। और जब बुद्ध पूरे वक्त मौन रहे तो यशोधरा ने पूछा कि फिर बताओ अब मेरे लिए क्या? तो बुद्ध ने कहा कि तुम्हारी जैसी तेजस्वी औरत भले ही मेरी बीवी थी, लेकिन तुम्हारे इस तेज का सामना मेरे सामने कभी नहीं आया और इससे परिचय मेरा कभी नहीं हुआ था। आज से मैं संघ में औरतों के प्रवेश की अनुमति देता हूं। और आप सभी पढ़िएगा कि यशोधरा के उस संवाद के बाद बुद्ध के संघ में यशोधरा कहां गायब हो गई, कोई उसका प्रसंग नहीं मिलता। यानी कि यशोधरा, बुद्ध ने तो 12 साल तप करके उस पद को पाया था और बुद्ध बुद्ध बने थे, लेकिन यशोधरा ने बुद्ध के इंतजार में उस पद को पा लिया। वो संघ में जाने के बाद आश्रम और कुटिया में कभी नहीं गई बुद्ध से मिलने। एक सामान्य भिक्षुक की तरह उसने अपना पूरा जीवन बिताया और उसने बुद्ध पर कभी अपना अधिकार हासिल नहीं किया। तो भारत उस मर्यादा, उस परंपराओं वाला देश है, लेकिन भारत में स्त्रियों की जितनी दुर्दशा हुई शायद दुनिया में बहुत कम देशों में हुई। और इसके पीछे एक ही कारण रहा कि जो धर्मों का द्वंद्व रहा, जो हमारे यहाँ शैव वैष्णव टाइप के संप्रदाय रहे, हमारे यहाँ शंकराचार्य रामानुजाचार्य में जो दुनिया भर के विवाद रहे। शंकराचार्य ने बुद्ध की इतनी आलोचना की, उसी बीच पोंगा पंडितों की इतनी बड़ी फौज तैयार हो गई कि जो हमारी सुनहरी परंपरा थी औरतों को सम्मान देने की, जो वैदिक परंपरा थी, जो हमारी पुराणों की परंपरा थी, वो सब समझिए कि जमीन के नीचे रसातल में, पाताल में पहुंच गई। और आदमी रचयिता हो गया और स्त्री उसकी दासी बन के रह गई। और दासियों की कोई हैसियत नहीं होती, दासों की कोई हैसियत नहीं होती। जब समाज में औरतों को लंबे लंबे समय तक, यानी 5000 साल तक की दास्ता झेलनी पड़ी, तो दास्ता फिर हमारे डीएनए में उतर आती है, हमारी आत्मा में, हृदय में, हमारे रोम रोम में उतर आती है, हमारी धमनियों में उतर आती है। फिर उस दास्ता को तोड़ने के लिए जो प्रयास मौजूदा समय के 200 सालों में हुआ, मैं वो मानता हूं कि पिछले 5000 सालों में उतना प्रयास नहीं हो पाया जितना 200 सालों में औरतों का जीवन बदला है। और मेरा ये मानना है कि औरतों का जीवन और बदलेगा और बदलना ही चाहिए। क्यों? क्योंकि फिर से मैं उसी बात पे आऊंगा कि अगर हमारा आधा शरीर लकवाग्रस्त रहेगा, पैरालाइज रहेगा, तो हम एक स्वस्थ समाज की रचना नहीं कर पाएंगे। आज, पहले जब बच्चा पैदा होते थे, सन 80 से पहले या 85 से पहले मान लिया जाए, तो हर बच्चे को पीलिया जरूर होता था, टेटनस जरूर हो जाता था, कोई ना कोई बीमारी हो जाती थी। उसकी पूरी जीवन ऊर्जा उस बीमारी से लड़ने में खर्च होती थी। आज के डेट में बच्चा जो है फुली मेडिकेटेड दुनिया में पैदा होता है। गर्भ धारण करने से लेकर डिलीवरी के दिन तक, अब तो यहां तक है कि बच्चा की आंख किस कलर की होनी चाहिए वो भी डिसाइड किया जा सकता है। उसके डीएनए को इंप्रूव किया जा सकता है। कोई बीमारी पता चल गई, जैसे बहुत अमीर घरों के बच्चे जो आज पैदा होते हैं, उनका बहुत डिफरेंट लेवल पे चेकअप होता है। वो गर्भ में ही पता कर लिया जाता है कि इसको कोई बीमारी तो नहीं होने वाली, और बीमारी हो रही तो उसको चेंज कर दिया जाता है। जो जीनोम थेरेपी से अल्टर कर दिया जाता है डीएनए को, उस बीमारी को दूर कर दिया जाता है। तो आज का जो बच्चा पैदा होता है वो फुली मेडिकेटेड दुनिया में पैदा होता है। बच्चा में मैं लड़की लड़का दोनों को कर रहा हूँ, इसको इसलिए मैं आज यह इस मन से बोल रहा हूँ, तो लड़का लड़की नहीं बोल रहा हूँ, बच्चा बोल रहा हूँ। फुली मेडिकेटेड दुनिया में पैदा होता है। और फुली मेडिकेटेड दुनिया में पैदा होने का पहला मुझे समय का मिल गया है नोटिस, इसलिए अब बंद कर रहा हूँ। तो क्योंकि कार्यक्रम है, लोगों को जाना भी है, मुझे भी एक जगह जाना है, शिवरात्रि की कई पूजा है, मैं तो अभी आज मंदिर भी नहीं जा पाया। तो जो बच्चा फुली मेडिकेटेड दुनिया में पैदा होता है वो पूरा सेव्ड एनर्जी वाला बच्चा होता है, बहुत ताजा बच्चा होता है, वो बीमार नहीं होता, बीमारी से लड़ने में उसकी एनर्जी खर्च नहीं होती। तो ऐसा बच्चा ज्यादा क्रिएटिव होता है, ज्यादा साहसी होता है, डरपोक नहीं होता, वो ज्यादा समाज को दे सकता है, ज्यादा कुछ बना सकता है। तो अब ये जो जनरेशन पैदा हुई है, इस जनरेशन से हम सबको ज्यादा उम्मीद करनी चाहिए। जैसे हमारा बच्चा पैदा हुआ है या जो हमारे बच्चों के बच्चे पैदा होंगे, वो एक नई दुनिया की रचना करेंगे। और आज के डेट में अपनी बात 1 मिनट में खत्म कर रहा हूं। एक पॉइंट रह गया जिसने औरतों को सबसे ज्यादा ताकत दी है, वो है हमारा सोशल मीडिया। मीटू मूवमेंट भी उसका एक उदाहरण है। और एक और उदाहरण दूंगा कि जब मणिपुर में 2 औरतों को नंगा करके घुमाया गया, तो किसी मेन स्ट्रीम मीडिया ने या मेरे जैसे टीवी चलाने वाले किसी ने नहीं दिखाया। पता नहीं हो था या नहीं था, मुझे तो लगता है लोगों के पास था, लेकिन लोगों ने डर के मारे नहीं दिखाया। सोशल मीडिया पर एक किसी की पोस्ट ने पूरे देश में उबाल ला दिया। पार्लियामेंट को स्पेशल सेशन बुलाना पड़ा, 65,000 पैरामिलिट्री फोर्सेज लगानी पड़ी, और सोशल मीडिया ने मेन मीडिया का जो दायित्व है, जो कर्तव्य बोध है, उससे आगे बढ़ के बहुत बड़ा काम किया। तो इस तरह की जो कुछ एक दो छोटी छोटी घटनाएं होती हैं, वो समाज को एक तरीके से क्वांटम जंप देती हैं। और वो क्वांटम जंप तभी आता है जब कोई न कोई निर्भीक तरीके से करने के लिए तैयार होता है। चैनल वाले लोग तो डर जाते हैं, लेकिन सोशल मीडिया पे पोस्ट करने वाले को बिल्कुल डर नहीं लगा होगा। उसको लगा होगा कि यह मेरा अधिकार है, और इस अधिकार के तहत ये मेरा अकाउंट है, और इस अकाउंट के तहत ये चीज़ हमें पोस्ट करनी चाहिए। उसने पोस्ट किया, और मणिपुर में मैं मानता हूं कि जो दुर्दशा औरतों की हो रही थी उस पर लगाम लगी, सरकार ने कदम उठाया, और वहां पे शांति बहाली की गई। जितना औरतों के साथ अत्याचार हुआ था, रेप हुए थे, दर्दनाक घटनाएं हुई थी, वो बहुत सारी अभी भी मीडिया में रिपोर्टेड नहीं है। ऑफलाइन से हम सब मीडिया वालों को पता है। लेकिन जब एक घटना ने इस कदर से समाज को बदलने का काम किया, तो चीज़ें बदली, और इसी तरह से चीज़ें बदलती हैं। और मेरा ये मानना है कि औरत पैदा नहीं होती, पैदा की जाती है। इसका सिर्फ एक लाइन में अर्थ यही है कि उसको चुनने का अधिकार, चुनने की आज़ादी जब हम सब उसके बारे में सजग रहेंगे तभी मिलेगा। अगर सजग नहीं रहेंगे तो नहीं मिल सकता। तो इसी के साथ मैं अपनी बात समाप्त करता हूं। एक पैनल डिस्कशन भी है, अभी आप लोग उसको सुनेंगे। जय हिंद, जय भारत, धन्यवाद।
Thank you, Mr. Rai. I would like to invite Pooja ma'am and Vivek sir to kindly felicitate Mr. Rai.
एक सरप्राइज है उपेंद्र जी के लिए भी, एंड आई विल इनवाइट माय फ्रेंड्स तनुजा एंड अपर्णा जी टू कम. Our organizing committee is giving him a commemorative award for being an inspirational change maker in media. Please join us to felicitate him. अपर्णा जी प्लीज आइए, बहुत बढ़िया, प्लीज आइए, आप आइए प्लीज. आप
नहीं नहीं नहीं, बिल्कुल कोई नहीं, टाइम।
So now, without further ado, I am announcing the next panel. And the next panel, also we have a little, little change there. Kavya, will you announce it? Yeah.
So the topic for our next panel discussion is navigating the rough terrain, challenges of mental health practitioners and organizations. The moderator is Dr. Nimesh Desai, senior psychiatrist and former director of Institute of Human Behavior and Allied Sciences, Delhi. Also, we would like to welcome all our panelists and as they join us on the stage. Ms. Sonal Kapoor, founder of Protsahan India. Dr. Vibha Sharma, Professor, Department of Clinical Psychology, Institute of Human Behavior and Allied Sciences, Delhi. Ms. Shrinkla Sahai, Psychotherapist and Course Director, Swayam Foundation. Ms. Shweta Goswami, Founder of Nirmal Initiative. Ms. Subuhi Safvi, Trauma Recovery Coach representing safety. And Mr. Gaurav Bansal, Advocate at the Supreme Court of India.
So, Dr. Nimesh Desai could not join us today in person. He's joining us from Ahmedabad. He will briefly up what he wanted to say today and the questions he sent to me. So, I will moderate the panel on his behalf later. Over to Dr. Desai. Audio, please. Tech team, audio, please. Dr. Desai, you have to unmute yourself, please.
Can you? I have unmuted. Can you hear me now?
Yes, we can. Please go ahead, sir.
Okay, thank you. Thanks so much. I'm going to be really quick fire and rapid. Thanks, Pooja and Vijay both. We're talking about navigating the rough terrain, and all these five colleagues, I'm sure Sonal, Vibha, Shranka, Suboi, and Gaurav will do great justice. But let me try and make a few remarks that will possibly set the tone for this panel, if not the rest of the day. First of all, women and mental health, or mental health for women, is essentially a huge paradox in one particular manner, besides being a double jeopardy. One, gender issues and men and women issues have been ancient from the time immemorial. Mental health is a relatively new subject. We as human race are learning to grapple with mental health. And so how do we handle this double jeopardy? It's bad enough. The combination is very bad. I don't need to elaborate, but I want to add two more points that make the jeopardy triple and quadruple. Let's not forget the socio-economic deprivation and the classes, and how the mental health of socio-economically deprived women actually is much more of a concern and much larger concern. I'm sure Gaurav and other colleagues will talk about homeless and other marginalized women. I also want to flag here the quadruple jeopardy. Women with disabilities, physical and or intellectual and developmental, is actually that much worse. And so I had decades ago to learn about social determinants of health and mental health. I am now beginning to talk about economic determinants of mental health, and I'm sure that will be featured somewhere. The second point that I want to make is this. About 60 years ago, in 1964, there was very good research that was referred to since the morning, saying that women have rates of depression about double or triple the rates of depression in men. This is, of course, a hugely skewed finding, but I only wonder, if you look into the crystal ball, as the gender sensitivity becomes better, as society becomes more gender neutral, and women become more empowered, will there be a time where possibly the rates will not only stabilize but might even change? So how does this panel look at the mental health of women and men 50 or 60 years from now? My poser. Is it possible that we will have what's a common social phenomenon? Overcorrection. And I hope not. But most importantly, uh, again, something that I will revert to, and that's my third and possibly last but penultimate point. Nothing about us without us is something that I have learned from the sector of disability. Uh, Gender issues and issues of health and mental health also require the same. And so, to that extent, Pooja and Vijay, it's been great that you have a fairly good equitable participation. I hope we can continue to do that. I hope we don't reach a day when men feel marginalized, much as history might actually justify women taking over and men being marginalized. If any one of you has seen the movie Man Up to This Point only, you will recall, and if you haven't, please, tonight or in the next few days, look up the movie Man Up to This Point Only. That's a futuristic look at gender equations, fairly negativistic and utopian. Lastly, the near complete form of art, filmmaking, I dare say, actually comes from both men and women directors. And so, my last point is that sensitivity and the corrective action for gender related mental health issues, or all gender related issues, actually can come from both. And like somebody was saying, a participatory collaborative approach rather than us and them. And Pooja, I will stop there with a customary but sincere thanks to you and Vijay. And thank you so much for carrying my questions to the panel. Thanks, Pooja.
Thank you, Dr. Nimesh. Thank you so much, tech team. Yeah, sir can be. Sir is watching us on YouTube, and I hope so many more students and others are too. In positive time, I had to request our next speaker, Dr. Dhawan, to please give us some time for lunch. So after this panel, we will have lunch, and then he will deliver his address. So that's the change in the schedule. And all of you here who have to make change in their schedule, please make it accordingly. Because there is less time, so instead of making it question answer, and because sir is not here, but what sir had made are points on which he wanted each one of you to speak. So I'll just float that point to each one of you, and you can take about 4 to 5 minutes each to, elaborate on that particular point that sir wanted each of you to take up. So I'll first go to Sonal. And Sonal comes from Protsahan India, and they've been working with teenagers and young people. And sir says, Sonal, what makes mental health services difficult to be made available for girl survivors of CSA? So that is what he wanted you to speak about.
Thank you, Pooja, and thanks everyone for having me here. I think when we're talking about access, we also have to understand that no matter how much we, try and understand our Shastra and Purans, and as important as they may be in the culture of this country, विवेकानंद से पहले अगर हमने अम्बेडकर को नहीं समझा, then a lot of it we have lost the plot already, is where I'll start. मेरा जो काम है प्रोत्साहन के थ्रू मार्जिनलाइज्ड बच्चियों के साथ रहता है, बच्चों के साथ रहता है. मैं एक दो एग्जांपल दूंगी and then I'll quickly come to to set the context and then of course answer this piece. So the kind of bachas I work with, right? For example, ये अब तो खैर प्रोत्साहन as an institution is much bigger. But when I started as a lone social entrepreneur, or whatever definition the world wants to give you, you start with zero resources, right? So and I do understand as a Hindu upper caste woman, my access to resources should have been easier, right? What if अगर मेरा सरनेम कपूर है, मैं यहाँ बैठ के नहीं कहूँगी कि I didn't have any resources and I was the if it was difficult for me, imagine somebody who's from Odisha or Bihar or Jharkhand with Sahu ka surname to access something with, leave alone the men, just the system wanting to support her with whatever she was wanting to do in her community in terms of community mental health, right? So जिन बच्चियों के साथ हमारा काम रहता है वो ट्रैफिकिंग भी नहीं. आज सुबह मेरी डॉक्टर स्नेहा से बात हो रही थी, who's a fabulous art-based therapist sitting in the room, and we were having a chat that the conversations with the girls that I have in प्रोत्साहन, ये वो बच्चियां हैं जो ट्रांजैक्शनल सेक्स के लिए 2 घंटे 3 घंटे के सेक्स वर्क के लिए आधा किलो आटा 1 किलो चावल आधा किलो टमाटर लेकर वापसी आती हैं. ये वो बच्चियां हैं कि जब क्लासरूम, अब हमारे जो कम्युनिटी मेंटल हेल्थ स्पेसेस हैं जहाँ पे ये बच्चियां आके दे transitioning from streets to schools and all of that. I remember this one child, I'll not take her name, let's call her A. So classroom khatam ho gaya, us din class khatam ho gayi. This child, so I was sitting in the stairs and saying free hugs, and bachche sab aake hug karke they were going. Shuru ki, it's been more than 10 years now to this. But I can't forget this child at all. और ये बच्चा आता है, so as every child is coming and hugging me, this child comes, little tiny, 8-year-old, 7-year-old, comes, turns around, bends and stands. And I didn't understand why. And I look at my social worker who's standing in a corner, and I'm not a professional social worker, right? So mere liye kuch spaces, ab I understand feminist social work, ab I understand, the arts-based therapy piece. But at that point in time, it was just, jo subhe, I think, Medicity के जो सर थे उन्होंने जो बात रखी कि we all need just first aiders of mental health. ये बड़ी everybody can't be a psychiatrist, psychologist, right? Like let's just be honest. All we really need is a human mind and a human brain and a soul, right, to talk about the common sense pieces. And ये बच्चा आके उल्टा खड़ा हो गया, and I look at my social worker because I was not understanding कि क्या हो रहा है. And then वो इशारा करती है मुझे कि just leave it at that and I'll talk to you later. And then she tells me, ma'am, her father rapes her every night. Her only understanding of love is when somebody fingers her or abuses her from behind. For an 8-year-old, right? So that's the context of community mental health. Now let's quickly get to what Dr. Nimesh was talking about, right? I think in my understanding of what access जिस चीज को मुश्किल बनाता है is सब कुछ इतना superficial है. Everybody is trying to impress their boss, is trying to impress a funder, is trying to impress a log frame में सब outcome output लगा रहे हैं. I don't know, बहुत सारे non-profits NGOs के साथ ही बैठे हैं. Even when arts based assessments करते हो आप, कितने लोग process को value करते हैं? कितने लोग, everything is a quick fix in this world of quick fixes. Nobody has the time to give the child the gift of time. सिर्फ सुनना है, right? And I think Dr. Nagpal ने इतना सुंदर बोला कि nobody has the time or the patience. So at Protsahan, what we're really trying to do is we working with now, जो जर्नी 17 लड़कियों से शुरू हुई थी 14 साल पहले, आज 81,000 प्लस लड़कियां हैं. और ये वो बच्चियां हैं from different spaces of marginalization and intersectionality of marginalization. Think of a मुसलमान लड़की जो गरीब है और जो violence के हिंसा के चक्र में फंसी हुई है, उसकी intersection will be very different from some of us sitting here, right?
Yeah.
So access to resources, access to law, like I always say, is very different from access to justice,
Yeah.
right? Just having a lawyer will not get you justice,
Yeah.
right? And that is where we need to start this
Yeah,
conversation.
thank you, Sonal. Thank you for that. We have a lawyer on the panel. We'll come to that. And I will again reiterate, these are difficult conversations. Some of us might mention suicide, abuse, and that might be disturbing for some of you. Please step outside. There are people, practitioners who can assist you. I will now take it up with Dr. Vibha Sharma. And Dr. Nimesh wanted you to speak about the sensitivity of mental health clinicians in their routine practices when they come across children or even adult women who come from a domestic violence and sexual abuse space.
Yeah, first of all, thank you for having me on this panel. What I can speak from my day-to-day experiences in our clinical practice, I'm coming from a tertiary care hospital and where Dr. Desai, Nimesh Desai was director a few years back. What we come across every day, even we mental health professionals, except just a few of them, how much time actually they are giving, as rightly she said and Dr. Nagpal said, very hurriedly, though we say to our colleagues that whoever woman is coming to you, whoever child is coming to you, please explore about the negative experiences, whether this woman coming with depression or with anxiety or with most of them have dissociative disorders, as Dr. Samir Parekh also talked, that having so many somatic problems, headaches, body aches, this problem, that problem, not actually able to tell about the problems she might be facing at home or at workplace. So we need to talk to them. We need to really explore, to ask whether you are having these kind of problems. But unfortunately, very few. And that too, I find even the women practitioners are not habituated to it. They are just, and barriers maybe because like a place where where I'm coming from has a huge OPD. As we always talk that we are very less in number mental health professionals. So we don't have time to talk into such details. Psychiatrists generally just write medicines. How are you? How are you feeling? What are the symptoms? And then just send to psychologists and social workers. And me, fortunately, being a psychologist, I have made it a point that let me ask the woman about her home situation. And most of them, it is my experience, I have researched about it also, that the women especially coming with somatic problems, having episodes of unresponsiveness, looking like unconscious, being possessed by some Devi, Devta or some other person, are most of the women who are sufferers of either domestic violence or some other kind of abuse at home or at workplace or outside the families. And the incest, as she rightly talked about the child. Incest is so common. When we try to talk in this society, even like me, I am a clinician for last 25 years. When someday if I want to talk in my house about incest, my husband or my family members say, what are you talking about, rubbish? This can't exist in our society. We are so religious persons, but it very much exists. So we as mental health professionals probably should down these barriers, we have to tackle with these barriers. First of all, we should try to explore. A woman coming in distress, a child coming in distress, we should know how to talk to them.
Right.
Before giving them any therapy or any medicines, let us try to understand, give them time to listen. And just believe me, even listening to them, giving some comfort, helps them, heals them. So what we need to do is healing, not only just providing medicines.
Right.
That's what is required. And coming just a minute about the barriers. Barriers start from, like I say, from the government providing funds for women in mental health to the family and society. It's very difficult to bring a woman for treatment, as we talked in the last session also. Because in India, the women, especially lower middle, even matlab, to bring them there, a family member is required. Either a husband or father or son has to accompany. And the women who are coming from lower socioeconomic status, for them having that kind of fare, coming by bus or auto, whatever, they may not have money to bring the lady there. That's why if a male of the family is ill, he would be brought. But if a lady is ill, as rightly said, until unless she is creating problem, she is not working, only then she would be brought.
Yeah.
And unfortunately, this happens mainly in middle and upper middle class and higher class. I have seen the daily wagers bringing their wives for treatment, but not a middle class, not a manager.
Right.
Either the women come alone or with their children or with some friend. So
Yeah.
these are the barriers we really need to
Yeah.
break down.
No, it's all intersectional, as rightly Dr. Vibha has said. And I will take that forward to now Shweta, who's working with communities. And we would like you to throw some light on the common societal and structural barriers when we are trying to provide timely mental health services, and also to reflect on some of our other institutions like police. When they intervene in cases of especially abuse, or there is a sexual, abuse or sexual crime, and it's a woman victim. So what kind of experiences you've had there, please?
Um, so instead of experience, can I talk about how we work and
Yeah,
what we
sure.
understand?
Please go ahead.
So the first question is what happens, like what violence does to us? Any of you can respond. I think we can have it interactive, right?
We
Like,
don't
no?
have time.
Okay.
We'll do it later.
Okay.
They have an
But
open
if
mic
anyone for
later in the
quick
day.
one,
Yeah.
But yeah, yeah. So what we understand at Nirmal Initiative is that we are like the world is our home. And when someone does violence upon us, it shatters the sense of home. And now, and home in the body, home as the space. And this is what we understand. And the first thing we understand here is that ab kya karna hai? So certainly violence would lead to certain psychological impacts that need to be addressed by the experts. But what are the things that we can do? Because the home is shattered, what is our responsibility of the stakeholders at every step for the survivor? And that is to bring back the pieces by believing, right? So these are very, like, I think simple. How hard it is to tell somebody this happened and I'm sorry, but we are here. And so this is the kind of language we are trying to give to these stakeholders so that they do not further harm or shatter the home, but as a community we take a responsibility to bring back the pieces and recreate the home. So again, we usually think of people as, if violence is happening, we think, okay, there's victim, right? And certainly there is victimhood of structures, patriarchy, caste, disability. And within this, now, this is the we are victim of, right? But we are also survivors at the same time. So it's not binary of victim and survivor. I'm always survivor. I'm surviving the structures every day.
Yeah.
Right? And that's the victim, that we need to shatter. That structure we need to
Yeah.
shatter. So there's no binary as such.
Right.
A person knows the best. And if we agree on that, she knows the best, he knows the best, they know the best.
Right.
So this is the
Of
thing.
course, it has to come from people. It has to be people first. And Sonal often talks about that even children know they have agency and their consent into what they want or how they would want, how much of what legal or medical decisions they would want to participate in.
Indeed.
I will take this now from you, Shweta, to
Yeah.
Subhuhi, who works on trauma specifically. Subhuhi, I would dare to say this in this full hall. We are a very trauma-inducing society. So please shed some light on what should we unlearn not to be a trauma-inducing society.
Well, to begin with, I'd just like to share something. I'm a part of a survivors group on Facebook, intimate partner violence survivor group on Facebook. And one day I just asked them, like, what stops you from, seeking help? And I thought that the answer would be finances, but the answer was judgment. Everybody is still scared of the judgment that they'll receive when they approach someone who's supposed to provide a safe space. So that's how we've created, like, as you said, our idea of home is taken away. Our idea of home was never there to begin with if we experience violence from our childhood times. And unfortunately, even when we actually have loving parents, we don't always live in a loving society. There's always so many stereotypes, so many expectations, so many ideas that are forced upon us that we don't really adhere to, belong to, or really even like, but we're expected to live them out. If you're a girl, then you have to only be nurturing and kind, and you have to think about having children and please everybody. And when you're pleasing everybody, I mean, where do you stop pleasing?
Right.
You know that you don't want to, and you know that it's not right, and you might feel very uncomfortable and unsafe, but you will still like kind of keep doing it because it just seems like that's the right way to do it. That's what I've been told, that's what I'm supposed to feel. And additionally, I just want to also add here that I was unmarried for a very long time. I think I was 36 when I finally decided, okay, fine, we'll sign some papers. And I still don't really identify as a wife. But for the longest time, I was like, I mean, random people would just come and ask me, why aren't you married? It was like I had committed some kind of horrible sin. And then they tell me, but you have to have children. And I don't want to have children. But like, what will your parents say? How can you? I mean, every normal conversation for a woman and a decision that she takes is something that we have to justify at every step. And
Right.
that is exhausting. And it's like, mental health wise. And then because all of these things are completely normalized, it becomes harder and harder because if something is already normalized, then how will you seek help?
Yeah. I understand. Yeah, so we have so many important points coming across here, and now I will take it to Gaurav ji because you used some legal verbs there, which should have been legal, but we use them in our personal lives, like judgment. And I would also like Gaurav ji to take the police part of it. So it's institutions together, whether it is marriage or family or police or our judiciary or allies like him, it's everybody together who can make a difference. इट कैनॉट बी के पिज्जा का एक स्लाइस अच्छा बेक होगा और बाकियों को कच्चा छोड़ देंगे. It has to be done in a holistic way. So Gaurav ji, what has been your experience with judiciary and police, particularly with women survivors of psychosocial violence or even domestic violence and abuse?
First of all, I wish to say that those who don't know, but Dr. Desai is a source of inspiration for me. Reason behind the same is that when I was filed up my first PIL regarding the mental health institutions in India, so I was just looking for an expert, and I was just trying to have dialing all the directors of the mental health establishments of India. So suddenly I just called Dr. Desai कि sir, this is the case. तो Dr. Desai said, oh तू वही बंसल है क्या जिसने केस फाइल करा है? तो बोले हाँ चल मिलते हैं. And then the journey begins. And see, as a lawyer, we may know little bit of law, but the expert persons are the persons who are dealing with the same. And in that sense, I have learned a lot, and I'm keep trying to have a guidance from Dr. Desai. He was a source of inspiration. So, but at the same time, he knows my limitations also. वो मेरी कमजोरी जानते हैं. That is why he said कि गौरव homeless के बारे में बात आएगी. ठीक है, तो मेरा दिल कुछ ज्यादा धड़कने लगता है homeless के लिए. Basically now coming to the question, before coming to that, the what the judiciary says. See, judiciary, the persons who are running the judiciary or who are the judges are also a part of the society, and that is why many times I got a very good orders if the said judge is having a sensitization of what the mental health is and why we say mental health. Now the concept is changed into psychosocial disabilities, and that is why we are saying psychosocial is because the the social society has a major role to play into it when we talk about the mental health care, mental health treatment, etc. And I was just noting down some of my points. So as far as the judiciary role is concerned, it's a mixed one. I have got a very wonderful orders. It's still pending since some of my petitions are still pending since last 6 years, and we are getting a favorable one. The court is just basically requesting the chief secretaries to meet, and it is because of the same that now the all the governments are meeting every 4 months, and they are just talking about the mental health. That's one of the achievement. But at the same time, see, the situation is really horrible. Why I'm saying so is that the if we talk about only, and I have seen the IBHAS because of Dr. Desai only. I was literally lucky enough to have a visit IBHAS, and then Dr. Desai showed me the mother children ward. You know that as far as we in our society, हम बड़ा artificial दुनिया सी है, to be very frank, और मैं बड़ा बिल्कुल फिट नहीं बैठता इस जगह, और इसी चक्कर में मतलब जो मेरे दिमाग में आता है वो मैं करने की कोशिश भी करता हूँ अपनी पेटिशंस के थ्रू. बट एट द सेम टाइम we have around 43 government run mental hospitals, and in these 43 government run mental hospitals, except I think IBHAS or some 2 or 3 mental health establishments government run, we don't have the mother child ward unit.
Yeah.
और जब मैंने पहली बार डॉक्टर देसाई ने दिखाया ना, तो मुझे समझ में आया कि यार हम कितना पीछे हैं. तो आप जब बस एक बेटा इसलिए बच्चे इसलिए नहीं पल रहा क्योंकि माँ को मेंटल इलनेस है, तो आप सोच रहे कि सोसाइटी कहाँ पे है. और ये डॉक्टर्स का हाल है. मैं यहाँ पे ये नहीं कह रहा कि, और सी डॉक्टर, दैट इज व्हाई आई एम सेइंग डॉक्टर्स, जजेस, दे आर ऑल पार्ट ऑफ द सोसाइटी, वो हम जैसे ही हैं, और हम उसको भूल जाते हैं. तो खैर, अगला जो मेरे रोल ऑफ द पुलिस, आई एम जस्ट ओनली टेक 2 मिनट्स. मालूम है बॉस, मालूम है.
1 minute, Gaurav, 1 minute.
मैं खाने के बीच में बिल्कुल नहीं आने वाला.
Yes, please.
So as far as role of police is concerned, you know, the nodal agency as far as the implementation is concerned for the mental health act as well as for the mental health treatment of the homeless is the police officers. But sorry to say, police officer बिल्कुल sensitized नहीं है, और उन्हें खुद नहीं मालूम कि करना क्या है. हमने कंटेम्प्ट करा, चीफ कमिश्नर, दिल्ली पुलिस चीफ कमिश्नर के खिलाफ कंटेम्प्ट करा, उसके बाद तो गाइडलाइंस बना, एंड थैंक्स टू डॉक्टर देसाई अगेन, he was the part of that thing. Another thing, I'm sorry, just 2 minutes more. See, the doctors themselves are barring the person with mental illness to pursue MBBS. डॉक्टर्स खुद ही कह रहे हैं, एनएमसी आज के टाइम पे कहता है कि इफ अ पर्सन इज हैविंग अ मेंटल इलनेस तो वो डॉक्टर नहीं बन सकता. इससे ज्यादा शर्म की बात मेरे हिसाब से एनएमसी के लिए क्या होगा कि एक डॉक्टर्स की बॉडी ऐसा कह रहा है. दूसरा चीज, एक और इंपॉर्टेंट चीज है मेडिसिन. 5 पैसे की एक दवा है जो बहुत सारे गवर्नमेंट मेंटल हॉस्पिटल्स में नहीं मिलती है क्योंकि वहां पे कमीशन नहीं मिलता. वी एम फाइटिंग फॉर दैट. एक और चीज, सुसाइड. आई एम जस्ट ओनली 30 सेकेंड. दिल्ली में हाईएस्ट रेट ऑफ सुसाइड है एज फार एज यूथ इज कंसर्न. 8 साल का बच्चा अगर सुसाइड कर रहा है, ठीक है, तो आप समझ लीजिए कुछ भी ठीक नहीं है. हम एक आर्टिफिशियल सी दुनिया में है, उससे निकलिए. मेरी तरफ से कोशिश रहेगी, डॉक्टर देसाई का गाइडेंस रहेगा, और पूजा जी का साथ रहेगा, तो डेफिनेटली वी विल डू समथिंग. थैंक यू.
I will hand it over now to my illustrious friend Shrinkla, because she's been into training and she also runs some amazing support groups. And a support group which I came across for the first time, a pet loss support group. तो हमारे यहाँ ग्रीफ को ग्रीफ नहीं समझते, दर्द को दर्द नहीं समझते, दुख को दुख नहीं समझते. ऐसी हमारी 1000 समस्याएं हैं. वी आर रनिंग लेट बिकॉज आज यहाँ जितने भी लोग इस मंच पे हैं, वी ऑल फील सो पैशनेटली अबाउट दिस एंड वी कैन गो ऑन एंड ऑन. But I'll hand it over to you, Shrinkla, so that you can tell us what's the way forward and how successful have these support groups been in, some support, recovery, resilience for the survivors.
Thank you so much. Thank you so much, Pooja, for bringing it up. And thank you to Dr. Desai also for all the questions. Um, so the reason that we started with support groups is because even though I'm a therapist myself, I'm a caregiver, a family caregiver to someone with a mental illness first. And I realized, and this is what we stand for at Swayam Foundation, that while mental health treatment can happen in clinics and hospitals, healing happens at home. And for that, it's really important that home is a place of safety. ये बात अभी इस panel में कई बार उठी है, and home is often not a place of psychological, emotional, or physical safety for many people. And we need to be trained on ground to be able to offer mental health support. It's not just the therapists, psychologists, or psychiatrists who need to be trained. It's not just the mental health professionals and counselors. It's people at home, you and me, who need to be trained in mental health support and emotional support. This is the reason we started the support groups and our trainings. And I think that the way forward is to bring mental and emotional health into our homes, into our daily lives for each and every person. And I'm sure initiatives like these, like yours, and these dialogues and conversations will definitely take it forward. The rest of the conversation, I think we can have it over lunch.
Yeah.
Because I know we're running
Thank you.
late.
Thank you so much. And you can connect with all of us on social media and carry those conversations there. We will now felicitate our panel. And after that, we will break for lunch. After lunch, sharp 2:30, Dr. Dhawan has been kind enough to wait. So 2:30, we will resume. So I will request all of you, without the volunteers urging you to come inside, at 2:30, please come back to your chairs. Thank you. Now for the felicitation. Please, Vivek, join me. आप जूही पे भी देना, दोनों में देना, बिल्कुल। थोड़ा सा दे दीजिए। मैं तभी बहुत छोटे बात करूँ। Thank you so much. Sorry. Thank you so much. One moment, so please. Thank you. Please proceed for lunch, and at 2:30 we'll be back here. I am sure सबको भूख लगी है, तो जल्दी जल्दी lunch करके वापस आएंगे.
everyone. We welcome you back to the next session. I request everyone to please settle down. Also, please ensure that your phones are on silent so that we don't interrupt our speakers. We will be resuming the session shortly. Good afternoon, everyone. I welcome you back to the session. We will be resuming shortly, so I request all of you to please keep your phones on silent so that we don't interrupt our speakers. We'll shortly have our chief guest for an award ceremony up on the stage. So I request everyone to settle down. So I would like to invite the chief guest for the award ceremony, Dr. S.K. Dhawan, to deliver his address. Dr. Dhawan is a renowned scientist and is currently the managing director of Vikas Lifecare Limited. He has received many accolades, including Outstanding Scientist Award 2009 and DST Lockheed Martin Innovation Award 2014.
I request everybody to please silence their phones, and Nisha and everybody, please ask the people to come in the hall, please, again. He's been kind enough to Dr. Dhawan to stay with us longer than he was supposed to be. So everybody, please join in fast. Yeah.
Thank you, Pooja, because already we are running late by 1 hour, 10 minutes, 20 minutes, I think. So thanks, Pooja and Vivek, and co-founders of Bharat Dialogues, and the whole team of Bharat Dialogues for arranging such a nice meeting on women and mental health summit and all the arrangement being done by them. Our company will always support this type of clause, and as the managing director of Vikas Lifecare Limited, it gives me great pleasure to stand before you today to shed light on an issue that's close to our heart, women mental health. Mental health is universal human right. At our company, we firmly believe in the importance of supporting women and their mental well-being. We understand that mental health is an integral part of overall wellness, and it's crucial to address the unique challenges that women face in this regard. That's why we have taken proactive steps to allocate funds specifically towards initiatives aimed at promoting women's mental health. Through partnership with mental health organizations, we are providing resources and support tailored to the needs of women, whether it's through counseling services, educational workshops, or community outreach programs. We just heard Protsahan won by Kapoor, Sonal Kapoor. We'll be happy to associate with them also for their cause. But our commitment does not stop there. We also recognize the importance of fostering a supportive and inclusive work environment where women feel empowered to prioritize their mental health. From offering flexible work arrangements to promoting a culture of open communication and support. Of course, our HR team is doing all these things. We are dedicated to creating a workplace where every employee, whether it's man or woman, feels valued and supported. Together, we can break the stigma surrounding women's mental health and create a future where every woman feels empowered to prioritize her well-being. Thank you, Bharat Dialogues, for such a wonderful summit. And I think I conclude my talk here. Thank you very much.
Thank you so much. Thank you so much. I would now like to invite Ms. Pooja to felicitate our speaker. Thank you.
आप लेके आइए, मैं पकड़ा आप अनाउंस कीजिए, मैं पकड़ा
Now we would be giving away the commemorative awards to all the organizations. The first award is for Best Rehabilitation Support, which goes to the Schizophrenia Awareness Association.
Pragati ji.
The next award is for exceptional work in prevention of human trafficking, and it goes to Impact and Dialogue Foundation. Can we have a round of applause? I request the tech team to please switch on the lights. Our next award is for the best use of alternate media for awareness, comics, and it goes to Menstrupedia.
But I don't think a representative is here, so those who are not here, their awards will be sent to them. Next one, please.
Next, Best Organization for Empowerment of Girls, which goes to Protsahan India.
I think Sonal also left. You heard her on the panel, and we'll have the award sent over.
Next up, Best Organization for Accessibility Awareness, which goes to Sangati.
Alka, if you're around, please. Alka Salot Asthana, can somebody look for her? She was around from Sangati Foundation. Meanwhile, you announce the next one, please.
Best Inclusive Startup Platform, which goes to Startup Story.
Anilji, you've been very supportive on this journey as well, so thank you. Please come.
Our next award is for Best Support Group Facilitation for Mental Health, which goes to Swayam Foundation.
Shrinkla, if Shrinkla is also around. They were both on the panel, so Shrinkla, Alka, please look for them. Yeah.
Next up, we have Best App to report gender-based violence, and this goes to Red Dot Foundation for the Safe City app.
Elsa, one of their founders, was also on our jury, and because they operate globally, she could not come. She had sent us a message which we could not play because of paucity of time, so their award will be sent to them. But these names are being announced, and I want all of you to not just clap and forget them. I want you to remember these organizations. They are doing commendable work, and these awards are based on the research by our whole research group, which I was heading, and checking what kind of impact they are having. There you are, Shrinkla. We announced your award. Please join us, Shrinkla for Swam Foundation.
Next, Best Use of Twitter for Awareness, which goes to Safety, #SafetyChat.
So Subhuhi is here for safety, and my compliments to Dr. Shruti as well, who's been an ally, strong ally.
The next award is for Best Community-Based Support and Awareness Work. The winner is Nirmal Initiative.
They've been doing amazing work in Vrindavan with children. I hope to visit their center someday. So congratulations.
Next, we have an award for Most Inclusive Workspace for Women Employees, and this goes to Winnie Gifts.
So Sujit always says, "Ma'am, ये सब मुझे समझ नहीं आता, पर हम करते हैं." So for that.
Our next award is Most Inclusive Workspace in PR, and it goes to Media Mantra.
Both Udit Pathak and Pooja here have been very supportive of these dialogues and conversations. So we congratulate them.
Next, we have an award for Best Training in Counseling, and it goes to Counsel India.
I am feeling I have won with each one of them because I've seen their journeys, especially the youngsters. So I'm so thrilled about this. Counsel India? Counsel India? It was yours. We found yours. अरे जरूर thank you, congratulations.
Last but not the least, the award for Best On-Ground Support for Marginalized Communities goes to Islamic Research Foundation.
Tabriz, if you're around, please come. They've been doing on-ground work. Ambulance bhejo, hospital pahchao, which is so important. Sangati Foundation, please come. If you finish your lunch or whatever, come and take your award. Alka has been doing amazing work on accessibility for people with disabilities. Please look up their work. Yeah, that's about it.
Congratulations to all the winners, and a huge thank you to Dr. Dhawan for felicitating all the awardees. Now we have another keynote address by Miss Aparna Piramal Raje. Miss Raje is a writer, public speaker, design thinker, and mental health advocate. She is also a visiting faculty member at Anand National University. She authored the book Chemical Khichdi, seeking to contribute to India's mental health landscape by sharing her lived experiences with a serious mental health condition. I invite you to the stage.
Yeah, do they have the presentation? So everyone had lunch? Well fed? Thank you. Thank you, Pooja and Vivek, for having me here. Now, I know there's a 10-minute time limit, so I'm going to stick to that. Can I have a clicker? Sorry, I need the clicker for that. Yeah. It says writer and survivor, but I like to think of myself as a thriver, not just as a survivor. Yeah, sure. So you have been given the book Chemical Khichdi, and one of the reasons I want to make this talk today was to really talk about the power of storytelling and how you could use a book like this in your practice, of course in your community with your family and friends who might find it useful, but also as many of you are psychology students or in the profession, how you could actually bring a lived experience like this to be helpful. So the power of storytelling. We've had a filmmaker today talk to us, but here is a beautiful line by Paulo Coelho, who says that really the power of storytelling is exactly when all the gaps, what everything else has crumbled, it's picking up the gaps. And when it comes to mental health, we have heard so many stories today about how things are crumbling. But with Chemical Khichdi and with my story today, I want to give you a story of hope that you can take forward in your lives perhaps, but also of the people around you. So let's start with these words, right? We've talked about mental health, but somehow we've not talked about these words today. So mad or crazy or pagal or psycho. I'm sure that these are very casual words that are used very cruelly. All of us in this room certainly would recognize that. But I'm sure there are also words that all of us would recognize that have been said about us, or we perhaps have said, right? Even though we might be professionals, we do say them casually. Now, what about if I say that these words also actually apply in my case, right? I think that perhaps for Gone case, apart from that, everything else in the room actually applies to me, that I have been psychotic, I have been mad and crazy and insane, and done all these things at some point in my life. But I'm also this. I'm also a mother, I'm a writer, I've studied at these universities, I've run a company, I've written 2 books. So the question really is that how do we reconcile all of this? How do we reconcile that reality? Which is the real me? Is that the real me, the mad me? Or is this the real me, which is the sane me, right? So I want to show you some pictures of this journey. This is me at 24 when I was just about to start at Harvard. And I think this is a picture that captures my personality as an adult. Quite, fun-loving and cheerful and warm and optimistic and a little bit hutke with the, yellow sunglasses. HPS was always pretty conservative campus. And this is a picture of me that I'm very proud of when I was 28 and I was the CEO of our family's office furniture business. And we were the first company in India to take part in any global exhibition. And this was 20 years ago in a global furniture fair. And I was leading this team. So it was a huge milestone for us. It was not, taking part in an international exhibition now is not such a big deal, but 20 years ago it was a big deal. And this is a picture of my first book published in 2015, where I have profiled CEOs. Up till now, I've interviewed 100 CEOs, everyone from the Uday Kotaks of the world and the Deepak Parekhs to the younger generation startups. And finally, this is a picture of me teaching. So this story looks great, right? Like I run a company, I've studied abroad, I've done all these things. But I'd like to share you a picture of me when I'm unwell. And this is a picture of me when I was quite manic in 2018. This was really one of the last times I was really quite manic. And I can't remember this photo being taken because I was so wrapped up in my head. There were so many thoughts and ideas in my head that was my reality, that I was totally caught up in that reality. Now, I know a lot of us have ideas and we can't, sleep for days. That happens to a lot of us. But mania, as I'm sure that many of you are familiar with, is a totally different scenario, where really there is the remote control of your thoughts is not in your hands. It is in somebody else's hands. It is in the chemical imbalances in the head. And you can see my sister being such a great ally for me and being and smiling, but my smile is not real, and I'm trying to just keep it together. But this is what I'm like when I'm unwell. Because I have lived with bipolar disorder for over 20 years. The first incidences started when I was 24. I'm now 48. Luckily, I've been in a good place for the last 5 years, but I've had these ups and downs, and they've been pretty extreme. It's been quite a roller coaster ride. All of you will have the copy of the book which talks about it. And this is a picture when I was very down. And I think it's an important picture of depression to show that actually we don't have the luxury of sitting at home in our pajamas and crying, which we often think is the picture of depression, but also just being very quiet and withdrawn. And so you have to really understand what's going on. So I'm with my kids, but I'm not still fully engaged with them. And this is me with the book. So finally, after years and years, I always wanted to write this book. And I was having a lot of mood swings and I wasn't able to, but then finally I got a space. In the last 5 or 6 years I've been good. And so this book came out a couple of years ago. But even then I have had downs and ups. So this was a phase, a little brief part of hypermania that happened in December. So again, you can see me in the middle of the day trying to just desperately get some sleep on the sofa. And now I have learned to hack it. Everything that I've written in the book, I tried to put this in real life. I took my meds, I had therapy sessions, I, cut down on my social engagements. I really was aware of what was going on, and I reached out, and actually the hypomania lasted only for about a week or so, and I was fine. And I would say this is me with my normal personality, where I'm, just posing by the bookshelf, waiting for that fashion magazine to feature me. So, so what I'm trying to really say is there's a difference between personality and illness. And when you see these pictures, I think that we need to craft a narrative, and we need to recognize that the picture in which I'm lying on the sofa, or the picture where I'm, not present fully with my kids, is a time when I'm unwell, not a time when I'm being moody, or not a time when I'm being difficult, but actually a time when I'm unwell. And so we can learn to distinguish between personality and illness. So the myth that I really want to bust with the book is that you can have a that you can't actually live a normal life. I want to show that you can have a normal life, you can have a family life, you can have a career, and you can actually be thriving. So what does that journey from surviving to thriving look like? So what I've talked about in the book is that there are really 3 therapies for surviving. And surviving is first the medical side of it, which I think we talked about today, going to a practitioner, having access to those resources. The second part, which I think was a beautiful statement that was said earlier, that treatment happens in the clinic, but healing happens at home. And I think that heart for me is the love therapy, is the support I got from my family in accepting this diagnosis and supporting me with it. And the third part is the lifestyle piece, which is the nutrition, the sleep, the exercise, which has been really very important. I think we all want to manage our lifestyle these days, we're very aware. But the connection between mental health and lifestyle is so strong that we really actually keep it, we need to manage it. And I'll just give you an example of this. So when my book was coming out 2 years ago, we had a huge launch party with about 400 people. And I was beginning to get a bit anxious that, have I overstretched myself? Would they not like it? And I said, the last thing that you want to do is when you launch a book on mental health is to start getting anxiety yourself and have a manic episode just because of that. So I said, let me hack my mental health this week with these 3 things. So I had an extra session of therapy. I took some medication. I spent a lot of time with my family and the dog. I did more exercise. So I really took charge of my mental health. And a lot of families just struggle with this first part, which is the surviving part, to really take charge of their mental health. I didn't watch IPL that week, which was really, I think, the best thing I could do for my mental health. And the 4 therapies to survive, I'll just go quickly through this because you can see it more in the book. But really, if you want to go from surviving to becoming an advocate, to thriving, to say, I've gone 5 years or 6 years without a manic episode, I'm really on top of my mental health now. Even if there's a trigger, I can manage it. You need a combination of, this is what worked for me, and I think everybody has to work out what combination works out for them. But for me, work was very important, being out with my colleagues and getting their support. And also just that I find work therapeutic. Spiritual therapy was very important. Very important is having a conversation with myself through journaling. And finally, just having the support of allies. So this is all talked about and much more. But these, I think, take you to a stage where you can say that you're totally aware. You have the first stage is the acceptance stage. The second stage is to say that I'm completely aware of it and I'm tackling it. So while one part of my mind thinks that it's going to win an Oscar screenplay, but now I know Tanuja, so now she'll help me do that. So the second part of my mind is saying, slow down, you need to actually write something good if you want to win an Oscar on screenplays. So you have to be able to manage that civil war in your mind, and I think it's these 4 therapies that have helped me to get to that second stage. So what I say is that I have an illness, but I am not unwell. For me, this is not a disorder at all. This is a condition. So this is about changing the narrative, which I would like to invite all of you who are professionals in the room to use this kind of terminology and change that narrative so it reduces the stigma and makes it easy for people to access help. Mental health for me is a team sport. It's really important to make those allies. I've had a lot of those. And really that happiness is a practice for me. It's a choice and a decision, but it's something that I actively practice. If I can see myself getting unhappy about something, I need to step back, reflect, not react, not respond, not hit that send button, just wait, just exhale, and make that really a daily practice. So these are a lot of words. But yeah, this is the mission of the project, is really to change the narrative. That's why we really want this story to go out. Because very often I find that doctors will give a lot of gyan, right? But patients listen to other patients. And I think even Dr. Jitendra Nagpal talked about this when he talked about how communities can help each other and how the peer-to-peer learning is so important. So just a little bit about the impact of what's happened so far. Like we've had a TED Talk come out, an audiobook come out. It's been a bestseller. It's been shortlisted for an award. It's had a lot of social media impressions. I've done a lot of talks like this. But I think stories matter more than statistics. So rather than just me, I'm going to talk about 3 stories that have really moved me from my readers, just to show how universal mental health is and how powerful stories can be. So the person on the left is Chip Thompson. He's a middle-aged, he's a 40-something entrepreneur in the US, and he got to know of the book through a friend, and he has since become a friend. He lives with bipolar disorder. He goes through a lot of ups and downs. And he said to me that as soon as he read the book, he reached out through LinkedIn, and he said, you know, I'm reading 20 pages of your book, and I feel every page is my story. And so he really resonated with him. And on the middle is a lady who's this is a stock photo, but I got a really lovely email in Hindi from a lady from Nagpur who was a senior citizen, and she said that मेरे बेटे और मेरे husband को दोनों depression है. मैंने आपकी किताब जो पढ़ी थी, डिक्शनरी से मदद लेकर मैंने पढ़ी थी, क्योंकि मैंने मराठी मीडियम तक पढ़ा है और मेरी इंग्लिश इतनी अच्छी नहीं है. फिर भी मेरे बेटे को इतना मेरे हस्बैंड के डिप्रेशन तो फिर भी मैनेज कर लिए, वो रिटायर हो गए, वो खुद डॉक्टर हैं, पर मेरी बेटे के लिए हम इतनी फ़िक्र है कि हम लोग पता नहीं हर दिन क्या होने वाला है, पर आपकी किताब ने हमें नई उम्मीद जगाई है. So I thought that was, thank you. And it was so moving. If you see the life of this lady and the socio-economic context of this lady and the socio-economic context of Chip Thompson, they may have nothing in common. Geography, age, the whole culture of where they come from, the demographics are totally different, but they relate. They relate to stories. And the third story is of Madhumita. She actually sent me an amazing email. She's saying, I used to be a banker with a multinational bank. I'm a single mom in my 40s. I read your book and I have actually switched my career completely because I was looking for purpose and meaning, and I have joined an NGO in Calcutta working with the homeless and the mentally ill with Ishwara Sankalpa. So she actually entirely changed her career. So these are just 3 stories. I get so many more emails and messages. Even today, people have said it. And I just want to say that, you know, of course, yes, we've had these kind of endorsements of these are the sort of people in terms of CEOs or institutes that have endorsed the book. But really, I think stories can help. And I want to share a last story as a woman. I was told by a mental health professional of mine that I shouldn't write the book because it might upset me. My husband has such a demanding job. I should support him. I should spend my time planning the children's holidays because I'm so good at doing that. And that really upset me, you know. So I think that there is so much in the medical system itself, there can be so much patriarchy. But luckily, I went beyond that. I've written an op-ed in HT today just about that incident and about patriarchy in general. But the point is, I think as a woman, we need to have our stories coming out. So I would love to hear from you with your stories. I would love to hear how you've engaged with the book. These are some of the ways I think it can help you. And lastly, just keep in touch with me. I always reply to whichever response I get. So I'd love to hear from you. Thanks.
Thank you so much, ma'am. I request you to please stay on the stage. I invite Ms. Pooja and Mr. Vivek to kindly felicitate our speaker.
So I also connected with Aparna as a reviewer for the book. And since then, we've had conversations, and now I think we are friends. So, बातों से बात बनती है का एक उदाहरण ये भी है. सबका है मीना बोरा मैम का ऑर्डर है कि ये सुंदर है सबको उड़ाओ. Thank you so much.
Now we have another exciting panel discussion, Transforming Mental Health, AI and Startups Shaping the Future. This will be moderated by Mr. Vivek Satyamitram, co-founder of Bharat Dialogues. Please welcome our panelists, Mr. Shashank Avasthi, investor and co-founder of Ally Ventures, Mr. Sujit Kumar, CEO Online and Retail Winnie Gifts, Ms. Kanika Agarwal, founder of Mind Peers, Mr. Tabrez Alam, AI and data expert, Mr. Shivam Dikshit, founder and CEO of Council India, and Mr. Prasoon Srivastav, chief correspondent at the Press Trust of India.
So, first things first, I think there must be some errors in the script, so we forgive us for those. Shashank could not be here. And as much as I had wanted कि हमारे event में कुछ देर से नहीं होगा, देर भी हुई. And as much as I wanted कि manel नहीं होगा, ये manel हो गया है क्योंकि Kanika cancelled. But anyhow, I hope the gentlemen will have a rocking conversation. Over to you, Vivek.
हेलो या सो आप सभी का बहुत बहुत शुक्रिया सुबह से इतने सारे पैनल इतने सारे लोगों को सुनने के लिए और कई बार झेलने के लिए भी अगर ऐसा लगा हो तो बट मैं ये कह सकता हूँ कि ये पैनल और ये विषय शायद सुबह से हम जिन बातों पे बात कर रहे थे उससे हटकर भी है और बहुत ज़रूरी भी है क्योंकि स्टार्टअप्स मैं जैसे स्टार्टअप्स को देखता हूँ मुझे लगता है कि आने वाली दुनिया स्टार्टअप्स या एंटरप्रेन्योरशिप के भरोसे ही आगे जाने वाली है, खासकर विकासशील देश जैसे भारत जैसे देशों में। तो आज इस पैनल पे 6 लोग होने थे, 2 लोग नहीं आए, एक उनमें इन्वेस्टर थे। तो इन्वेस्टर वाला एक पार्ट है जो मैं इनमें से किसी से पूछूंगा जो जिनको अनुभव है इन्वेस्टमेंट से रिलेटेड, और माइंड पियर्स करके एक स्टार्टअप है, उनकी फाउंडर थी, वो भी नहीं पहुंची। लेकिन हमारे साथ शिवम है, शिवम भी एक मेंटल हेल्थ स्टार्टअप रन करते हैं, थोड़ा अलग तरीके का, तो उनसे उस पर हम बात करेंगे। मैं एक एक करके इंट्रोड्यूस करता हूँ। हमारे आखिर में बैठे तबरेज़ आलम। तबरेज़ एआई और डेटा के पितामह नहीं कहना चाहता, लेकिन बहुत पुराने लोगों में, वरिष्ठ लोगों में से हैं जिनकी नज़र रही है। बहुत सारे संस्थानों में उन्होंने लीड किया है और फिलहाल बॉबल एआई एक संस्थान है जिसमें स्ट्रैटेजिस्ट के तौर पे काम करते हैं। देन हमारे साथ सुजीत कुमार मिश्रा हैं। सुजीत कुमार मिश्रा एक ई-कॉमर्स प्लेटफॉर्म विनी ऑनलाइन गिफ्टिंग कंपनी है और केक रिटेलिंग में भी हैं, और ये इंडिया की दूसरे नंबर की ई-कॉमर्स कंपनी ऑनलाइन गिफ्टिंग में। And he has made this business like 100 CR plus without raising any funds from any investor. So he is here to guide us on those things. इसके अलावा हमारे साथ प्रसून श्रीवास्तव मेरे मित्र हैं और पीटीआई के सीनियर चीफ कॉरेस्पॉन्डेंट हैं, और इनकी नज़र रहती है स्टार्टअप्स पे, बहुत सारे बीट्स कवर करते हैं और फंडिंग पे और जितने भी मसले हैं स्टार्टअप्स के इर्द गिर्द। इसके अलावा हमारे साथ शिवम है, शिवम दीक्षित, काउंसिल इंडिया के फाउंडर सीईओ हैं और एक मेंटल हेल्थ स्टार्टअप रन करते हैं, तो इनसे उस बारे में बात होगी। समय थोड़ा हम ज़्यादा ले चुके हैं पहले ही, और प्रसून की कुछ कमिटमेंट्स हैं। प्रसून अगले 10 मिनट में अगर मैंने नहीं छोड़ा तो इस पैनल के बाद बहुत सारी चीज़ें सुननी पड़ेंगी मुझे, तो मैं पहले प्रसून से शुरू करूँगा। और मैं प्रसून से ये जानना चाहूँगा, प्रसून, यू हैव बीन वॉचिंग दिस स्पेस फॉर आई थिंक इट्स बीन मोर देन अ डिकेड नाउ. So how do you look at it? Like, the trend has been into edutech and fintech and health tech, but is there any trend, in future that you think mental health tech can be, we can expect? What is your take on this?
Yeah, thank you, Vivek, for giving me this opportunity. Before I start, let me tell you, I should attempt to unwire you all guys from the stress and briefly introduce myself.
Sure.
How sick I am. So, when their proposal came and when my wife saw this particular thing that I am speaking at this session, so she thought that I am going to speak as an expert in mental health and other things. Then she said, "मुझे तो समझे नहीं और जा रहे हो इस पे बोलने." So then I told her, no, I'm not going to speak on this subject as an expert, but I'll be putting out some data there which might be of help for people there, which I see on daily basis, the investment, the startups. Then she could recall to her first gold earring purchase when she showed me the design and everything, and I gave her gyan on gold index. So that's far I am from these things. But the question that you asked about the opportunity, so I'll go by what I have gone through the reports and all those things. So Bloom Ventures, that's a venture capitalist, they peg the market to be around mental wellness market in India to be around $3 billion. And there are startups, but if you break on the healthcare segment and other things, you know, there has been funding winters, and funding has dropped significantly. And most of the funding has gone to e-commerce and the trading business. And one of the sufferer has been the healthcare segment, where the valuation of enterprises, if you may have heard about PharmEasy, so that has dropped by 85 to 90%. So that's the scenario right now. But we see interest towards funding healthcare startup and mental wellness startup also. There's a startup by the name of Visa that has raised $30 million funding from Google, Kai Capital. So there are funding happening. And you want more on the scenario? I can
No,
give more.
obviously, Visa raised and recently Amaha raised. Something has happened.
Yes.
Okay. Okay. So Amaha raised recently, but the thing is, the way edutech startups has raised funding, the way fintech startups have raised funding, even the health tech startups have raised funding. Is there any scenario in the future, recent future, that we can expect that they are, going to be a funding rounds for mental health startups?
See, if I'll go by the stats. So there were 118 deal that where women founders participated, and most of them are co-founded by women. So even when the reports come, they count Byju's as a women-founded startup, but it is actually women co-founded startup. So there were 118 deals, and when I speak to investors, why this there's been drop in terms of women-founded startup, they say that there's no gender bias per se. It is their version, but they see that if there is a business going on, they can show the proper pattern, profitability, roadmap, the scaling up of the business, they are ready to fund. So that is the scene right now.
Do you think the taboo and stigma attached to the mental health is playing a role into it?
If we go by the Bloom Ventures report, there's someone who is looking at you. In terms of healthcare, there is like even venture capitalists specialize in certain domain. So there are venture capitalists who look at healthcare domain, and recently Peak 5, which has funded a lot many startups, even Byju's and Bharat Pay, you can take the name of unicorns. They have started adding healthcare startups into their cohorts. Recently, they have got one healthcare startup, which is Soul Side something. So they have gone into the cohort. It is a women-led startup. So even bigger investors are coming to fund startup in the mental wellness space.
Okay, okay, great. So Prasoon, if you want to leave, you can, because
Thank
I
you.
know you have an urgent assignment. So thank you for coming and joining us and sharing your thoughts about it.
And sorry for...
No, it's fine, perfectly fine.
I wanted to listen you all, but sorry, I have some comment.
So Shivam, I'll come to you. Like Prasoon said that, there is a hope for mental health startup. What is your take? What is your experience? You have been running this company in bootstrap mode, right? So have you approached investors, and how has been your journey? Can you shed some light on that?
Yeah, thank you, Vivek, for this question. And before answering this, a small overview I want to give you. 2 panel discussions have been done. There was 1 male. And this is the only panel discussion where there is no female.
There was one, but she couldn't join.
And even if we take that one, still it's reverse. There was 1 male, and in this, there's only 1 female.
Right.
So why I am showing you this picture is because this shows how much women entrepreneurs are required in this industry. And even Prasoon was mentioning this, that even when we go for the startup rounds and all, even there women entrepreneurs are less. Coming on to the question of Vivek, like running a bootstrap company since 2016. So I would like to give you a quick update on what exactly Council India is doing, or what kind of company we are, because when we say we are a mental health company, or so there is a kind of a value proposition or an ideation which comes automatically कि ये counseling करते होंगे. But here's a catch. When we started, so there's a unique story. I'll just go through that story in 1 minute, because 8 years journey, but 1 minute is enough. So so when we started this journey in 2016, me and Bobby, we met in a spiritual conference in Mount Abu. Brahma Kumaris आप सब शायद जानते होंगे. So we both met there by God's destiny. I don't know what it was. We were not known to each other. We became friends there. We trusted each other, and we started this venture to help people as a kind of an NGO that time. ये सोचा था कि लोगों की मदद करनी है in context to mental health. क्योंकि just imagine in 2016, that was the time when we used to visit schools to meet principals or any tuition center and meet the owners. So we were labeled कि यार वो पागलों के डॉक्टर आएंगे दो, वो कुछ बताएंगे, उनको बाहर से भगा देना. So this was the real scenario which was going into the market in 2016 when we started this company. Then we keep on working, and then we started tapping NGOs, villages, outskirts, remand homes, custody halls, orphanage halls. So we used to start working with these people, and luckily with the support of a lot of the owners of the NGO, they helped us and we served them. Within 2 years, we were able to serve more than 2,000 students. And that was a good achievement for us that time. And then somebody came into the panel and made us realize कि ऐसे काम नहीं चलेगा. You have to do something differently, and ऐसे NGO की philosophy से काम नहीं चलेगा. You should start raising funds. You should start raising, I'm coming on to what Vivek asked in context to funds. You should start raising पैसा. बिना पैसे के आप नहीं, even if you want to give a charity, you should have money. So वो एक quote, I'll take it. So then he gave us an idea कि start asking people to pay for the services. So we come up with a program that was 21 days mind power training program, and we used to charge 100 rupees for that. पूरे 21 दिन के लिए 100 रुपए हम चार्ज करते थे. Till 2018 we did that, and then an idea hit my mind कि ऐसे हमारे देश की जो प्रॉब्लम है, मतलब जितने वास्ट हमारी प्रॉब्लम है, आज भी अब हम सुबह से डॉक्टर साहब को सुन रहे थे, इवन समीर जी को सुना हमने. Everybody was telling कि ये जो रेशो है वो बहुत कम है. Like India need 3 psychologists or psychiatrists over 1 lakh population, and we have 0.7. So this is the current situation. So ये जो डिमांड है ना, ये सिर्फ मेरे अकेले काम करने से नहीं होगा. काउंसिल इंडिया जाके घर घर में कितना भी सेशन दे दे, कितने भी लोगों को टैप कर दे, बट बहुत साल लग जाएंगे. Then we came up with an idea कि why not to make psychology as a skill, and let us upgrade everybody to have counseling skills in them so that they can help their near about or the family members. And एक नारा हमने दिया, हर घर काउंसलर, कि हर परिवार में एटलीस्ट एक काउंसलर हो. इसको हमने एक हैशटैग बनाया, इसको बहुत एग्रेसिवली हमने काम किया. फिर धीरे धीरे वी रियलाइज्ड कि हम लोगों के लिए अपस्किलिंग कोर्सेज बनाएंगे. सो विद द सपोर्ट ऑफ MEPSC, NSDC and NCVT, we launched multiple courses. Since last 4 years, so we have more than 10,000 alumni who have done our courses. जब ये सब स्टार्ट किया, ये था कोविड आ गया. कोविड आने के पहले हम लोग सिर्फ मालवीय नगर बेस्ड थे दिल्ली में, बट कोविड ने इतना अच्छा काम किया हमारे लिए कि हमें ये रियलाइज़ कराया कि लर्निंग ऑनलाइन भी हो सकती है, कोर्सेज ऑनलाइन भी हो सकते हैं, और हम इंडिया को ग्लोब, पूरा एक ग्लोब से कनेक्ट कर सकते हैं, और हम सोशल सर्विस को भी ऑनलाइन कर सकते हैं. So today, by God's grace, we have 50+ NGOs whom we are serving without any cost. हमारे volunteers, हमारे interns वहाँ जाते हैं, अपनी services देते हैं. Thank you. And business is a separate thing. Like today we are a 30 crore valuation company having 500+ employees, and being a bootstrap company in mental health and having 500+ employees and 4 offices all over India is a huge milestone that I feel that Council India has achieved.
Great.
So we are in Noida, 2 offices in Noida, 1 Mumbai and 1 Bangalore. So मेरे को ऐसा कभी नहीं लगा कि फंडिंग की या इन्वेस्टमेंट की ज़रूरत है, क्योंकि जो विजन, सी it's for all, and even I go to colleges, universities as a speaker, so I always tell this to students कि never focused only on funding, कि अगर फंडिंग नहीं आई तो मैं कुछ कर ही नहीं सकता, because there are a lot of, See, business has a simple logic. Out of 100, only 5 will succeed, 95% will fail.
Okay, thank
It
you,
has a
Shivam.
simple
I'll
logic.
go to Tabrez. Tabrez, you have been working in this entire ecosystem for, I think, more than 2 decades now. You have been part of many leading startups in different senior roles, right? So, and there's a lot of noise around AI and data intelligence, and you are the key person in that specialized space. So I would like to understand from you, is there any space of actually building a bridge between mental health startups and AI and data, and can it help them, grow faster, or maybe help the entire ecosystem in a better way?
Certainly. Before I begin, thank you, Pooja and Vivek, for setting up such a good cause in terms of the discussion points. I heard you, and I think there's a lot of problems. Why I heard the investor part as well. There are startups which are coming in, but we need to understand that there's a demand which needs to be there. India as a society, we are not open to sort of accept, like Aparna said, that we're not happy to accept that we are going through an illness, right? We all feel it's a normal part of to be in the pain. So that is where the opportunities are sort of lag behind. Why? Because there's nothing. I mean, if I have a problem which is related to, let's say, kidney, I have a doctor and I'm happy to approach it and admit it, right? The first thing is the cultural taboo, or the stigma that we have, that people are not voluntarily accepting that I'm going through an illness, right? And that is where, when there is no demand, the supply is not building up. So that's the biggest problem that we have. Like you said, COVID has been instrumental in terms of reaching out to the people. Now, having said so, this is India, but if you look at developed countries where people have been going through a lot of stress, they have a lot of patterns which is available. That is where the AI and data started coming up, because we are all on social media, we are all declaring ourselves, we're leaving our footprints on the digital media, and there's so much of data to analyze. I mean, even before doctors could understand, our government has already understood that how to play around with the data of the people, right? The sentiments and everything. And that's something which we inherited from outside. So what has happened in developed countries 15 years back is that the patient has a history of going from one doctor to another doctor, and they leave a lot of sort of discussion points with the doctors. So the AI decided to sort of access this metadata and build a profile of the consumer or the patient. What they did is that they call that as an data clean rooms, and they started building pseudonymized or anonymized IDs of the people, so that they are able to understand the historical pattern of the user, so that they can predict something, right? Now, this is really very important, that we need to understand there's a lot of progress which has already happened and which is happening in terms of accessing it. How do we venture out, and how do we sort of scale this in India? We need to understand that the collection of the data is very much important, and you gave a very right example that COVID gave you that edge, that you started doing a teletherapies, right? So that is a mass reach that we have, being the largest internet population, right? But because of the cultural taboo or anything, so there's a lot of things which are coming up in terms of accessing data. AI, bases your social media, bases your NLPs, which is natural language processing. They're understanding the sort of context or the typing behaviors, and even there are voice biometrics which are available with certain companies like Kintescu, right? If you heard about them in US, right? They study the voice pattern, and they understand what is the level of depression that you have, right? Are you going through an anxiety, or is a bipolar disorder? And since you are able to collect pattern, you're able to predict, right, that what would be the right source of diagnose or sort of a treatment for this person. So it's very pivotal. I mean, if you look at health, mental health, Lyra Health, it is into the B2B sector. You have a lot of companies, Headspace, right? These companies are coming into B2C sector as well. But openness and acceptance is very high in developed countries versus our country. Why? Because we are not able to declare ourselves that we are going through a problem.
Right. So, Sujit, I'll come to you now because you have been running this company entirely in bootstrap mode. So, I want to understand from you what exactly an investor look into a startup, whether, you know, when you must have discussed your startup with a lot of investors. So, I want to understand from you, as a space, mental health is not that lucrative and there is a lot of stigma and taboo attached to it. So do you think, you know, there is way forward, you know, mental health startups can position themselves and lure investors into it? And what is that right way to do that?
हेलो हाय बहुत सारे लोग हैं आई नो इट्स टफ आफ्टर लंच और इतनी सारी बोरिंग ज्ञानवर्धक बातें हैपेंस पर पैसा तो मायने रखता है सो दिस इज़ समथिंग रिलेटेड टू स्टार्टअप्स पैसा होपफुली इस पैसे के चक्कर में आप हो सकता है एक सोसाइटी में चेंज ले आए बहुत सारे लोग यहाँ से प्रेरित होकर मेंटल स्टार्टअप ही शुरू कर दें सो डेफिनेटली विवेक व्हाट आई थिंक is this is $3 billion industry as Prasoon has said पर वो $3 billion कहाँ है राइट वो $3 billion है मार्केट है प्रॉब्लम है अब क्या हुआ आइडेंटिफाई होने लगा है दैट यस देयर इज अ प्रॉब्लम एग्जिस्ट करता है वो दूर गांव में भी एग्जिस्ट करता है वो शहरों में भी एग्जिस्ट करता है वो पुअर के साथ भी है वो रिच के साथ भी है एवरीवेयर मेंटल प्रॉब्लम है चाहे वो मैन है या वुमेन है मेंटल प्रॉब्लम सब कुछ है मैं छोटा हुआ करता था गांव में मैं बस्ती से बिलोंग करता हूँ अयोध्या से आगे एक छोटी सी जगह है वहाँ पे क्या होता था कि आए दिन इसको चुड़ैल लग गई इसको माता आ रही है राइट सो बचपन में तो मैं भी बिलीव कर बैठा कि नहीं ये तो बात सही होगी अगेन पर अगेन कमिंग फ्रॉम मिडिल क्लास सोसाइटी वो बेसिक्स फैमिली से ही नहीं आता कि आपको एक मेंटल प्रॉब्लम हो सकती है बट देर इज बहुत मेंटल प्रॉब्लम है और बीइंग स्टार्टअप रनिंग ए स्टार्टअप फ्रॉम 10 years इन अ बूटस्ट्रैप मोड जहाँ पे क्या है कि दिस वाज सिमिलर लाइक कि गिफ्टिंग की भी क्या ज़रूरत है राइट इनिशियली गिफ्टिंग होती थी बट नाउ बर्थडे सेलिब्रेशन की क्या ज़रूरत है वंस इन अ ईयर आता है सो coming to this mental thing, I think there is a problem, but lot of category creation is required in this, and that will require a lot and lot of money. मतलब 100, 200, 500 करोड़ इससे नहीं होने वाला उसके लिए 1000 करोड़ चाहिए अगर आपको जोमेटो आधे घंटे में खाना डिलीवर करता है दैट इज ए हैबिट फॉर्मिंग थिंग एक आपको 10 मिनट में पनीर की ज़रूरत नहीं है पर जेप्टो है ब्लिंकिट है इंस्टामार्ट है सो दे आर क्रिएटिंग अ कैटेगरी कि नहीं आपको ज़रूरत है राइट पर आई डोंट थिंक कि वहाँ पे ज़रूर मतलब डेफिनेटली ज़रूरत है कमर्शलाइज करने की ज़रूरत है बट सेम थिंग शुड हैपन हियर ऑल्सो कि नहीं प्रॉब्लम है पहले इंश्योरेंस की इतनी वैल्यू नहीं हुआ करती थी बहुत लो इंश्योर्ड कंट्री थी इंडिया बट नाउ इट हैज़ पिक्ड अप क्यों पिकअप हुआ बिकॉज देर आर सो मेनी umpteen numbers of startups that came and that made this insurance easy अभी क्या है उस चुड़ैल वाली जो भी हमारी माता जी थी चाची जी थी उनके पास कैसे पहुंचेगा उनको कैसे पता लगेगा डेफिनेटली मोबाइल फोन का पेनिट्रेशन आ गया है सो आई थिंक लॉट ऑफ वर्क नीड्स टू बी डन बहुत सारा काम करना है एंड दैट कैन हैपन ओनली थ्रू मीडिया मीडिया इज द ओनली चैनल जो वर्क करता है मैम इज हियर आई थिंक लोगों को बर्थडे कैसे मनाया जाता है पहले क्या होता था शादी हो जाती थी अब तो प्री वेडिंग फोटो शूट होता है उससे संगीत होता है क्या क्या होने लगा कैसे आया सोसाइटी में वो दैट गॉट इम्पार्टेड थ्रू फिल्म्स थ्रू मीडिया तो मेंटल वेलनेस के लिए भी मेंटल प्रॉब्लम्स के लिए भी उनको बताना ज़रूरी है एंड दैट कैन बी थ्रू एंटरटेनमेंट या दूसरा अब आजकल मीम्स बनने लगे हैं या देर आर बहुत छोटे छोटे रील्स आ गए हैं राइट बट दैट हैज़ टू बी देयर तो जब तक कैटेगरी क्रिएशन नहीं होगा एंड कैटेगरी क्रिएशन रिक्वायर्स अ लॉट ऑफ मनी
right so I'll come to Shivam again and we have 10 minutes more so we'll take it quickly 2 minutes for everybody so Shivam there are a lot of people who come out of IIT and they build IT companies right There are people coming out of IIM Ahmedabad or other IIMs, right? They're building companies into marketing space. But what is the reason behind that people who are actually graduating in psychology from different colleges, they are not getting into the startup ecosystem, they are not taking this play that, okay, let's build a mental health platform. What is stopping them, and what do you think is the way forward to, maybe create a better scenario to get in, lure these people into this ecosystem?
Right, right. See, again, a problem is mindset. आज हम सुबह भी बात कर रहे थे माइंडसेट की. Here also the problem is mindset. Specifically when we are talking about the professionals who are passing out from as a graduate or as a after doing masters, उनका mindset इतना ही है कि मुझे सिर्फ साइकोलॉजिस्ट बनना है बस. एक IIM बंदा जाता ही इसलिए क्योंकि मुझे एंटरप्रेन्योर बनना है. IIT का सिंपल सेट पैटर्न है. IIT करो, कंपनी खोलो, फंडिंग उठाओ, बिजनेस करो. क्यों एक IITian को फंडिंग तुरंत मिल जाती है? मतलब जस्ट अ नैरेटिव विच इज सेट इन द मार्केट. एक साइकोलॉजी वाला फंड मांगने आएगा, कोई देगा उसको? नहीं देगा. आज के टाइम में आप खुद देखो साइकोलॉजी में कितने एंटरप्रेन्योर्स हैं. लिमिटेड कंपनी है, इवन कनिका नहीं है माइंड पेयर से, उनको शार्क टैंक से फंडिंग मिली है, राइट? ऐसी कितनी कंपनी हैं. इवन आप लोगों ने शार्क टैंक के मल्टीपल सीजन्स देखे, कितने साइकोलॉजी मेंटल हेल्थ के पिक्चर्स आते हैं? हार्डली 1 or 2. अभी रिसेंटली अमाहा को मिला, लाइसन एक कंपनी है मेंटल हेल्थ की, उनको मिला. लिमिटेड फंड कंपनीज है जिनको फंडिंग मिल रही है. और इसकी प्रॉब्लम है जो करिकुलम है यूनिवर्सिटीज़ में, कॉलेजेस में, उसको चेंज होने की ज़रूरत है. NEP 2020 के आने के बाद काफ़ी हद तक ये चेंज हुआ है. इवन रिसेंटली लास्ट वीक ओनली आवर ऑनरेबल प्राइम मिनिस्टर हैज़ इनॉग्रेटेड IIS, इंडियन इंस्टीट्यूट ऑफ टेक्नोलॉजी जैसा इंडियन इंस्टीट्यूट ऑफ स्किल. So that's a new add-on. I thought most of you were not aware about this. So अब जैसे धीरे धीरे चेंजेस आ रहे हैं ना, इवन ये प्रॉब्लम जो अभी विवेक ने बताई है हमने 3 साल पहले डायग्नोस करी थी. एंड दैट इज द रीजन इन ऑल आवर कोर्सेज एंटरप्रेन्योरशिप इज अ करिकुलम, इट्स अ पार्ट ऑफ द कोर्स. सारे कोर्सेज में हमने कंपलसरी किया है. लास्ट 1 year आर एल्यूमिनाइज, हमारे पूरे नेटवर्क में 25 एंटरप्रेन्योर्स वी हैव गिवन टू आवर कंट्री, जो अलग अलग इंडिया के एरियाज में अपने खुद के बिजनेस स्टार्ट करें. प्रॉब्लम है कि एक साइकोलॉजिस्ट को ना साइकोलॉजी आती है, धंधा करना नहीं आता.
राइट, राइट.
बिजनेस करना सिखाना पड़ेगा, वो प्रॉब्लम है.
वेलकम टू तबरेज. तबरेज, जैसे इन्होंने कहा कि साइकोलॉजिस्ट को धंधा करना नहीं आता है, बट आज की डेट में रील बनाना सबको आता है, राइट? बाकी चीज़ें करना भी आता है. लोग सीख रहे हैं जहाँ उनको लगता है कि उनको फ़ायदा है या उससे जो भी एस्पिरेशनल वैल्यू उसकी, तो एक एस्पिरेशनल वैल्यू एक बिजनेस बिल्ड करने की भी हो सकती है अगर ये $3 billion का डेटा सही है. तो मैं आपसे ये समझना चाहता हूँ कि जो AI या डेटा इंटेलिजेंस, ये सारी चीज़ें जो अभी प्रचलन में हैं, इनको कैसे इस्तेमाल करके और हम जो है किसी भी मेंटल हेल्थ स्टार्टअप को फंडेबल बना सकते हैं और ल्योरिंग बना सकते हैं.
विवेक, मैं ना इसमें 2 कॉन्टेक्स्ट उठाऊंगा वेरी शॉर्टली. जो अभी सुजीत ने कहा कि मीडिया इज़ अ रीच, ठीक है, जहाँ पे कैटेगरी भी बिल्ड करना है, वो सिनेमाइज होता है. जो अभी आपने कहा कि कैटेगरी, एक IIM, एक IIT निकल के आता है, एंड ही इज़ देयर टू बी देयर फॉर एज एन एंटरप्रेन्योर हु स्टार्टिंग अ टेक कंपनी, राइट? बट मेंटल हेल्थ के बारे में कोई सोच ही नहीं रहा है. And that's the reason you don't have investor also, because they don't want to put money on a dark horse as well, right? Now, what has happened, I'll give you an example what we have done, right? How technology can first help in terms of curtailing the situation and then help mental startup as well. A lot of brands are putting stress in terms of, mental illness for women. Obviously, this is for men as well, right? But then, brands like HUL. And they wanted to do something, Vivek, you're aware about that, right? A thoughtful process. We all go through the body shaming every day, right? Tu choti hai, tu nati hai, tere baal lambe and all that thing. And this is happening all through the conversation platform. So what innovation we did is we worked with Dove and we wanted to send out a message that every time any conversation is done, which is related to body shaming, we were able to sort of give a prompt on our keyboard itself saying that all sizes or all hairs are beautiful, right? So this is a natural prompt which is going to come in, right? As soon as you type something which is not which is derogatory and which is about shaming, and trust me, the volume of the keywords that we noticed before versus after the campaign which has happened, it has reduced significantly. I'm not saying it reduced by 50%, but 5-10%, 11% in each and every word. So that's the power of reach in terms of controlling the mindset. And how media can help, or the digital can help in terms of transitioning this, right? I think the only way right now is seeing the sort of mindset of the people not open to admit something, right? We'll have to have only a media as in part. You can't have a physical clinication of all these illnesses. It has to be declarative, because see, India data is all about declaration, right? I mean, चाहे आप उसको फिजिकल डिक्लेरेशन बोलें वो इम्पॉसिबल है, या आप उसको डिजिटल डिक्लेरेशन हर कोई यस यस करके चलता है हर समय. So for, I think, startup, mental startup, it's a category that you need to build in. Digital is the way to reach out. Like I said, you have so much of technology now available through an AI, where you are doing a processing of the illness, you are suggesting a sort of a diagnose for the patient as well. Like I said, NLP is studying the languages and all those things. I think that is something to come on a digital platform, and that is where you will be categorized as mental tech startup rather than mental health startup, right? And that is where you can eye for the investors.
Thank you, Tabriz. I'll go for the last question. Sujit, आपने entirely bootstrap company build की है, और आप सभी लोगों को बता दूं कि ये कंपनी बड़े लेवल पे काम करती है. इनका रेवेन्यू फ़िलहाल 100 CR से ज़्यादा है, और पिछले 10 सालों में बिल्ड की है. तो मैं यहाँ पे ये समझना चाहूँगा कि अगर मेंटल हेल्थ स्टार्टअप इकोसिस्टम में फंडिंग नहीं आता है बिकॉज ऑफ वॉट एवर रीजन्स, राइट, क्या तरीका हो सकता है कि बूट स्ट्रैप तरीके से इसको करते हुए, कोई इनोवेशन करते हुए, और बाकी वो क्या फैक्टर्स होते हैं जिनको कंट्रोल करते हुए हम कोई एक विनी जैसी कंपनी जो है मेंटल हेल्थ स्पेस में बिल्ड कर सकते हैं?
डेफिनेटली बिल्ड हो सकती है, क्योंकि अभी तो एआई, मशीन लर्निंग इतनी सारी आ गई है. सो नाउ जनरेटिव एआई हैज़ कम इन टू प्लेस. सो जनरेटिव एआई करता क्या है, वो कंटेंट जनरेट करता है, राइट? तो दैट कंटेंट क्या है, द सोशल मीडिया इज अ गैसोलीन एंड दैट कंटेंट इज अ फायर. सो सोशल मीडिया का यूज़ करके, मीडिया का यूज़ करके, वो जो जेनरेटिव एआई से अगर हम एक रीजनेबल कंटेंट जनरेट करें जो एंटरटेनिंग भी हो, जो थोड़ा इंटरेस्टिंग भी हो, वो चीज़ अगर सोसाइटी में आती है एंड पीपल आर वर्स्ड विद दैट, धीरे धीरे वो सीख ही रहे हैं. अभी तो बहुत सारी एआई की कंपनीज आ रही हैं. गूगल अपना लेकर आया, माइक्रोसॉफ्ट अपना लाएगा, फेसबुक अपना लाएगा, एंड बहुत सारी स्टार्टअप्स भी आ रहे हैं इसमें. सो इफ कंटेंट गेट्स जनरेटेड, कंटेंट अगर जनरेट, बिकॉज इट्स ऑल अबाउट कि आप अवेयरनेस कैसे बढ़ाओगे. वंस अवेयरनेस इज देयर तो मार्केट में ऑटोमेटिक इंटरेस्ट भी आ जाएगा, पीपल विल ऑप्ट फॉर दैट, राइट? पहले तो यही होता था ना, सिर्फ फिजिक्स, केमिस्ट्री, मैथ पढ़ लो, इंजीनियर बन जाओ, डॉक्टर बन जाओ. नाउ पीपल आर ऑप्टिंग फॉर डांस, दे आर ऑप्टिंग फॉर आर्ट. बहुत सारी चीज़ें हैं. सो कुछ चीज़ें वैसी भी आनी चाहिए, कुछ चीज़ें मुझे लगता है वैसा भी आना चाहिए जो फिल्म, सिनेमा या इस टाइप से भी सोसाइटी को इम्पैक्ट कर सकता है. जैसे अभी शाहरुख खान की कोई भी मूवी आती है, वो 1000 करोड़ है, वो बहुत ज़्यादा इम्पैक्ट करती है एज कम्पेयर टू आर्ट मूवी जो 2 करोड़ में बनती है, राइट? वो सिर्फ, मुझे लगता है सिर्फ अवार्ड लेने के लिए बनती है. नहीं, वैसे नहीं.
सो
दैट कैन बी डन.
एक चीज़ जो मुझे खुद कहनी थी इस सेशन को रैप करते हुए, कि शायद मैं पहला व्यक्ति था जिसने मेंटल हेल्थ स्पेस में एक स्टार्टअप शुरू किया एडवाइस अड्डा नाम से, और तब स्थितियां बहुत अलग थी. तब फंडिंग किसी को भी नहीं होती थी इतनी ज़्यादा, अब होती है. लेकिन जो मैंने महसूस किया कि पैरेलली कुछ जो दूसरे स्टार्टअप्स आए, यहाँ बहुत सारे लोग हैं जो मेंटल हेल्थ प्रोफेशनल्स हैं, उनके भी कंसर्न्स है, क्योंकि उनको वो लैंग्वेज नहीं पता है जिसमें मेंटल हेल्थ बहुत सेंसिटिव विषय है, और उसको आप किसी भी स्टार्टअप की तरह रन नहीं कर सकते. उनको सेंसिटिविटी नहीं पता है, उनको डेकोरम नहीं पता है. तो मुझे लगता है कि इस स्पेस में जो भी संभावनाएं हैं उनको अगर हमें बनाए रखना है और आगे ले जाना है, तो उसके लिए मेंटल हेल्थ के बारे में जानना समझना भी बहुत ज़रूरी है. आप सभी लोगों का बहुत बहुत शुक्रिया. और
विवेक जी 1 मिनट लूँगा बस, 1 मिनट,
30 सेकेंड्स
30 सेकेंड्स दे दीजिए, क्योंकि ये बात बहुत इंपॉर्टेंट है. आज सुबह से हम ये बात कर रहे हैं, बट मेंटल हेल्थ की इस बात पे किसी ने बात नहीं करी. ये बहुत इंपॉर्टेंट है. आप सब लोग 1 मिनट ये सोचिए कि मेंटल हेल्थ में सबसे बड़ा ऐसा क्या प्रॉब्लम है कि हमारी इंडस्ट्री ग्रो नहीं कर पा रही. दैट इज़ यूनिटी. हम सब साइकोलॉजिस्ट हैं, हम सब काउंसलर्स हैं, एंटरप्रेन्योर्स हैं, ये है, बट सब अपनी अपनी डायरेक्शन में ग्रो होने के लिए भाग रहे हैं। कोई बात नहीं करता कि सब साथ में मिलकर चलते हैं। आप लॉयर्स को देखो यूनियन है, आप डॉक्टर्स को देखो यूनियन है, आप एंटरप्रेन्योर्स को देखो यूनियन है। क्यों मेंटल हेल्थ प्रोफेशनल्स की यूनियन नहीं बन पाई अभी तक? क्योंकि कोई साथ मिलकर, आज हम यहाँ पे आए हैं, इतनी बड़ी बड़ी बातें करी हैं, सब कुछ किया है। आई कैन वाउच ऑन यू, यहाँ से निकलोगे कोई किसी का फोन तक नहीं उठाएगा। फैक्ट। पूजा जी उठा लेंगे वैसे?
नहीं, यही चेंज होगा शिवम। ये आप आखिरी बार कह रहे हैं कि कनेक्शन नहीं होगा। आई एम कमिटेड टू दिस कि ये जो intersections हैं, both Vivek and I, they have to be connected. And that is why we are not just talking mental health, we are talking AI, startup, tech. In the next panel, you'll hear about inclusive workspaces from HR voices, from people coming from corporate backgrounds, people coming from universities and education. तो हम सबको connect करने की कोशिश कर रहे हैं, तो hopefully ये कमी कम हो जाएगी अब।
और किसी भी तरीके से शिवम दीक्षित है, काउंसिल इंडिया आपके लिए कुछ भी करे, प्लीज़ फील फ्री टू कॉन्टैक्ट मी। मैं सारे मैसेजेस, सारे कॉल्स का रिप्लाई करता हूँ, चाहे वो NGO हो, बच्चे हो, यूथ हो, किसी को भी हेल्प चाहिए। टाइम कम है इसलिए चलते चलते बात कर रहा हूँ। किसी को किसी भी तरीके की हेल्प चाहिए तो प्लीज़ 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 लेट अस नो। एंड थैंक यू पूजा एंड विवेक फॉर दिस लवली इवेंट।
A big thank you to all of, a big thank Thank you to all our panel members. Now I would request Pooja ma'am to kindly felicitate the speakers.
Thank you for that quick conversation, gentlemen. With that, now we'll move ahead in the program. Kavya.
So for our final panel discussion, the next frontier, inclusive workplaces, education and awareness, kindly welcome to the stage our moderator, Mr. Balindu Sharma Dadich, Director of Local Languages and Accessibility at Microsoft India. We would also like to invite our esteemed panelists to the stage, Ms. Alka Selot Asthana, founder of Sangati Foundation and Head of Regulatory Affairs at Tata Communications, Dr. Itisha Nagar, psychologist and former professor at the University of Delhi, Dr. Rakshita Sharma, HR veteran and senior corporate consultant. She won't be able to join us today. Dr. A.K. Puri, Vice Chancellor of IEC University and board member at AIMS Rishikesh. Ms. Soumya Bejal, advertising professional and artist. Ms. Soumya won't be able to join us in the panel today. And lastly, Dr. Shruti Srivastav, professor at the Department of Psychiatry, UCMS and GTB Hospital, Delhi.
So, why don't you move in the center? So, Dr. Shruti is on her way, and two people have not been able to join this panel. They've been unwell, both Dr. Rakshita and Soumya Bejal. But I hope this will be a riveting conversation. Itisha, please. Yeah, so over to you, Doctor. Balindu ji.
So hello everyone. First of all, wishing you for this International Women's Day today. In the morning, I posted a very small post congratulating all the ladies on this very important day. And there was also another lady who also posted another message. And the likes that I received were only 10% of what that lady received over social media. So these are the problems of the modern day that we are facing. But in any case,
this is in this world today, which we consider that this is based on equity, we have our own problems, different kind of problems, and all of us here, we will try to talk about those problems. We will try to talk about the experiences that we have, and the esteemed panelists that we have here. They will try to share their experiences as well as the expertise that they bring in for this to this panel. So first of all, I would like to talk about a couple of things that I have in my mind. Ideally, this is an equal society, so there should not be any discrimination of any kind, right? But the mental health issues, they do discriminate in this society. And there is a fact that women face more mental health issues than men, and that is a fact. There are different reasons behind that. Maybe gender roles are there, stereotypes are there, the societal biases are there, barriers are there. So many things are there, so many contributing factors are there. And survey after survey, they also, come up with the information that this problem is still there, even though lots of people, lots of organizations, lots of startups, even governments, they are all trying to make sure that we are able to handle these issues, but they are still there. For example, there is one survey from McKinsey, which was conducted in 30 cities, involving 30,000 employees of corporates. So that survey says that most of the people believe that yes, women face more mental health issues at workplace than compared to the men. Now these people, even among the people who are facing these issues, 46% are women and only 38% are men. So there is a discrimination, right? And this is happening with all of us. In fact, this is happening with the ladies here. Now most such cases of mental health problems are in France, India, and Japan. So that is the conclusion of that particular survey. There are so many other things also, and there are questions that come to our mind, like why women at the receiving end? So there are so many reasons behind that. First is that they face discrimination at the workplace. That is a reality. Not all of them, but some of them they do. There are also dual responsibilities that they have to take care of. On one hand, they are taking care of the home or family responsibilities. On the other hand, they have to take care of the office jobs, etc. And then, the issues of work-life balance and other such issues, they come up because they are constantly struggling, constantly fighting to strike a balance between the two worlds that they are operating in. There are also burden of performance. Many a time women face that, that also creates a sort of stress for them. Then there is pay disparity. And then finally, there are health-related issues and certain issues which are related with the milestones of their lives. For example, pregnancy, that is one milestone, very important milestone. But maybe those milestones may also, reflect in some type of stress at workplace. I know many ladies who hesitate while taking their maternal leave. They will delay it for some time, because that is the situation. They don't know as to what is going to be the reaction of the people, what is going to be the reaction of the bosses or the workplace. So those kind of things are there. And these mental health issues, they are not limited to ladies from smaller organization, for example, SMB or MSME, etc. They are also impacting people at the top. So a couple of examples I have. One is that of former New Zealand PM, Jacinda Ardern. She had to resign because she was feeling that it is too much. I don't have my tank full now, and I have to focus on my family and my own life now, because she was so stressed out. There is another example of YouTube CEO, Susan Wojcicki. She also had to resign because she was feeling that it is too much now for me. Similarly, Meta's chief business officer, Merv Levine, she also resigned. So, this is a great leveler among the ladies. This doesn't spare one lady because she's coming from some background and another because of she's coming from some different background. So many issues are involved here and so many experiences are there. And I would like to start this discussion with my fellow panelist, Dr. A.K. Puri, and I would request Dr. Puri to share his experiences and what he thinks about the challenges that ladies face today at the workplace, and what could be the insights that he would like to share with us.
Well, good afternoon, everybody, and thanks to Pooja for giving me this opportunity to be here with you. I have been into education in my career since long, and most of it has been in management education. We realize that a lot of changes are coming at the workplace in terms of inclusion, in terms of taking care of gender-specific issues. Of course, there is law, sexual harassment at work, other laws, anti-dowry, domestic violence, which to some extent tries to tackle the issue of taking care of women-specific issues in a different way. But what we realized was that probably law is not the only solution. The dimension of mental health, so to say, personally I will like to avoid using the term mental health, because the moment we say mental health, we believe there is sickness, we believe there is problem in the sense that it needs to be handled by an outsider. Ghrelu upai nahi chalenge. So I would rather like to deal with the positive side of it. And that is where we realize in the last academic year, rather the current academic year 23-24, at our own, we started an optional course for MBA students, which was totally outside of the curriculum. And we said, this is a course in happiness. This happiness, we named it actually to give a positive twist to the issue of mental health. Because the moment we say mental health, it carries stigma. And the moment we say, let me do a quick survey, आप में से कितने लोग खुश होना चाहते हैं जिंदगी भर खुश होना चाहते हैं, जिंदगी भर खुश रहना चाहते हैं? So the answer is all. And the way I ask, आप में से कितने लोग feel करते हैं कि आप mental problem में हैं? Very few hands will come up. So there's a need to look at it in the positive side, and as I realized while teaching this course, there's no textbook, there's no ready-made material available, there are no guidelines. So it was totally innovative, totally different. And what we realized was that essentially it is this dealing with the issue at the elementary stage. If we go back at the root of mental health, it starts with stress. So if we can deal with stress, and then again, the moment we call it stress, probably it causes stress. So we say, हम खुश कैसे रहें? हम जिंदगी को एक मीनिंगफुल तरीके से कैसे जिएं? हम लाइफ में अच्छा कैसे करें और उस अच्छाई को रोज महसूस कैसे करें? So when I did a 30-hour course on that, it was pure enlightenment for my students. It was enlightenment for me as well, because we realized there's a lot to learn, and left to me, probably we should make it a compulsory course for all the students in all the schools and colleges, because there's a dire need for it. There's a need for each one of us to understand from the beginning how we can live a stress-free life. Stress तो जिंदगी में आएंगे, outer conditions को कोई control नहीं कर सकता है. मैंने for whatever little while I was here, I heard that there are problems in family, there are problems in society, there are problems at workplace. probably we are trying to shift the blame to others. The moment there is a self-realization, the moment we realize that I am the master of myself and I have to take charge, probably we'll be better equipped to deal with mental health issues. And that is where I started in a very humble way. I happened to learn certain therapies. And what I found again, thanks to, rather, I would say sorry to some of the medical practitioners, some of the mental health problems which medically may take maybe 1 year, 2 years to resolve. There are therapies available where just in 15 minutes, 30 minutes, I'll take care of the problem. It will get eliminated for life. It's possible. So there's a need for all of us to learn those techniques. I really loved the idea where in the last session it was said that let every family have a counselor. I won't call it a counselor, I'll call it a therapist. खुशी बांटने से बढ़ती है ना, तो हम सब क्यों नहीं बांटते अपने घरों में? अपने घरों में जरा याद करके देखिए, हर रोज़ हम घर के हर फैमिली मेंबर को कितनी बार कम्प्लीमेंट करते हैं? We have stopped doing it because somewhere they are taken for granted. So the moment we start doing that, we start creating happiness for ourselves. And for me, that is a realization. At our university, we have already started a postgraduate diploma course in counseling and guidance. This again is camouflaged essentially to train people, to develop people who can help spread happiness in their own way. That's all from my side.
Thank you, sir. So I think that was a very positive message that even though there are challenges, but yes, we can also take care of those challenges. And I know that there are many ladies who are quite successful, and there are many celebrities also. For example, Lady Gaga and Emma Stone, and many ladies, Agatha Christie. They have been affected with these kind of challenges, but they have been able to rise over those challenges and they have been successful in their lives. They have also been able to tackle these kind of issues. So I'll come to Alkaji now, because you come from corporate as well as NGO background, and I think you must have seen situations where although even though, like sir was saying, that we should have a happiness quotient, but how to create that kind of happiness quotient for the workforce, the women workforce in different corporate environments? What kind of challenges you have been seeing, you have been witnessing, and how to address those challenges?
Thank you. Good afternoon, everybody, and thanks to Pooja and Vivek to kind of create this whole dialogue, and also a little bit of a big challenge to create such a vast topic and ask 4 people to talk on it. I have been working for the past 30 years, and I have been in a space where women are few, and they were fewer when I joined. So I'm an engineer. I've been in hardcore infrastructure kind of roles as well. I have traveled up and down. I have worked in spaces where there was no women washroom. So when we now talk of International Women's Day and we say inspire inclusion, I really relate to it. Yes, we need to inspire inclusion, but because we are a country of 140 crores, in workplace we strive to divide and exclude people. We have to select people on basis of certain criteria to take in. When you want to hire somebody, you look at certain categories of people who would fit into your space, and therefore it is actually creating exclusion rather than inclusion. And these inclusions or exclusions operate at several levels, some of which are captured here. So if you are a woman, you don't fit into an infrastructure role, you don't fit into a CXO role, you don't fit into a independent, alone founder role. So you can hear of co-founders, you cannot hear of women founders. Few are there, yes, and now we are, kind of coming out of that shell. We are allowed to feel only pride in pregnancy and motherhood. If we start questioning that, you are being a non-woman. You are not right if you are not enthused about, marriage and motherhood and so on. So there are scripts that we have been fed with, and women included. So when we talk about, inclusion, first we have to cut those barriers which are excluding people, and then let's start talking about inclusion. The other thing is mental health. Somehow what I have noticed is that in India, prominently, this is our way of thinking that each one is responsible for themselves. What Puri sir also said, आप अपने आप भी तो खुशी ला सकते हैं. तो जब कोई गिरता है तो उसको बोलते हैं अरे संभाल के चलो. भाई वो संभाल के चल रहा था, उसके बाद भी गिर गया. आप अगर लड़खड़ा रहा है और उसको ये बोल रहे हो कि संभाल के चलो, you're not really giving an advice which they don't know. So I didn't expect it to resonate with so many people, but I know it resonates with me very strongly. तो लोग जब अपने दीपिका पादुकोण जब अपने डिप्रेस्ड होने की बात करती हैं, तो हम सब, including the women who are going through it, would say, इनको क्या कमी है, ये क्यों डिप्रेस्ड हो रही हैं. कोई अपने बच्चे को ठीक से, I mean, after pregnancy, postpartum depression is something which has been recognized now as a, as a solid reason for depression. But जब नहीं था, तो घर की सारी बुजुर्ग महिलाएं बोलती थी, ये तो अजीब टाइप की बहू है, इसको समझ नहीं आ रहा, she is not able to handle the kids. So we have somehow been fed that script, which we only need to kind of, get rid of. And hats off to Aparna ji, who is talking about it, so hats off to you. There are very few people I can find who will do that. But I have come across a lot of women who grapple with situations which are excluding them. And it is not because of, things which we can correct by law, as you said. Sexual harassment, I have sat on the committees, I've chaired those committees who have to decide on the cases where a lady, after a lot of internal turmoil, has complained about sexual harassment, but there are no witnesses. Obviously, there are no witnesses. And you know what the CEO, MD, all those kind of people tell me is that, how would you prove it? It's he said versus she said. No. It is she said, and he has to prove that he is not a sexual offender. So those kinds of changes in our patriarchy, and why only patriarchy, even in the thought processes of women themselves, have to come across so that we start becoming more inclusive rather than more exclusionary. I also work a lot with people with disabilities, all kinds of disabilities, whether they are learning disabilities or physical disabilities and so on. It is very difficult, let me tell you, to convince them that education is possible, skill development is possible, livelihood earning for you is possible. They have seen so much of trouble even getting into, so by the way, there are medical professionals here also. The physiotherapy clinics or the mental therapy clinics are inaccessible. Have you noticed it? I hadn't noticed it when I was not working in this field and amongst these people. But now I've started noticing all the physiotherapy clinics are in basements, having 10 steps, and people will say, "Hum utha ke rakh dete hain." Arey, what do you mean utha ke rakh dete hain? Imagine a woman sitting on a wheelchair, or grappling with some kind of, even mental issue, or in an agitated state of mind, would she like for people to pick up that wheelchair and go? No. Why are these people not being questioned? Why is their license not being questioned? That why are you setting up a system to cure people or help people when you're not set out to help them? So these are things which we have been ignoring and neglectful of for a long time. I'm glad that we are talking about it, and I'm very hopeful, very optimistic that with all of our efforts, this is going to become an inclusive country. Thank you.
Thank you for that positive statement from you. And you have also raised a very valid point that there are disadvantaged sections within the disadvantaged sections also. Women, they are at the receiving end already, but at the same time, women who come from certain backgrounds like disability, or sometimes even, small towns, if they are coming from those small towns, sometimes women who are coming from local language space, they face even more issues at the workspace or workplace. So this brings me to, since you also talked about education, and the problems start from the beginning itself when the students start studying in schools and colleges. So that brings me to Ishita ji, and I would like to ask Ishita ji as to what have been her experiences, and what could be the best practices of dealing with these kind of issues. You can use this one.
Thank you, sir. Sir, my name is Itisha, not Ishita. There's a very beautiful quote. I'm forgetting the person. So this woman said, "Give your daughters difficult names. Taki, we're not just anybody. You should consciously and deliberately speak my name." So education is a space which मैं जब घुसी मैं इसलिए नहीं घुसी क्योंकि ये लेडीज़ लोग के लिए बेस्ट प्रोफेशन माना जाता था या है. I got into education because I love teaching. I love interacting with people. I love talking to people. I love conversing with people. And over a period of time, I realized that is the most beautiful way of bringing about change in society. कॉर्पोरेट्स की हमने बात करी, वर्क प्लेसेस की हमने बात करी. मेरा ये मानना है, शायद बिकॉज मैं एजुकेशन सेक्टर से हूँ, कॉर्पोरेट से बाहर रही हूँ, that corporate does not have a lot of interest in social justice until and unless it brings profit in. That is my personal opinion. Educational spaces are supposed to be different. I disagree with the use of the word education industry. We don't make Coca-Cola bottles. We don't make products in that sense. We make human beings. So इसीलिए education एक school या एक college बहुत ही we call it temples of learning for a reason, because ये sacred जगहें हैं. और जब कभी लगता है कि यहाँ इन जगहों पे हमारे किसी भी के साथ discrimination हो या किसी भी level पे कोई bias हो तो बहुत बुरा लगता है, because हम teachers को एक अलग दर्जे पे रखते हैं, हम उनको गुरु मानते हैं, हम उनको हमारे country में गुरु शिष्य परंपरा का है. हमारे लिए every student is someone who's come to us and for education. लेकिन उसमें इस बच्चे का background क्या है, किस socio-economic class से आता है, किस caste से आता है, क्या उसका gender है, ये सब चीज़ें सिर्फ बोलना effect नहीं करती. मेरे ख्याल में उसी power dynamics पे पर्दा डालना है जो उन्हें create करता है. So there are attempts to make educational spaces bias free, but I think if you would want to, सबसे पहले मैं बोलना चाहूँ कि challenges education space में especially gender से related क्या हैं, अगर उसके लिए हमें किसी से भी पूछा है तो किसी भी एक marginalized बच्चे को किसी भी university से उठा के आप यहाँ बिठाएं, they are going to tell you what are the challenges they are experiencing. I've been a professor, and with all due respect to all the esteemed panelists for sure, but I think their voices need to be heard. मैं रिक्रूटमेंट पैनल में थी, एक प्रोफेसर यूनिवर्सिटी ऑफ दिल्ली के वाइस चांसलर सर ने मुझसे क्वेश्चन पूछा कि उसी पैनल में से क्वेश्चन पूछा कि विमेन इतनी एजुकेट हो रही हैं बट वर्कफोर्स में क्यों नहीं जा रही हैं, वाई आर देयर नो मोर विमेन विमेन इन वर्क फोर्सेस, एंड माई आंसर वॉज बिकॉज द एटीट्यूड दैट वी स्टिल होल्ड इन सोसाइटीज़ की लड़की का शादी करना, बच्चे पैदा करना ज़्यादा उसके लिए इम्पॉर्टेंट काम है, और उसका काम her other work, not that women who are working at home are not working, but to be in a work place is a hobby. It is a very challenging, I've worked with men, I've worked with women, but I've never heard a man pick up a call and say, beta kaisa hai, dawai kha li bete ne, khana kha liya usne, so gayi ya nahi. But this is something that I often see with women who are working, that they have to work like they have no family, and they have to have family like they don't work. So when we speak of gender, there is also this whole thing about एक taboo होता है, अरे आप लड़की को ज़्यादा feminist नहीं बनाना है, लड़की को ज़्यादा educate नहीं करना है, education उतनी ही चाहिए लड़की को जितनी उसकी शादी लायक काम आए, लड़के से ज़्यादा वो कमाने लग गई है, लड़की से ज़्यादा वो पढ़ने लग गई, तो वो that would not be okay for the society. So behind every successful man is a woman, of course, doing his laundry. But behind every successful woman is a mother still saying कि ये शादी क्यों नहीं करती है. So these are the things that I could say. Panels जो हमारे recruitment panels, because since something that's been happening more recently, a lot of them are male dominated. This is something that I have found, and even chairpersons of women's colleges are chairperson तो हम बोल रहे हैं, but chairmen ही है वो at the end of the day. So beyond tokenism, having women on, I find it very amazing कि why are there no more women entrepreneur, why are there's no women vice chancellor of Delhi University till date. तो जब हम इस level पे पहुँच के बोलते women कहाँ गई, I think we need to question at every level what are the different challenges girls are experiencing, what is the glass ceiling, why are they dropping out. Because otherwise, once we've reached a certain level, and say it can also become very blaming that अरे वो तो lazy हैं, they don't want to do it, they're not interested. So having honest, healthy, authentic conversations with our students, no matter what caste, class, gender category they're coming from, understanding their challenges is so much more important to develop policies that serve the students at the end of the day, the youth at the end of the day. हम टीचर्स डे सावित्री बाई फूली के बर्थडे पे नहीं मनाते हैं, हम फेमिनिस्ट डिस्कोर्स ऑफ कोर्स बात करते हैं, सेकंड सेक्स की बात करते हैं, विच इज़ रिटन बाय सिमोन डे बोवर, बट वी ऑल्सो हैड ताराबाई शिंदे राइटिंग पुरुष स्त्री तुलना, जिसकी हम बात नहीं करते हैं. So it just my opinion, मैं बहुत direct बात करती हूँ, लोग ना aggressive बोलते हैं, लेकिन मैं सिर्फ if I was a man I would just be assertive. So I have to give this disclaimer. These are my few bits on what needs to be done. We need to go back to our classrooms and talk to our students. We need to go back to our drawing boards.
Thank you, Itisha ji. So yes. So I think, yeah, it is working now. So yes, so actually we have gone through and all of these problems. We have also discussed the entire gamut of these mental health issues which are there. And Itisha ji also mentioned that, when it comes to corporates, they only take actions when there is some kind of profit involved. But nowadays I see that there is kind of a moment across the world in corporates also to recognize and acknowledge these problems internally. And I can give an example of my own organization, Microsoft, where the workforce is at this position right now that 32% of the overall workforce at Microsoft is women. Secondly, we generally talk about the programming roles, technology roles, etc. And there are not so many women in those roles, but at our place, 26% of the programming roles or engineering roles they have gone to women. So many things are happening. We are also coming up every year with a D&I report in which we publicly acknowledge these kind of data that is happening. We have a women's ERG, employee resource group, which is very active. And also we have one initiative under which people declare their own limitations or mental health issues or any disability issues, etc. So people come out on their own and they declare that, yes, I have this issue, and then the company tries to take care of that. So many companies are there, but then there is another reality that these international organizations may be at a certain level, but what about the organizations in India? What about the organizations which are starting this journey right now? So I will just, maybe I can request you all, the panelists, to please share maybe your perspective as to how this problem can be solved in corporates. What should be the right ways that the corporates can handle with these problems in a better way?
Mr. Sharma, I'll have to interrupt. As Itisha said, इसके बाद students ने बोलना है और उनके लिए time चाहिए. तो आप लोग बस एक sentence में sum up करेंगे. Thank you very much.
One suggestion each. Any way that we can create a strategy or somehow, yeah. How can we handle?
So I think the only way to handle is to focus on individual capabilities and not the the characteristic which sets you apart. In case of a woman, being a woman sets you apart. In case of a disabled, being a disabled sets you apart. In case of being a mental health affected person, that sets you apart. Instead of that, while going for education, while going for livelihood, if one could just focus on the ability, you as a person, that in itself is going to make a sea change, is what I feel.
I think I just echo what Alka ma'am said just now. I think one step is awareness, second is education, and third is a practice. Events like this will help spread the awareness. Events like what we experimented with, as I said, a course, and I'm a corporate trainer. I've already started giving training on happiness, and there's an excellent response I'm getting from corporates. So if we can start building those up, maybe small baby steps, it will go a long way, because the issue with mental health, as I look at, is there are a lot of taboos attached with it. Seeking help, going out to doctor itself is a big taboo. A lot of issues, problems are there. So that's why I said if we can tackle it at the initial stage itself, it can do wonders. And that is where we need a lot of therapists, a lot of counselors, not necessarily doctors.
Itisha, I think you will take the challenge better. One sentence.
Agency, choice, and dignity. In all settings, family, workplaces, educational spheres, organizations, agency, choice, and dignity of human beings.
Thank you. Thank you so much. I know we all feel so passionately and we can go on and on, but we have to keep time in mind. So thank you so much, this panel. And Vivek, please come and felicitate the panel.
Now we will have another awards segment. To give away the awards, I would like to invite to the stage Mr. Rajat Garg, founder of My Upchar, and Shri Kumar Shailendra, famous poet and writer as well as advisory board member of Bharat Dialogues. We will be starting with the commemorative awards for individuals. First up, the award for remarkable author goes to Miss Aparna Piramal Raje for Chemical Khichdi. Next, we have the award for Best Facilitation of Support Groups, which goes to Miss Shrinkla Sahai.
I saw her around. Can the volunteers please check if she's still around? Next one, please.
The next award for Best Use of Traditional Classroom for Mental Health Literacy goes to Dr. Itasha Nagar. Our next award is Best Radio Program for Mental Health Awareness, which goes to Miss Divya Vasudev.
The program is called Take It Easy. So please listen to it if you haven't.
I like it.
Yeah.
माइक होने के बाद भी माइक मिला नहीं है इसलिए 10 सेकंड लेके जाऊंगी द शो इज कॉल्ड टेक इट इजी एवरी डे एट 11 o'clock ऑन रेडियो सिटी और कल मैंने एक एक्टिविटी की थी व्हेन आई आस्क्ड पीपल व्हाट इज द कोट एंड आई थिंक मोस्ट ऑफ द वुमेन सेड टेक इट इजी एंड हम ही भूल जाते हैं सो प्लीज टेक इट इजी
Next, we have Best Young Crusader for Empowerment of Communities, which goes to Miss Shweta Goswami. Next up, we have Best Life Coach Inclusive Education, which goes to Miss Neena Gulabni.
Ma'am, please आइए. Ma'am, surprise भी देना चाहिए. Surprise भी देना बनता है थोड़ा.
The award for Best Young Crusader for Empowerment of Communities goes to Ms. Shweta Goswami. Our next award is Best Reporter for Mental Health TV, which goes to Mr. Nitendra Singh.
Doordarshan, please clap.
I would like to invite Ms. Shrinkla Sahai to accept her award for Best Facilitation of Support Groups. Next, we have Inspirational Changemaker in Media, which next we have Innovative Women Mental Health Practitioner, which goes to Miss Riddhi Doshi.
Yeah, she runs a very interesting group called Laja, but she's not here today, and we'll send her award across.
Our next category is for the competitive awards.
So competitive awards are the ones that the jury has judged. Ma'am is here, a few other people are here. And we had very few entries, and they were, there was a jury, they had a process. Ma'am can tell better, but already Dr. Bohra spoke about it in the morning. And we have only 4 people who qualified, so congratulations to them. And now I'll hand it over to Kavya to announce.
So the first award is Game Changers of Mental Health Organization, which goes to Nirvan Hospital Private Limited.
Someone here from Lucknow for Nirvan Hospital? Okay, next.
Next, Mental Health Social Entrepreneur of the Year, which goes to Dr. Saima Furkan. Then we have Best Educator in Mental Health, which goes to Dr. Sukanya Biswas.
She's a wonderful practitioner based in Mumbai. I don't think she was able to make it today, but yeah, she's doing a lot of good work. Look her up on Google.
Lastly, we have Best Mental Health Blogger, Sanity Daily, Miss Priyanka Joshi.
Priyanka again is in UK, won't be coming today, but please look up all these names. They are doing amazing work in mental health.
Congratulations to all the awardees. Now we will be taking a short tea break, and we will be resuming in 15 minutes.
And please make it only 15 minutes. After that, we have a session where there'll be lived experience sharing, and mostly by students, chaired by our jury member, Miss Meera Chaudhary. So please be back in 15 minutes. Thank you. Thank you, Babuji.
check, check, check.
आपका lanyard भी green है ना? Lanyard भी green. That's how it was color coded. सबको थोड़ा बुलाएंगे बच्चे last task please. और आगे बिठा देंगे. So this is the absolute last session. It was supposed to start about 20 minutes earlier, but we are going to start now. And this, I think, is the most important session today. Unfortunately, most important sessions जो सुबह था और लास्ट में है उसमें ही लोग कम होते हैं. But ठीक है, जितने लोग हैं उनकी आवाज़ पहुंचनी चाहिए. And that is what we are going to do right now. This is a lived experience sharing session. It will be chaired by Ms. Meera Chaudhary, who is a filmmaker, documentary filmmaker, who will be chairing this, along with Dr. Shruti Srivastava from IBAS, who was supposed to be on the last panel but reached us late, Delhi traffic. So both of them will chair this session, and a few students are going to share their lived experiences. I invite the guests onto the stage, please. Also, I'll have to felicitate Meera because she came late, so her jury felicitation, please. So we'll begin with you, Meera, and then ma'am, and then we will announce, Kavya will announce the students. They will come up one by one. Also, this is lived experience sharing. Again, we've not edited anything that they've written or say. There could be things pertaining to self-harm, suicide, abuse. Please use your discretion. If it triggers you, please step out. There are practitioners around who can help you if it upsets you too much. Yeah. Meera. वहीं से बोलना है अब वहाँ से भी बोल सकती हैं कंफर्टेबल जैसे है आपको यहाँ है या वहाँ है
First of all, thank you, Pooja and Vivek, for having me here, and congratulations to Team Bharat Dialogues for conducting this important conversation so beautifully, very well managed, and thank you to the audiences who turned up to be a part of this discussion. Well, as she said that I'm a filmmaker. I became filmmaker very late in my life, and I realized that my first role, most important role in my life, I realized very late after watching the black film. After seeing the role of Amitabh Bachchan in that, and I realized, ooh, I've done something in my life. And later on, I was given a formal word, the term of caregiver. So my brother is a special child. He's having a 98% disability, a miracle baby of India. When he was born, he was just 5 months, 23 days old. And he's also my first guru in life, who taught me to be empathetic, how to give unconditional love. So I feel very lucky that I learned about what is unconditional love, because when I see parents, when I see siblings, when I see friends, when I see all the peers around me, where I worked in school also, I felt we always expected something from each other. Teachers expecting students to excel, mothers expecting, although they give a lot of love to their kids, but can we categorize it in unconditional love, because parents expect a lot from their kids. If in today's world they are having only one kid and giving everything and all of their resources, they're investing in their one kid and claiming that they love their kid, but at the same time, the kid has to excel in each and every field. You have to be a good singer, you have to be a good player, you have to do well in studies and all that. Anyways, so I learned my lesson of unconditional love. I had my brother, the first guru, with me, who is a very happy child. So I have had a very challenging childhood, I would say. I have seen the challenges of bringing up a special kid in your house. I have seen the challenges that my mother also faced. I'm from a Jat family belonging to... आवाज़ आ रही है? ऐसे? Okay. So I belong to a family of Jats from Muzaffarnagar, and coming from a patriarchal land. And I have seen how much my mother have gone through in fighting for the rights of her 2 daughters and then 1 disabled son. So the childhood was good when it comes to memories of playing with my brother, learning from him, teaching him, and but when it comes to seeing the society's perspective, how they perceive us, how they perceive 2 daughters and 1 son who is disabled, I always felt like there is something wrong. So I feel that there are many challenges, there are many pressures from our society, which we were coping up as a family, Now, what happened 10 years back, that a very unfortunate incident happened in my life. And finally, it was, I would say, it was a final hit on the nail, you know. And I was diagnosed with the traumatic depression. I was living happy life. I was very happy. I was doing what I liked. I started making films. And so I was diagnosed with the traumatic depression. And I could not understand like what was happening with me. My symptoms were low BP, fatigue. I'm still living with fatigue. I walked out of the room twice or thrice, washed my face to come out of that fatigueness. I just had a coffee. So how's my life in the past 10 years? It's completely changed. First thing I would say that over a period of time, you know, the moment I came to know that I have this issue, I thought that I said, thanks to my psychiatrist, I said that, doctor, now I will take care of myself. I'm diagnosed with traumatic depression. Now I will not take stress and I will look after myself. So I worked on myself for a year or two and I failed. So people who say stress mat lo, ये मत करो, आप स्ट्रेस बहुत ज़्यादा लेते हो, तो वो स्ट्रेस ना लेने का डिसीजन मैंने तभी ले लिया था. आई एम नोन एज द मोस्ट cheerful person. If you ask my friends, if you ask Pooja, we always laugh. Whenever we meet, we just laugh. So ये जो एक कहा जाता है कि आप स्ट्रेस बहुत लेते हो, बट आई वॉन्ट टू डिफ्रेंशिएट इट लाइक सफरिंग इज़ द रियलिटी ऑफ लाइफ. स्ट्रेस हर किसी की ज़िंदगी में है, लेकिन ये लोग डिप्रेशन और स्ट्रेस को डिफ्रेंशिएट करना बहुत ज़रूरी है कि कब आपका स्ट्रेस जो है वो डिप्रेशन में बदल जाता है. सो it's like a disabling factor in your life. Depression means it started affecting your normal lifestyle. तो मेरी normal lifestyle जो है इतनी ज़्यादा affect हुई that I worked, I earned most of my bread and butter during depression. But at one point of time in 2019, my condition was such that I could not concentrate. My condition became very severe. And since 2019, I'm not able to write any funding proposals. I stopped checking my mails. I stopped calling my clients. In every event like this, when I used to meet my clients, I said, Meera, आप बहुत lazy हो. आप हमेशा कहते हो आप लिखोगे, but you never write to us. What is this? So at that point of time, when I started seeing that people have started judging me for being lazy, I started telling them outrightly, look, I'm suffering from depression. I have a problem of fatigue. I'm sorry, I've become forgetful. So I think जो empathy का जो मेरे भाई ने मुझे एक सिखाया, being empathetic, like we understood his issues, he understood us, that we both are different and how we can communicate with each other. ये जो understanding जो develop हुई, उसकी implementation मैंने खुद अपनी life में at around 40, I'm 44 now, so at the age of 40, मैंने उसको खुद implement करना शुरू किया. I became more empathetic towards myself. I became more kind towards myself. I gave myself a lot of time, and I proudly say that I work at snail pace. I completely changed my lifestyle. I adopted simplicity. अगर मैं बहुत ज़्यादा कमा नहीं रही हूँ, तो मैंने अपने खर्चे बहुत कम कर दिए. If I don't have to go to any place in emergency, I started traveling by trains. And yes, ये मैं मानती हूँ कि I am coming from a bit of privileged background, but still I faced a lot of challenges and still I'm facing it. Still my parents say, इसका कुछ नहीं होने वाला. When I tell them that I'm going to speak about mental health, they say, आपको क्या होगा mental health से? Tell me how much you are earning. So, but there was one panelist who said that we have to keep hope, the one who wrote the book, Chemical Khichdi, yes. So the hope is keeping me alive, and I learned Okay, I'll take just 30 seconds. First thing is that I accepted that I have mental health issues. These are my conditions, and this is how I have to work on it. Second thing, I stopped expecting from my society, from my parents, from my friends to understand me. Third thing is that I started meeting those like-minded people, sharing my grief, my understanding, my life with the like-minded people. And I must say, I'm so thankful to my friend. Huge shout out to all my friends who understood me and gave me a lot of support. Apart from that, I'm on a regular medication. And yeah, one more good news. If tomorrow you're coming to this, I'm taking the opportunity to talk about my upcoming film. There's a film festival going on at IIC in the same premises. It's Indian Women in Radio and Television, and my comeback film, short documentary, is selected to be screened in this space. So tomorrow there is a screening at 5 o'clock at C.D. Deshmukh Auditorium. So I think it's just a comeback, and then I'll start flying again. Thank you, and would love to listen to more such stories. मुझे लगता है कि अगर इन आवाज़ों का अगर हम नहीं सुनेंगे तो ये जो आगाज़ है वो अधूरा रह जाएगा. Thank you, Pooja.
Thank you, Meera. Dr. Shruti was supposed to be on the last panel, but she's come late. And being a practitioner, I think she has also been on the other side of the table, listening to a lot of lived experiences. So please throw a little light on the importance of sharing lived experiences and validating them as practitioners for us.
Indeed, it has been a pleasure for me to come and give you all a big smile on International Women's Day, and thanks to Bharat Dialogues and Pooja ma'am for organizing this lovely occasion. I was expecting yesterday that today will be a government holiday, so I could have joined right from the morning, but it didn't turn out to be that. And apologies for being late for the show. We have recently done a national seminar for working women. That was both webinar as well as it was a live, as well as it was done on a hybrid mode. So where we had around 380, 400 delegates, working women who joined. So like what ma'am is sharing, I also have some live experience to share. My mother always used to ask me that when I was just doing my internship, what branch you would like to take. So when I told her I would like to take psychiatry, so she said, she was, you know, a bit shocked. She said, how will you manage? But you have to manage yourself also. You will be listening to so many people coming, sharing their sorrows, sharing their grief, somebody becoming this, aggressive. How will you handle? You are not, you just as ma'am said, I am also from a privileged background. So how will you, because we've been raised in a nuclear family and with low social supports and all. And so how would you cope up? So now something that I want to share with you is that when I'm doing a therapy or when I'm listening to someone, then I do it as a mental task, as a mental activity, and I do try and give the best I can to help the client. But once I am at my own ease, like I'm at my own ease here, I've come to listen, share experiences. It's a new environment. I'm not here as a therapist or anything. So here I am as my usual self. So that is how one needs to be, right? That is how one needs to be. When you are working, then you have certain cognitive tasks, and your memory, attention, executive functions, your concentration, your learning abilities, they all get sharpened this way only. And that's what you need to do in a routine day-to-day practice. As ma'am has pointed out, She is now focusing on the task that she enjoys doing. She's now doing a task which she wishes to do, and she can focus in spite of the fact that she is suffering from depressive disorder. So the key to come out of this all this is pick up something which is passionate. She called me up and I was so passionate. I said, no, this is the event I should go. There was another International Women's Day being celebration happening there. So that wish and that motivation in whatever task that gives you pleasure, in whatever task that gives you pleasure, be it for an hour, be it for half an hour, be it just gardening, be it just planting trees, be it preparing a documentary, writing a poem, dance, drama, whatever. And the list is endless. Pick up something which gives you your inner happiness. And that's the way how you can cope up. That's one of the very, very big essence. And that is the traditional psychotherapy, that do something which gives you enjoyment, which gives you peace, which gives you happiness at the end of the day. And do it every day. Do it on an everyday basis. No, it's not, if you like dancing, take a break, half an hour, 40 minutes, put on a music and dance. No issues. And that should give you happiness. And when you do this, then you feel internally happy. So we chemically also explain this. Neurobiological studies have also explained this. The chemicals, endorphins are released. And they are more potent than any of the antidepressant drugs that one takes. So, and this sort of positive energy, it translates on. It goes on in every step forward. It goes on in every step forward that you take in life. So it may be a half an hour task, but this half an hour task will help you boost memory, will give you relaxation, will give you the energy to come out of all these things, and will inculcate positivity in you. So that's the purpose, that you should be positive. So students are also there to share their experiences.
Thank you, ma'am. Thank you for sharing that. And all the open mic students, I would wish you to come in front, please. Debishi, can that be coordinated? Yeah.
So thank you so much, Ms. Meera, Dr. Shruti, for sharing your experiences. Now we will be hearing from some of our audience members. I request all the people who are sharing their experiences, because of a paucity of time, we will only be able to have a limit of 3 minutes. So we will be putting a timer, after which you will have 30 seconds or so to wrap up. So we will start with Navya.
Also on our website, those of who share here and give us consent, so the content will be up there as well for you to read.
Hello everyone. So I'm not much of a public speaker, and this is the first time I'm dealing with such a big audience. So I'm gonna read my thoughts out from my phone. Thank you so much. So I'll be reading it out from my phone so that I can articulate everything better. So let's just get into it. I'm Navya Dang, and since the past 8 years or so, life has felt very dark. I have struggled with mental health issues since I can remember. It's very hard to tell when people see me because I'm high functioning, but that does not mean that I'm not struggling. So I'm here to share something which I've never, ever done in public, but I think it's time. Also, I thought that this is a safe space, so here I go. So I used to self-harm. I'm a former self-harmer. I used to hurt myself whenever I used to feel angry, hurt, sad, disappointed. I feel like not enough people talk about self-harm, especially in India, where it's a very touchy subject. Because all I can say is people think that in India, self-harm means that you are cutting your wrist to attract your love partner. That's what they say when you talk about self-harming. That's what they think about it. So when I used to hurt myself, I used to search online to find others going through the same thing to feel less alone, of course, but I couldn't find any Indians or Asians sharing their experiences. I've always wanted to talk about it, but just didn't have enough guts because of what people would say, my classic log kya kahenge moment. And this is the first step that I'm trying to take towards this long journey, and I couldn't find a perfect moment. So to share some lived experiences as well, I was a child when I started self-harming, and something which used to crush me every single day was whenever I used to try to share it with someone, they either used to make fun of me, scold me, or dismiss what I was sharing. This was literally a call for help, but no one helped. One of my teachers in school got to know that I self-harm, and on the day of PTM, she told my mom that how it will be difficult for me to get married and maybe even find a job. And I wonder if the same thing was told to a boy who was self-harming in my batch. And it just surprises me how she didn't care about how it can harm me or even kill me, but cared more about how meri shaadi nahi hogi. So in school, there were so many rumors around me saying that how I cut my wrist to attract boys. I was slut shamed for it. Few comments which I get to hear every single day, even now, since now I do not hide away from showing my scars, are, to quote, ये हाथ किसके लिए काट रखा है? ये हाथ पे कलाकारियाँ क्यों कर रखी हैं? You ruined your hand in the name of mental health. ये किस लड़के के लिए हाथ काटा है? Etc. etc. I have worn full-sleeved clothes in peak summers for 4 years. And now that I've finally accepted my scars and I'm finally comfortable in wearing half-sleeve clothes, these are the remarks I get. Conversations around mental health have started, but these conversations only cater to a certain picture of what mental health should be like and not what actually is, which includes not being able to do simple tasks like cleaning yourself or getting out of bed or even self-harm too. People really need to understand that if a person is self-harming, that doesn't mean they're weak. That just simply means that they are in deep, deep pain and it's just a silent call for help. So, there are lakhs of other kids out there who need me. They need you all. Those kids need to know that they do not need to turn to blades or lighters to get help. I feel the need to be there for all of them. And I really hope I get support from all of you helping me help them. मुझसे बहुत लोग पूछते हैं if I regret self-harming or if I regret ruining my body with scars and how it was an immature or kiddish thing to do. All I want to say is that no, I do not regret it. It has made me the person I am today, who is sensitive, kind, and empathetic. I hope I'm able to make the 13-year-old Navya a little bit proud, who only and only needed love, care, and affection. And that's what all the other self-harmers need too. Just a second, ma'am, just please. And since it's Women's Day, I'd also like to take a moment to show gratitude to a woman who's present here, Dr. Ritisha Nagar. She is my biggest inspiration, and she unknowingly gave me the courage to stand here and speak about all of this. When people made me think that my sensitivity is my weakness, she helped me understand how it's my biggest strength. It's like she became the Amir Khan to my Ishan Awasthi from Tare Zameen Par. I have been in complete denial since I've gotten to know that she will not be my professor anymore. Since just having her around in college also used to provide me with so much comfort. So thank you so much, ma'am. Here I am finally accepting that this change will only help you grow for the better and help even more people like you helped me. So ending it on a cheesy note, like one of the quotes says, to love is to let go. So Itisha ma'am, I love you and I let you go. Thank you, everyone.
We are very proud of you, Navya. And we are very proud that you're part of Bharat Dialogues now. Thank you, Itisha, for sharing this wonderful child with us. Thank you.
Who's next? Thank you so much, Navya, for sharing your experiences with us. Now I would like to call Sonal to come up on the stage and share her experiences.
All right, so I was just listening to Navya, and Navya, I love you, bhai. Okay, so hi everybody, I'm Sonal, And like Navya, I'm also a student of Itasha ma'am. And the poem which I have written is basically what every girl's soul yearns for. And I wrote this back in class 11th when I was frustrated by everything. And like ma'am just quoted, कि behind every successful woman, there is also a mother जो बोलती है कि शादी नहीं कर रहे. So this is something with my mother also that I feel कि अरे मैं रोज़ मेहनत कर रही हूँ, मम्मी मेरे को बोलती है कि भाई तू मोटी हो गई है, तेरे से कोई लड़का शादी नहीं करेगा. So this is a reflection, the poem which I have written is all about the lived experiences of mine, and I'm sure that everybody would be able to resonate with it. So here I start. छोटे से बड़ी हुई, घर में सबने एक एक कर डांटा, वो तो लड़का है, उसका कुछ नहीं जाता. झोल तो सारा यही है कि लड़के सोचते हैं, इसमें तेरा घाटा, मेरा कुछ नहीं जाता. मैं हूँ जो तुम्हें सताता, पर मेरा कौन क्या ही बिगाड़ पाता. Living in a world where my every action is judged by the society. If I tend to live my life according to my rules, I'm characterized daily. Periods के बारे में किसी को कुछ नहीं बताना. क्यों पूछा तो बोलते हैं, ए लड़की तुम्हें अपना मजाक है बनवाना. For women to bleed, it's the world's need. It's not my shame, it's my fame. Men cannot bleed whole night to judge women who gave them the right. If I don't carry my sanitary pad in a black polythene, who am I to be blamed? गलती तुम्हारी है, तुम अपने आप को नहीं बदलना चाहते. थोड़ा धीरे बोलो, थोड़ा कम हंसो. रिलेटिव्स आ रहे हैं, शॉर्ट्स में मत घूमो. वाइट स्कूल शर्ट के साथ भी इतनी गर्मी में स्लिप पहनो. स्कर्ट इतनी छोटी है, लड़कों की अटेंशन चाहिए क्या? मैं सोचती हूँ आंटी आप अपने काम से काम नहीं रख सकती क्या? What I want to wear is my choice. Whom is the society to whom I should explain what I like? For that, it's my life, my rule, not theirs. I'm tired of saying that I should not care about what they say. But in the first place, I wonder who are they to say? बहुत हो गया ये बोलना कि कुछ तो लोग कहेंगे, लोगों का काम है कहना. क्या अब लोग मुझे बताएंगे कि मुझे कैसे है रहना? चाहे मैं मिनी स्कर्ट पहनूं या साड़ी, हूँ तो मैं भी इस देश की नारी. अच्छे घर की लड़कियां रात को घर से बाहर नहीं घूमती. कह क्यों नहीं देते कि बेटा लोगों की नीयत साफ नहीं है ऑनेस्टली. फ्रेंड घर पर ड्रॉप करे तो गुप्ता जी की लड़की हाथ से निकल गई, ये टीवी सीरियल वाली आंटी को बोलना शुरू है हो जाता, और मुझे उनमें सिर्फ उनका इंटरनलाइज्ड मिसोजिनी ही नजर आता. Today, when I'm showing you this mirror, again some people will drag me into this judgmental gutter. I don't understand. Why do people have to be like those people who today criticized in our history textbooks? देखो बेटा, चेंज तो लाना पड़ेगा, और तुम नहीं सुधरोगे तो हमें तो सुधारना ही पड़ेगा. क्योंकि जिस देश में हम रह रहे हैं, हियर इट, क्योंकि जिस देश में हम रह रहे हैं वहाँ लड़का सेक्स करे तो है वो स्लट, पर लड़की करे तो है वो स्लट. I wonder where the hell is my hug, or my sexuality is just my luck. For that, I'm tired of being judged and letting my independence crushed. I'm not going to change because I'm totally normal. It's your mindset that's abnormal. Thank you.
Thank you, Sonal. I see so much of me in all of these girls, and it is very heartwarming. Thank you.
Thank you so much. Now I would like to call Arshdeep Kaur Marwa.
Hello everyone, I'm Arshdeep and I'll be sharing something very close to my heart today. Bear with me please, I might stutter, I'm feeling very nervous right now. So here it goes. Days turn to weeks and weeks to months, but I have been on an edge throughout 2023 to not make it a year. I have somewhat made my peace with the fact that my gap year might surpass 12 months and that won't be the end of me. I'm tired of being my biggest enemy. I'm tired of holding myself back, tired of not speaking up, tired of suppressing and staying quiet to keep things peaceful and comfortable, but for whom? I haven't even been trying to get a job thinking what's even the point, let's just stop the cycle for once and for all. But I don't really want to. The next time I feel like the pain is too much to bear and the struggle to breathe is too much that it's better to not breathe at all, I'll remind myself that I don't essentially want that. I just want the pain, the hollowness, the heaviness, the restlessness, the mood irregularities, the guilt, the self-doubt turning into self-hatred to stop. I want to stop bullying myself. I'm scared. terrified that maybe I'm not fully out of the danger yet, but I'm beginning to understand that I might never fully be. However, I can't let this emptiness and inertia be a destination. I want to move. I want to flail around. And I want to experience all the things that every 20-year-old something does. Be it heartbreaks, be it failure, making mistakes, having ambitions, having goals, and the likes that I have been absolutely terrified of. What's the worst that could happen really? Dear God, it's not a challenge. Please don't test me more. I still have no clue what I want to do professionally or who I am, but I know it's time to get into action and not wait around for all the answers just to be able to start. They'll come to me with time. Now the face is dry and my eyes and headache so much. I'm so tired of crying. No, I don't discourage crying at all. Quite the contrary, actually. But crying hangover is real, that no one really talks about. When you cry as often as I do and as much as I do, you start feeling pathetic. But that isn't the truth now, is it? When there is so much bottled inside, the least that I can do for myself is to release some of it. I'm so tired of my brain telling me that I'm making everything up, that life is not as tough and as complicated as it seems to me, who's at fault for making it to be. I'm exhausted, but I'm not giving up yet, not anytime soon. Thank you.
Thank you so much. These are difficult words to read, trust me. Other than those of us who are addicted to the stage since childhood, मैं समझती हूँ यहाँ खड़े होना कितना मुश्किल है और बोलना जो एक्सपीरियंस किया है. So thank you so much.
Thank you, Arshdeep. Now I would like to invite to the stage Sanchita Sinha.
Hello everyone, I am Sanchita Sinha, and today I stand before you with a poem that's deeply personal yet very incredibly important to share. So for too long I have been imprisoned by the chains of my own mind, consumed by the thoughts of food, weight and body shame. I am here to talk about the journey towards recovery from an eating disorder that began with anorexia and has since developed into a struggle with binge eating disorder. So I have danced on the razor's edge between starvation to excess and denial to indulgence. And I'm just here to break the silence of eating disorders because they thrive in silence, in secrecy, and I'm here to share this poem with you today. In the shadows of the mind, our silent war does wage. Between desires and fears, a tumultuous stage. Anorexia whispers, shrink, vanish into air, while binge eating pleads, indulge, for nothing's fair. In the mirror's cruel gaze, a distorted reflection lies, a battlefield of insecurities, where truth often dies. Bones protrude like fragile branches, craving to be free, while the abyss of binging becomes a bottomless sea. With each bite, a whisper, a temporary solace found, but the echoes of guilt, they resound and resound. In the depths of longing, in the caverns of despair, binging's relentless pull, a weight too heavy to bear. The scales of self-worth, they teeter and they tilt, as the mind battles demons, consumed by guilt. A fragile dance of restraint, a dance of fleeting control, yet in the shadows lurks binging, with its relentless toll. But within its turmoil, a flicker of hope does glow, a desire for healing, for the soul to grow. Through the labyrinth's twist and the darkness embrace, a journey of self-discovery, a path to grace. With each stumble, each falter, a lesson learned anew, for strength lies in resilience, in courage to pursue. Though the road may be rocky and the journey long and steep, hope whispers of a future where the soul may find its keep. Thank you.
Can somebody get me water? You okay? Get her water. So this session, as I said, is the most important session. And this needs to be heard. ये हमारे बच्चे हैं. ये कहीं और से नहीं आए हैं. इनके लिए safe space नहीं है. And that is what I want you all to take back from today.
Thank you so much, Sanchita. Now I would like to call Abhisha Gulati to share the experiences.
Yeah, can somebody? Somebody be with her, okay? Please come.
I'm scared. I'm petrified. I am standing here on a stage after 1.5 years with 101 fever and on my periods. But you know what fear reminds me of? And all of these things also. Womanhood. And you know what womanhood reminds me of? Acceptance, resilience, and empowerment. So, with all these ideas in my mind, I was going on this road. This road which was very hopeful in the beginning. But with time, I felt extremely, I don't know what's the word. Just understand. I felt something very, I think I felt some sort of angst. And that led me to write this poem. Why I want a refund on womanhood from God. Like I want to write an email to God and say that, dear God, this is not working very well. Give me a refund. Why I want a refund on womanhood from God. I want a refund on womanhood from every God that has existed, exists, or claims to exist. And trust me, I want a full one with not a person excluded. Because this is not what I had signed up for. Because with this 24-carat gold label of womanhood tied to my neck like a dog leash, I can't breathe anymore. I can't breathe a second more than it takes. I can't breathe a second more than it takes the men in my neighborhood to bury a girl child to her bones in the very soil they sing Jai Hind to. I want a refund on womanhood from God because when I was born in a pink blanket with silver piles gifted by my dadi and my nani, no one told me. No one told me that I'm coming into a world where women are unsafe in women colleges, where the voices of women convolute into a black hole that is too far from reach. Where only the mermaids who are clever enough not to exist and have spaces between their legs aren't raped. Trigger warning. I want a full refund on womanhood from God because I was tricked. I was tricked by my elders like my mom who dressed me every morning in a knee-length skirt and my teacher who checked whether the size of my nails was shorter than the self-control of the boys in my class. I want a refund on womanhood from God, because I was tricked into thinking, that if I behaved like a good girl and did everything I was told, everything will be all right. I want a full refund on womanhood from God, because with Rumi in my eyes, crying for the ransom of respect, love, glory, and power, and the secret recipe of the battle I'm surviving every day, I feel lost. I feel shattered. I feel scared. And I feel alone. I feel everything I wouldn't have if I were a man. And I feel that it's very important for me to accept it and to stand again on my feet and live this life that I have been subscribed to. Thank you so much.
As they famously say, I would like to believe God is a woman, but needs a lot of unlearning in internalized patriarchy. So thank you for speaking with your heart. I'm so proud of my girls. And Bharat Dialogues, I'm so grateful to Vivek and Elise, all the men here, Ankit, I can see so many of you, Sujit, all of you who've empowered these voices here today, and all my girls especially. So thank you for adding your voices here. Let's have a picture. Yeah. So with that, I will thank you, dear friend Meera and Dr. Shruti, for sitting here, chairing this, sharing. Please add. Yeah.
See, I just want to share that whosoever feels too distressed, you can message me. I am Dr. Shruti Srivastav, Director Professor, Department of Psychiatry at UCMS, University College of Medical Sciences and Guru Tegh Bahadur Hospital. My mobile number, official mobile number, 9625900583. And I again repeat, 9625900583. You can do a text message if you are feeling distressed. Our outpatient clinic is open on all 6 working days and it is free of cost. Other than that, the students can of Delhi University, I'm there on the Delhi University mental health team for telecounseling. My email ID is also available on the DU website, Srivastava, SRIVASTAVA Srivastava _Shruti, SHRUTI Shruti @hotmail.com. Thanks. Indeed a very live experiences. It was very good of students to come forward and share their life experiences. But at the same time, I will ask Bharat Dialogues not to put it on the public domain, because there are confidentiality issues. If the students give their consent, still.
Ma'am, the students are all adults and their consent will be sought, only then it will be posted. So with that, I thank everyone who is here. Thank you for being patient with us. I need to first thank Vivek for doing what he's been doing for the last 2 months, leaving all the other assignments pending. Also my core team, the sponsors of course have been thanked in the morning, and they've been thanked enough for whatever contribution they have made. I'm not going to list them. Please check our social media, who have been our friends throughout, our partners. I would like to thank my team. Ashima, I want to see you in the hall. She has been with us. Debishi, Nikki, constantly working, responding to midnight messages. I love you. Kavya here, who held the fort, really. Sant there, holding the tech font. Riddhi here. Sujit, Abhinav, Shweta, Ankit, I cannot thank you enough. Pintu, Devansh, boys who've been doing so much pre-event work. All of my volunteers, Navya was doing all the recordings throughout the day. I hope each one of you will carry a worthy memory from today. The staff at IIC, friends, we have a hashtag called People of WMHSA. This is the culmination of 25 years of a journey in mental health, and we will take it forward. With that, I would like to thank each one of you who is here today in whatever role, my volunteers who've been amazing, some of them fasting, just having fruit, but nevertheless doing their work. Thank you, each one of you. I'm so humbled that all of you have put your force behind this idea, this maverick idea of getting everybody together. Thank you so much. And I want all the volunteers and the Bharat Dialogues team to come up for a group picture, please. And the others can also join if they wish to stay longer. All the volunteers and the team, please. You can clap for us, people, please. It feels nice.
Sujit, Sant, please come here. Abhinav. Abhishek, Kallol, please come on the stage. Sushant, please join us. Babuji. आकांक्षा कहाँ है आकांक्षा आकांक्षा कहाँ है
आप बताएंगे सब आ रहे हैं
नहीं इधर आया नीचे कहाँ
कौन नीचे आ रहा है ठीक है
Okay. No, say mental health.
Thank you.